It's Mark Pires.
I was walking
and it's real talk.
today, looking for another way
To ease my mind
my living.
and help my living. It's real talk. It's the daily variety show, Mark Pires Real Talk. I'm here to connect with you, to amplify your current state, and I'm here with you on day 617 in a row of the Mark Pires Real Talk show. That's right, and we're about to get into it. I'm talking about another trip around the world with Dr. Richard M. Fleming. We're going to get into the coronavirus, or should we call it the conronavirus? We call it the plandemic. I don't know, a lot of that stuff going on right now, guys. And we're going to get into it. So let me get over to the Zoom channel and see if we can bring in Dr. Fleming. Dr. Fleming, are you with us? Let's see. Dr. Fleming, I'm about to share my video. There he is. I'm just going to ask him to start and join, and we should have him momentarily. Dr. Fleming.
Hello, how are you?
I'm great. How are you? It is so good to see you.
Doing well. Happy Labor Day.
Happy Labor Day. Look at us not taking the time off like we should. I'm excited to talk to you. I mean, every time I get you on, this is great. But a lot of stuff I've just been hearing this past week, and I know we're here to discuss the vaccine and the point of it. There's a little piece of information that I came across yesterday, and you may have seen this. I don't even know if it affects our conversation at all, to be honest, but I don't know if it was World Bank. The World Bank, I believe, had documentation on where they had put their money, what they spent money on, and in 2017, every country on the planet purchased COVID-19 test kits, which was very interesting. And they showed how much each country spent, how many tests they purchased. And then it said something interesting at the bottom. It said, it's not experiment, it said Project X estimated start date, April 2nd, 2020, which is interesting because Trump closed the economy on March 23rd, which is pretty close. And then it said the completion date for this project is March 31st, 2025. So the question is, we know this is planned, obviously. So much is starting to come together here. But if they were buying kits in 2017 for something that they released in 2019, and they called it COVID-19 back in 2017, there's a lot of really weird stuff going on. Apparently today they changed all the data to just say test kits. So they took off the COVID-19 because they knew that this got out there, people found it, and now they're changing the data. Did you hear anything about it?
Yes, I think I've seen the same stuff on social media as other people. I've had folks ask me about it. My one response right off the bat was I was only seeing part of an initial face sheet of what was being proposed. I was not seeing the full document to know what it is. I had a very interesting 2.5-hour debate this morning with Robert Young on terrain versus germ theory. And, hopefully that's something that's going to be released on Transparent Media on Wednesday, because It was done today, and hopefully it will be released. But one of the comments that I was trying to bring up in the and it was a hot debate. It was not a friendly, nice.
It didn't
polite,
stay calm.
I'm sorry?
It did not stay calm and cool and relaxed.
It did not. And, I'm not, I've always told people that you can blame my parents or my grandparents for that, because my grandparents, I remember my grandfather standing on the street in this town where my grandparents lived, and somebody came up to him, and my grandparents were civil people, but the guy was telling him something that simply wasn't true, and my grandfather just simply said, "Stop lying. Stop lying. I know you're lying. Stop lying." You can't have lying is not involved in a civil debate, and there's so much misinformation or misrepresentation of stuff that we've gotten to the place right now where it's critical that we address the reality of what truly is going on if we're going to solve problems. So why is that applicable? We've talked briefly on this program already before that SARS and MERS from the early 2000s, 2002, 2007 era were coronaviruses that were they're viruses from outside the human body that you have to accept are real viruses that have been manipulated. We have touched on briefly the fact that this last go round of this virus is clearly manipulated at least twice, not naturally, but by human intervention. So you have to throw out this misinformation about a terrain, it starts in the body, it's part of the body nonsense if you're going to get to the crux of the issue and what we're talking about. This document that you just stated is further demonstration of this virus being known about, being worked about. It is not something coming from inside human beings artificially being made. This is a man-made or woman-made or possibly both virus that they knew about, that they knew had increased infectivity. The fact that it's killing the people because of the inflammothrombotic response was just something I think they did not predict how well that would work, but they were clearly doing this in advance. And anything that suggests that this virus was not man-made, again, loosely using the term,
modified,
and not known about in advance, is missing the target and misleading people. And the document that you're referring to clearly indicates that either somebody falsified a document and threw it out there to see what type of splash effect they could have, or this is a legitimate document that validates that this virus is real, that they knew about it, that they knew it was infective, and there was a plan that somewhere along the way it would need to be let out. Now, the one thing that this might suggest, looking at those dates, is that instead of intentionally letting it out, it might have accidentally gotten out, because if they're thinking 5 or 6 years in the future for their test kits, that means they weren't ready to just kind of launch it out. It wasn't perhaps as intentional as it was ineptitude.
Well, I also start to think, I think everything that we look at are puzzle pieces. If you start to put them together, you actually get a picture. And if I look back and we take what you were just saying and we talk about the other puzzle pieces, and mostly it's not China. I mean, I know everyone wants to blame China, but I think we are more involved here than anyone wants to really say. And it strikes me as very odd that they tried to get the president of the United States out of office on false information. They failed. And I think it was the day afterwards that coronavirus was in the news. So it was already out there. Or they put it out there the day they found out they couldn't get Trump out of office. I'm just saying, this is a puzzle piece. I'm wondering if that happened, because at any point this thing could have either been released or it could have gotten out on its own. However, it just happened to be the day after they couldn't get Donald Trump out of office. And the only people that happened to know about these test kits, Trump maybe didn't even know about it, because this is purchased in 17. It could have been January 1, 17. Or actually, Trump just getting into office, or he didn't know what was being purchased. Who knows? Whatever. I happen to think there's somewhat fake news. It was maybe cataloged wrong, whatever. But I do think it also interesting, again, puzzle piece. How did they have test kits like immediately? Nobody thinks it's weird that they had tests for coronavirus, for COVID-19, like the day, we're testing for it. Like, how do you already have tests for it? Well, because they ordered them possibly in 2017, or they're using the wrong thing. We've discussed this, PCR tests. You said it tells you there's something there. It doesn't tell you levels. It doesn't tell you, how much of an infection you have, how dangerous it is to you. The thrombotic response, though, I'm curious, because anybody who's going to release this, I know they had an assumption of some sort of death rate, and they're hoping for something in order to create mass fear. And if they can control this world for 5 years, that would usher in a whole new experience to living. Everything we know would cease to exist, because 5 years' time, we will forget every single thing that we had. That's too long. It's too long a period of time for us to remember the freedom that we had. It becomes, I don't know, scary martial law type of world.
when I see packages left outside in our mailbox area for our apartment complex, and I see them just left out there, I will frequently take a package and put it by the door of the person that it belongs at, simply because I think that's where it should be versus down by a general mailbox area. I delivered one to one of the apartment units a couple days ago. I had a box about so big, right, about 4 by 4 by 4 inches, and it belonged to one of the neighbors. And so I called out both the husband and the wife's name, and it took a little bit, and no response. And then I did it again, and then I hear his voice, and then I hear her voice. She comes to the door to get the package. Okay, this is somebody, FYI, who works for Public Health Services in LA and does not wear a mask around the area, and neither does Public Health Services in their offices, even though they insisted everybody else wear the mask. The comment that I was getting to was, when I handed her the box, her finger accidentally touched my finger, and I thought, oh my God, that's a human touch.
And you forgot what that was like. You forgot what that was like.
It was shocking, and I touch enough people, but it's, gloved and everything else, right? So, but it was skin to skin contact, and it wasn't pulled back, like, oh my God, It was like, wow, yeah, that lack of human interaction has been pulled away. I saw somebody on the news. I know we're talking about vaccines, but we also talk about what we see. I saw somebody on the news that was just released from the hospital. I presume it was here in LA, since it was on the local news, although it could have been anywhere. And he'd been hospitalized for months, and he had tears. This was an older gentleman, I'd say probably in his 70s, because the hardest thing for him was not to have his family with him every day, or to be able. This is something I've hit on this before. I'm going to hit on it again tonight. There is no reason. Look, if you think we all need to be gloved up to be or masked up to be in the hospital, for the love of God, get the patients out of their beds, put them in a chair like we used to do, get them up, moving around, get their family members in there. And there's no reason why family members that are adequately protected should not be in these hospital rooms with their family members. I swear to God, much of the success that I think I've seen in patients on a daily basis is not so much me doing something as their family members being there. And it is more challenging for a patient who is isolated to get better than when they have social support.
Well, this goes back to what we were meant to discuss in some episode, which is my connection to positivity in life, and how I think that everything that's negative, if it had a touch of positivity, can just turn into a whole different experience. And we are going to get into that, but that's exactly what happens when you see someone you care about. And when you're not feeling well, what you need is someone who's going to bring up your spirits. And I'll tell you what doesn't bring up my spirits is seeing someone in a lab coat coming with me, a mask or with some sort of crazy thing on, and they're afraid to get near me. I can't see my loved ones, and I'm somehow supposed to feel better. That's a very interesting point. Just the curbside, energy you receive from your family. It's huge.
You don't think I look attractive in a white lab coat with all goggled up? I mean, is that what you're saying?
You know what, Dr. Fleming? It scares. It's such a sad thing that I don't know what anybody looks like anymore. Like, I'm walking around, I see eyes. I'm like, we've turned into, in the Middle East, we're in like some sort of Muslim country where everyone's faces are covered. All you see are eyes, and it's. And then you say this. Here's the one thing I want to say to everybody out there that's preaching masks. Okay, if masks worked. And we're all wearing them, by the way, except for the rioters and the protesters. But we're still getting it. It's still spreading. So if your mask worked, it wouldn't be spreading because we're all wearing the freaking masks. So how about just social distance? And if you're going to be around someone you care about, hug them. You know what? You get it, and you're around someone you love and you care and you spend all your time with anyway. It's ridiculous. They're starting to tell us to wear masks in our homes. What? Are you freaking kidding me? The moment I walk outside, I take that mask off. I'll walk around 500 people. If I'm outdoors, I've got the sun, I've got everything else out there, and I got flowing air. I don't have someone's breath sitting in my face, okay? And look, if I'm meant to get it, it's going to happen regardless. And if this is a 5-year plan that they've put on us, we're all getting it. We're all getting it. And if Dr.
The
Fleming's correct, if you get it, whether you have a vaccine or not, you will have the same response, the same experience. You're going to either live or die regardless of the vaccine, I think.
Yeah, and the reality is the thing that's going to determine whether you live or die is whether you, number one, reduce your comorbidities by taking better care of yourself, which is completely up to you, not me.
Yep.
As I've said before, you don't go. You're not coming home with me. You're not invited over for Thanksgiving meal, and I don't have a present for you under the tree. So what you decide you want to do, if you don't want to take my medical advice, it's a semi-free society. You can do whatever the heck you want to do. As far as I'm concerned, I mean, I have had in my private practice, you know, I've had people in the government come in as patients, and I've told FBI and CIA agents that if they don't want to do what I recommend for their treatment, they don't need to come back and see me just because they're with the FBI and CIA. That doesn't mean that somehow they're going to miraculously get better. And, you know, and they don't know what to do with that because they are so used to people being, it doesn't matter to me. If you don't want to do what I tell you to do, there's no point in coming back to see me. I'm not going to be offended. I won't lose sleep over it. I'm not going to go into a depression because you decided that you didn't want to come back and see me. If you want to go to somebody else who's going to tell you to do what you want to do, then good luck with that. Because I'm a firm believer in science. And if you want to go to somebody who's just going to tell you to do what you want to do, then you don't need to go see anybody anyway.
Just do what you want to do.
Unless, of course, you're trying to just get the drugs. And I'm the last person you get to come to if you just think you get to prescribe drugs. Because I'll tell you, go to medical school, get a degree, get a DEA number, and start prescribing. Have at it. You know, it's just getting into medical school and graduating medical school and getting a DEA number and all those things. That's a little bit more complicated for you, which is why, you know, the non-doctors are the non-doctors, the doctors are the doctors.
Absolutely. Well, and I think it's interesting because, and we talk about this a lot here, everybody's speaking like they're an expert. And, you know, and it's a scary time because the misinformation we're dealing with.
You know, and the problem is, and this is part of what I was alluding to earlier, is that just because someone shows up to talk and they want to defend a position, you have an obligation to hold them to task. I mean, look, I have a notorious one patient who comes in, and he's not even the patient, his wife is. And he's an attorney, and every time I schedule him late in the day, and the reason why I schedule him late in the day is I know he's going to come in with a 3-ring notebook over the latest papers that have been published in New England Journal or whatever, and I'm going to have to sit there and explain to him why, yes, I've read the papers. No, it doesn't apply to you. Yes, it's a great idea. No, it's not applicable here, or I would have already made the change in your medication. But I know it's coming, and I don't mind the fact that he's holding my feet to the fire because he's going, well, I just want to know what you think. I get it. And that's why your appointments are at 4:30 in the afternoon versus 10 a.m. in the morning. Because I know I need to schedule nobody after you.
Oh, my goodness.
Because it's just going to take so long to do this. I'm good with that. I'm okay, you know? And again, you're probably seeing, I don't know if you're seeing questions. I'm not. But.
Well, you know what? I just see one thing. Sig said that, and this is just, I don't even know if it's something we could talk about, but he said there are tons of pictures going around today of children in some sort of school, and they're wearing masks 6 feet away, and they looked really scared. He said, like, sad and scared. I don't know.
No. Children are little disease carriers, aren't they? I mean, if you have children, you know that they are runny nose, discharge. It's just their character until we teach them the things that means that you don't need a mask because you clean up and you don't cough at people. You know, we teach them social skills. And I guess the reason why we have the mask is because we've forgotten social skills.
That's a good point.
Yeah, no, I saw the picture. I saw the looks of the kids. If you want to get somebody to readdress an issue, I think show them children. I mean, at least they weren't in cages, right?
That's true. That's true.
The reality is, this virus is passing around, even like you said, with people wearing masks.
Yeah.
It's going to, because it is smaller than the mask. I'm gonna see. But you know me. I'm the scientist. I'm gonna present both sides and show just how dumb both sets of arguments are.
Exactly. I love that.
Carbon dioxide is smaller than a virus. That mask is not holding in carbon dioxide, making it impossible for people to breathe. Okay? If it doesn't stop a virus, it sure as heck doesn't stop carbon dioxide. Okay?
Yep.
So the argument cuts both ways. No, wearing a mask is not going to make it impossible for you to get rid of carbon dioxide, and it's not going to interfere with your getting oxygen. The point is, why is there an argument for wearing a mask? And the argument is to prevent the spread of the virus. So instead of coming up with dumb arguments that don't follow, I can't get rid of my CO2 and I can't get O2, stick to the intelligent argument that is the point, which is,
protect you from.
does it prevent the transmission of the virus? It's like the vaccine thing. The question about the vaccine is not, does it make antibodies? The question about the vaccine is not, is it safe? The question first becomes, is there a benefit to having the vaccine? And if having a vaccine does not change the benefit, then it doesn't matter how safe it is. It doesn't matter how effective it is. None of that stuff matters, because if it doesn't change your ability to get the infection, if it doesn't shorten the time of your immune system to react to a real virus that comes from outside your body and isn't made by your body, for the love of God,
Well, it's
then
funny.
there is no good argument for a vaccine, period.
And so it would get back to what I was saying yesterday, and this is what I wanted to bring to that argument that you're making, which is that this is mental. If you have, and again, we're just throwing a number out that the CDC said, if it's if you're a healthy person, there's a 99.4% chance that you are going to be, or is it that what it was? No, it was 90. What did they say on the?
Okay, so I think they're saying that if you have no comorbidities, it's 98 to 99% likely that if you get the infection, nothing else will happen. Okay.
Okay.
And that maybe only 5 to 6% of the deaths are people that didn't have something else happen, which equals that 1 to 2%.
Okay.
The point is that the vast majority of this country and the world is not healthy and has comorbidities.
Yeah.
Okay. So the fact that somebody's in a lab, and you're right. All evidence suggests that this virus started in this country, that the manipulation of this virus occurred in this country at a couple locations, and then I suspect that somebody caught on to the fact that, oh darn, this might be a little bit more dangerous than we want to be playing around with, and it might be good if it's not released in this country. Let's see, who are we paying to do work for us that we can shove this off onto? Oh, yeah, those people in Wuhan that we're paying for, that the United States taxpayer is paying NIH, NIAID monies to, right?
Yep.
Right? We paid for this. And the fact that it's over in Wuhan, China, where they finally were somehow let it get out, okay? And that's right. That does put their fingerprints on it. Because let's be honest, if you're a Chinese scientist, you're not sitting there going, yeah, I'm an American scientist. You're going, I'm a Chinese scientist. And if you're in this country as a scientist, I'm not a Chinese scientist. I'm not a Chinese physician. I'm an American, right?
Mm-hmm.
So
Well,
far.
Well, but that does make a lot of sense. I mean, everything's misdirection. You know, whenever something nefarious does take place, it never comes from where it looks like it comes from. So it makes sense to me.
You know, and maybe I've said this before. I know I've said this to a few people. Remember those horror movies where something gets out of a lab and causes tremendous danger to people, and there's always this scientist running around behind the scenes going, "You shouldn't be doing that. You shouldn't be doing that. I told you not to do that. I told you this is what would happen. Why did you?" That's me.
And then they finally come to you like 3 hours into the movie when half the population's gone. They're like, "Look, I'm Dr. Fleming."
And then you're supposed to put it together. And the problem is that you can, there's a part of you that people don't like to hear this, but I'm going to tell it to you anyway. There's a part of scientists like me that believe it or not, there's a point at which you say, I'm tired of this game. Go kill yourself off. It's a semi-free society. But here's the problem. The people that are dying weren't the ones that were playing this game, were they? So that's where the physician kicks back at me and says, but yes, I know these people did things that allowed their health to deteriorate to produce the comorbidities, but they weren't the ones playing around with this virus to make it so infective. And therefore, you got me. In the end, that's funny. That's the trump card to play, no politics intended, which is, Dr. Fleming, you're a doctor, aren't you? It's like, darn, yeah, I am. You got me. Okay. And then I will go, okay, listen, boys and girls, if you want to save them, you've got to treat the inflammothrombotic response. You can't pretend that this is from some magical force that you can't get rid of, some terrain somatid theory. This is a real thing that came from outside the body. They're real living entities, and viruses use the machinery of the cells that we have. We have to address this like reality. We have to treat it like reality. And then we have to respond to that. I got a text message earlier today from somebody who said they were having a discussion with someone about hydroxychloroquine and the use of these drugs. And, one person was arguing we need to follow the science, and the other person was going, yeah, but there's all these countries that claim that hydroxychloroquine works for them. And somebody needs to put this information together so the general public can see it. Well, guess what? I have yet to see those papers that show that what is being said from these other countries, in fact, is true. I'm yet to see a solid scientific study that shows that the use of hydroxychloroquine pre-hospital does, in fact, prevent the infection from getting worse. It's one thing to give this medication to people. It's completely another thing to show that medication actually is the reason why the people didn't get sick or sicker.
Well, could I ask a question about that? Because I'm curious. Some people say that some of these countries you have to take hydroxychloroquine because of like malaria, and those countries where they do take it, as a people, they have a very low infection or a very low death rate. Would that be a way to look in and see? Because they're taking it. Is it working?
No, that's not a way to do that. It's, we have worked out why it works for malaria and that it does work for malaria. We've done that work. But you don't know why they're not getting a higher death rate. Do they have fewer comorbidities? Are they doing something else when they're getting treated in the hospital? These same countries are also using other treatments that I've talked about using tocilizumab, the interleukin 6 inhibitors, or dexamethasone, the steroids, to control the inflammatory reaction. They're also using these other things. I mean, there are other medications that we've only briefly talked about, which is interferon. There's good data. There is some data that shows that perhaps the combined use of hydroxychloroquine and interferon may have some benefit. However, even that paper did not do something to show that it was in fact the result of those combinations that in fact interfered with the transmission or the worsening of these individuals. Maybe there was something else going on. And that is why Fauci has a valid point when he says, because he's using a scientific method, when he says we need studies that look at things prospectively from beginning forward, not looking backwards and saying, well, what did somebody say they got for a result? And then changing treatments to see what those different treatments have for different outcomes. And when you do that, you find that things like the remdesivir study falls flat on its face. Remdesivir, when it was used, did not show a statistically significant better outcome of patients. There weren't fewer people who died when they were given remdesivir than when they weren't. They got out of the hospital a few days sooner, but as I've said before, they haven't accounted for how many of those people were on ventilators and not. And being on a ventilator buys you more time in the hospital.
Well, also, they're not clarifying who had a comorbidity or not, and somebody who gets out a few days earlier could have been a healthier person, right?
Could have been. There is some information, some inference from the data that you can infer from what's called demographics, the presenting health of the people in the study. But to do that, you really do need to do a prospective study, because a retrospective study, when they look backwards on this stuff, is dependent upon somebody seeing you who's not doing a study who goes, well, Mr. Pires, okay, so you have high blood pressure, and well, you don't look like you're terribly overweight, so we won't mark that one down. And well, we've seen you smoke, so you're a smoker, that type of stuff. And that goes into the record, and then somebody goes and digs up the codes from hospital charts, and they make conclusions from that. Well, what if the person taking your history didn't bother to check about, have you been exposed to somebody with it, or have you been running a fever, or are you allergic to this medication, or any of a number of other variables? What they never checked for will never come out in the data, so you don't have that. And it's all based upon what somebody may have coded. And we already know that if you had a positive PCR test, you automatically got listed as a COVID patient. But that doesn't mean that you now have been entered intelligently into a study protocol that can discern anything except that you tested positive for COVID-19.
Now, but if you were to have solid data that you were able to classify as, hey, look, I've reviewed this and there's enough there for me to stand behind this and say, this works. How much data would you need to see? How many positive results? Say, is there a number you need to, like, we have to 50, 60%?
Yeah.
Like, how does it work?
So there is a way to actually check for it, and it's a statistical method where you basically say, what are my expected changes in these different treatment groups?
Okay.
And the way that you try to get to that data is you collect some initial data where you say, okay, people on this drug, for example, have this variety, this expected change in whatever test we're doing. So let's say we're using FMTVDM, right, as my favorite quantitative test, the only one that's non-invasive. And you're looking at changes that occur in people as a result of changes in inflammation. Well, I can tell you that over a 3-day period of time, now I'm providing you data.
Yep.
This is real data, that I'm telling you that over a 3-day period of time, on a drug that actually works, where the FMTVDM counts begin as an inflammatory infectious number, that if the treatment is successful, that you will see a drop in that number by at least 15 to 20.
Okay.
Okay. That number then allows me to design an experimental model that says, if we see a successful result, we need to see this difference to be statistically significant. Now, how many people will I need to put on this medication if it's effective to show that type of drop? And you need to do some preliminary work that shows how much drug A, for example, changes that number. And then you can calculate how many people you need to take drug A to give you the result if, in fact, the people taking drug A work. So that's how you do that calculation. So it's not so much a matter of how many you need. Now, what we see in a lot of research data, especially when they pool data, is that if you see a very minuscule difference in the outcome in a treatment versus a non-treatment, that is not statistically significant. So now that we're using that term, let's explain it. It has been accepted in statistics, particularly Fisher from Europe, that anything can happen by chance 1 in 20 times. So, for example, when you go in to get your blood work done and they do what's called an SMA 1220 or 660, where they're looking for your potassium and your sodium and your bicarbonate and evidence of kidney function and liver function. If you get 20 tests, 20 blood tests, statistically, 1 out of 20 will be abnormal just by chance. Okay?
And that could mean anything, right?
That means just by chance. It's so that's 5%. So the p-value is 0.05, which is the same thing as 5%. So what you want is an outcome that is more different than that. You want something that reaches less than 5%. So if the odds of something being different is 4%, that's 0.04. That's statistically significant. That means less than chance will you have that outcome. 0.01 means that only 1 time in 100 should that have been chance. 0.001, only 1 time in 1,000 should that have been chance. So as those numbers get smaller, it says, look, the odds of this happening by chance get smaller and smaller and smaller, which forces you to the conclusion that it must be something you're doing to make a difference. Okay?
Yep.
So and you take those numbers and you calculate it. So there is no magic number. When you see these mega studies that they're pooling together, what happens is that when the difference is so minuscule that it doesn't come up significant, if you throw enough of them in there together, enough people together, that difference starts to look statistically significant, so that the people like myself who've been trained as research scientists and aren't manipulated so much by statistics, one of the critical things that I will do long before I run the numbers is I plot the data. Now, in my mind, I can think three-dimensionally, which is a drawback if I'm trying to explain that to someone, but I think in three-dimensional terms. So I think in spatial terms, X, Y, and Z.
Okay.
So I can plot data out in my brain that way. And the first thing that happens when I look at data is I go, is there a difference in where this data sits? Does one data group sit different than another data group? And if those data groups overlap, that automatically tells me that there's really no difference in the outcome because they're showing the same thing.
Yeah.
So if I get 3 trillion people to participate and it now gives me a p.05 value, statistically significant, but the data's overlapping, I'm going to look at you and go, if you think I'm going to call that statistically significant, you're nuts, because there's no difference. When you just look at it, you can't separate the data visually. It can't be real, because things that are truly different visually separate themselves when you put the data out there and you look at it.
Well,
that's not where we wanted to go.
No, but still, it's interesting to hear all this, because we're in a world right now where we need information, first of all. So I love hearing about all of this. But how does it affect where, because if we continue to move forward day by day and we let these professionals out there change their mind constantly, like, what do we, if this is a 5-year plan, they're just going to keep doing that to push us in one direction to go to another direction. And if we can say, for example, that this is what it is. You're going to get it regardless. Why are we getting the vaccine? And then if it is a 90 whatever percent, and this vaccine has a 50 to 70% efficacy, that's the correct word, right? What?
Sure. Yeah.
So, okay. So if it's say, let's call it, and you just said something interesting in what you were discussing. You said a very small number, when you take enough of people, it starts to look pretty big, like zero point 0.4 people in the United States of America, 183,000 people, whatever it is, die from something, but there's 450 million people in the United States. So, but it starts to look like a lot of people. 180,000 people is a lot of people, but statistically, it's a very, very small number when you're talking about 100% of the population. So
okay, so and I get that, but that's still 186,000 people. I think it is 187,000 people that are dead that should not be dead, and they are only dead because they were not treated correctly, because they didn't address the inflammation and the blood clotting.
Yeah, and if you guys are tuning in for the first time, I want Dr. Fleming to explain this, because you may be out there thinking to yourself a few things. Oh, well, when this vaccine comes, I'll be okay. Something that was just said is that you still get the you still get the disease, you get the virus.
So let's talk about vaccines. Let's do basic vaccine 101. Okay. What we talk about are antigens and antibodies. And the abbreviation in medicine is AG for antigen and AB for antibody. Okay? More than you needed to know, but what the heck? Let's throw it in there. So, an antigen is something that tells your body that it's not part of your body. It came from outside. Now, cancer cells do this too. Why? Because when a cell has its genetic material change and it becomes cancerous, it no longer is your original material. It is foreign to your body.
Interesting.
When you have a tissue transplant from somebody else, it may be a human organ, let's say a liver, but it's not your liver. It's not what you were born with. It is foreign. When an infection, when a viral infection, for example, comes into your body, it was not made by your body. It didn't come out of your red blood cells. It didn't come out of this miraculous somatid stuff that can't be destroyed, that is the essence of all terrain theory life. It comes from outside your body, so it is recognized by your immune system as foreign. Shouldn't be there. You weren't born with it. It doesn't belong there. That's an antigen. Now, that will come into your body, and it will either it'll come in through a variety of methods. In this case, it's coming in through your nose and your respiratory system. It's passing lymphatic tissue, which is part of your immune system. It's filtering through there. The cells in your immune system are recognizing this as foreign. It shouldn't be there. And what begins after about 3 to 4 days is what's called the T cell cytotoxic response. So your immune system has a lot of components, but the two major ones that we talk about are T cells, which are labeled because they originate in the thymus gland, which is a gland in the center of your chest, and B cells, which originate in your bone for B. Aren't physicians smart?
Sometimes.
T, thymus, B, bone.
There we go.
So that's how they got their names. So the initial cells, the cytotoxic cells and the T cells, recognize this antigen as something that shouldn't be there. And the T cells actually will differentiate. They'll become two different types. They'll become T helper 1 to go help attack originally, and T helper 2 to go help develop antibody cells.
Okay.
That all happens in about 3 to 5 days, if everything goes well. Now, there was a very, very cool picture that was posted in the New England Journal of Medicine today that I shared on a meeting earlier, where they took the coronavirus and they infected human epithelial cells, which are the lining cells of our lungs, and showed that after 96 hours, 4 days, the virus had grown massive in numbers, which is about the amount of time it takes for that initial innate immune response to kick in. And that's when you've passed that critical point at which it's no longer a matter of controlling the attachment of the virus or the replication of the virus. It is now an issue of dealing with it immunologically. In other words, to use the colloquialism, the horse is out of the barn.
Then it's a matter of your immune system properly
Handling it.
Correct?
Right. And so one of the reasons why you get people that are asymptomatic or they don't get sicker is because their immune system is intact, it's in balance, it's not hyperimmune with all the comorbidities, and it's not naive. It's had time to sufficiently develop. That immune system kicks in with a T cell cytotoxic, which means cell killing. So it goes to kill the cells that the virus has infected. And it does this in a variety of ways, including the release of chemicals that punch holes in those cells to kill them.
Wow.
You're infected, we will kill you. You no longer are useful to the body. You've been taken over by the virus. You die. We release these chemicals. Those same chemicals, however, don't just kill the cells infected with the virus, they kill other things. So you've had that experience where your throat gets really raw, right?
Yep.
And it's red. The reason for that is because your throat is being damaged by these chemicals being released, trying to kill the cells that are infected by the virus, but it's also killing your natural cells in the area because it's just chemicals being dumped out to try to kill. The job is kill.
Jeez.
Kill the virus, kill anything infected by the virus, and it's very functional. If it wasn't, the species wouldn't have survived, right?
Well, that's
so it's
true.
a very good system. It has evolved to be sophisticated, and that part of our immune system is our most primitive component.
Really?
Believe it or not. That is the primitive component that we get from lower species. The innate T cell cytotoxic response. Very effective, handles most of it. And you don't make any antibodies at that time because it's too soon in the process. So, all the asymptomatic carriers, all the people that get infected, their T cell cytotoxic response handled it. Maybe they didn't get that much virus to begin with. Maybe they just got enough to trigger it. Maybe they're just really healthy and don't have all those other comorbidities. They handled it.
It's interesting.
Looking at the vast majority of Americans, I don't think it's because they're all that healthy to begin with.
Yeah, well, that's definitely true. But it's interesting. You just said something that my wife and I were discussing once, I don't know, a couple months ago. But we were curious, and you just said it. So I think it is true that, maybe you walk by, you get a little droplet. It's whatever. But if you were you get the whole, is there getting a little, or is there getting a straight up, you know what I mean? You get the full mouthful, and now you really got the worst of the worst. I always wondered that is if you get a touch of it or you get a big bucket full of it, it should almost hit you the same, but maybe it doesn't.
No. And I would tell you, there's nothing better for a doctor than working in a hospital, because we will get exposed to all the garbage all of you have.
Build your immune system.
Builds our immune system. There's nothing, this is going to be controversial, there's nothing better for kids or teachers than to have those kids in school building their immune system. If they get sick enough, they will go home. But I said it earlier, children are nothing but little virus factories.
Yeah.
They pass them around, they share them, they build their immune system, and they get over it. Yeah, why don't children complain? Because they're children. They don't feel well. Yeah, I want chicken soup, and that's okay. Look, my parents spoiled me when I was a kid and I was sick, and I was ready to get back to school. okay, and you got better and you got over it, and then you watched somebody else get sick and they went home for a few days and they got better and they came back. And that's what's going to happen in the workplace and in the school place and in society, because this is going to be passed around that way. So that's 3 to 5 days. So it takes you 3 to 5 days to mount that response so you start to feel better, right?
Yeah.
Critical number of days to remember. If, however, the infection continues and that doesn't do it, those T cells then communicate with the B cells and work together to the T cells present the virus, in this case, to the B cells that then make antibodies. Now, the first antibodies are called IgM. They're a pentamer. They're much more complicated, but they're designed to attack other things. Now, one of the topics that came up earlier today was then why are all these cells being punched in the body that then have blood clots forming to deal with the bleeding issues or the loss of blood? Well, the first one I just said at 3 to 5 days, right? All the chemicals. When the antibodies are released, what part of the antibody, one end of the antibody attaches to the antigen and binds onto it. On the other end of the antibody is what's called the FC.
FC.
Which stands for complement. That component binds the complement cascade, which you've seen in that diagram that I showed you about inflammation and cardiovascular disease, that explains all that. That causes the complement cascade to activate, and that cascade causes further damage to the area in an effort to not only kill the viruses with the antibodies, but to kill them with more chemicals and more complement cascade to kill the virus. The entire thing is designed to be a nuclear weapon, if you will, to kill the area. And this antibody response, this is what the higher animal species have. This is why it's called the adaptive humoral, which means antibody immune response, because it's only the higher animals that have this antibody level. The lower animals have the innate T cell cytotoxic.
Interesting.
Okay, now we give you a vaccine. That vaccine is designed to cause your body to think that it's being infected by whatever we're giving the vaccine for. It's the antigen being directly pushed through your skin, right? Or, they can do nasal sprays now, right? That's the newest popular thing. But we're not going to do that because it's more fun to stick needles in people.
I hate needles. I hate needles.
I'm guessing that's why they think that. But so they're going to stick something into you. And what they have to do is they have to make your body think that this is the virus. So what's happened over the years? Well, some of the vaccines have been live viruses, right?
Yep.
Yeah, that was a good idea. I mean, it was better than nothing. It was a thought at, look, we can either get it naturally or we can just stick that virus right into you and you'll respond to it. Now, there are some vaccines for bacteria, pneumococcal vaccine, which is important for particularly if you get your spleen taken out, because your spleen is necessary to assist in the formation of the antibodies to certain bacteria. So when people have their spleen taken out, you need to give them a pneumococcal vaccine to deal with all these pneumococcal bacteria, because once the spleen's out, they can't process it, and then they're just vulnerable and exposed. And bear in mind, the premise is always that these vaccines are clean. So whether they are or not, that's a side issue, and not to be confused with the conversation. You have to keep these conversations clean, or it's easy to get confused and lost in the forest. It's like the person who runs into the forest and doesn't pay attention how they got into the forest, and then they suddenly realize after 15 minutes, oh my goodness, how do I get out?
Yeah.
Which way do I go? So we're not going to do that. We're going to stay smart and focus on one thing at a time. So that gets into your body. Now, what's the first thing that's going to happen to that antigen when it gets introduced? The exact same thing I just said. That exact same sequence is what's going to happen. you're going to get a T cell cytotoxic response, and then you're going to get an antibody response.
Yeah.
So they have to wait to see if there's an antibody response, right? That doesn't change. The antibodies are not going to get made faster than the T cells are going to get activated. That's not how it works. This is not magic. This is science. This is human biology. This is immunology 101. All right? Now, so let me go back. So it could be the live virus. It could be an attenuated virus. What does that mean? That's a virus that we've tried to kill it. We've done our best to kill it so that we know its material, its DNA will get into you, or its RNA, depending upon what type of virus it is. Okay? And there's both types. And your body will recognize that and say, that's foreign, that shouldn't be here. Why? Because the RNA and the DNA of viruses and bacteria and mold and yeast aren't human. They don't come from us. This is the terrain theory.
Oh, okay.
Okay? They don't come from us. They are foreign. They are not our genetic material. So your immune system will recognize it and say, attack, remove,
Interesting.
destroy. Warning, Will Rogers, warning, you know? And so your body does that. Okay, there is, you know, as we've gotten more sophisticated, we've looked at, are there things that we can target? You know, the vast majority of the vaccines for COVID, even though there's multiple proteins that are made by multiple segments of mRNA from this single-stranded mRNA sense-positive virus. I'm putting all the terms out there. So if somebody's listening, they've got them all. It's sense and positive's the same thing. Single-stranded, it's RNA. But they make different proteins once they translate, once the RNA becomes a protein, and you have to build it. So part of what they've done is they've said, well, let's take the genetic code, or let's take the S protein. There's more than one option, but the vast majority of vaccine developers have gone for the obvious, right? The S spike protein that you've all seen too many pictures of already, because all of you now think that you understand microbiology and you understand that S proteins attach to the ACE2 receptor. I got it. It's been regurgitated enough times that, you know, you can at least say the words, but understanding what that really means is a little bit more sophisticated than that. But what they're trying to do is to introduce part of this virus into people so that you will build an immunologic reaction. Okay, now this is interesting because you really are now giving genetic code of this virus to cells. And I guess the key is that we're not trying to give all of the genetic material, just some of it, so that we'll only make antibodies to the spike protein. Interestingly enough, if that spike protein alters, those antibodies aren't necessarily going to be quite so efficient, are they?
No.
But though that takes 7 to 10 days for those antibodies to develop. So you've been vaccinated. You now have antibodies. They are now stored in what's called your memory B cells. Now you get exposed to COVID-19. We've all gotten vaccinated. We're all pulling off the mask. We're all going back to work. The kiddos are going to school. We're going to the polling places. And what happens? COVID-19 gets passed from person to person. Having those antibodies or having the T cell response early on doesn't prevent you from getting infected. When you get infected, it simply says, I've seen you before. I remember you. I know just what to do for you. And how long will it take for that memory B cell to kick in and go, wow, T cells are showing me this virus. Well, I've already made this antibody before from when I got vaccinated. I'll make that antibody. Well, let's see. That means that at about 4 to 5 days, you'll be pumping out antibodies instead of 7 to 10 days. But guess what? your T cells are already active at 3 to 5 days. So your new T cells being made when you get exposed to the new coronavirus that you just got because you took your mask off and we're now sharing the virus because it's a respiratory virus, it will all kick in about 4 to 5 days, which is exactly the amount of time it's going to take for you to naturally kick in if you just pick up the virus naturally. The only problem is that if you pick up the virus naturally and you feel crummy like you do today and you go to your doctor, you will probably go, do I need to be admitted? And the doctor hopefully will be smart enough to go, Mr. Pires, you need to go into the hospital. We need to be, monitoring your oxygen and watching for other problems. Now, if they get smart enough to start treating you for the inflammation and the blood clotting, you probably are home free, because if you prevent that from being the problem to kill you, you're probably not going to die.
And you're
going to survive and you're going to get better. But now you've had the vaccine and you're of the impression that, well, I've got a vaccine, I'm protected, I'm not going to have a problem. Right? Okay, you see my mannerisms. The mannerisms are you've exposed these people already to a vaccine, and they're thinking, well, this must be the way this works because I'm being vaccinated against COVID-19 so that I don't die. And now when you get that inflammothrombotic response because your body's responding to the vaccine, you're not going to go to your doctor because you're under the impression that nothing bad can happen to you because the vaccine's good. Vaccine good, virus bad, right? Mm-hmm. Or you get you get exposed to the virus now because you're the 80-year-old grandma and your 3-year-old grandson comes over because now we've all been vaccinated and you can't possibly get sick. And now 3-year-old Bobby from his preschool, who's been sick with other preschoolers, but they've all been vaccinated, shares COVID-19 with grandmommy, and grandmommy goes through her typical response and she doesn't go to see the doctor because we've all been vaccinated, right? So I can't die now. And what you now have is a dead grandmommy.
Yeah.
Congratulations.
So, guys, bottom line is just keep building up your immune system because this thing is not going anywhere. Vaccines are doing nothing because you're going to be creating these T cells prior to or the same time as you would with a vaccine. It's a fool's errand. And when I heard Fauci say to Matthew McConaughey, 50 to 70%, he'd be thrilled. Look, 50 to 70%. I'm like, Dr. Fauci, really? 50 to 70%?
So, here's the next thing, because the McConaughey Fauci thing is worth talking. I sent you that little equation, right? I sent it to you earlier on Twitter. It's 1 minus 1 over R naught, okay? That is the herd immunity equation, okay? So herd immunity is determined based upon if an infected individual spreads the infection to somebody else, how many people does he or she spread it to, okay? If the average person infected spreads it to one person, then it's 1 minus 1 over 1 person. What's 1 over 1? 1. 1 minus 1 is 0. How effective does a vaccine need to be? 0%. That's herd immunity.
Okay.
If you spread it to 2 people, then it's 1 minus 1 over 2.
Okay.
1 over 2 is 1/2, so 1 minus 1/2 is 50. Now herd immunity needs to be 50% of the population. FYI, the efficacy of the vaccine also needs to be 50%. Now, if one person passes it to 2 people, so those 2 people pass it to 2 people each, 2 people each, 2 people each. Now it's 3 people. Sorry, we already did 2. 3 people, then it's 1 minus 1 over 3, or 1/3, which means 67% for herd immunity, and it means the vaccine has to be 67% effective. Okay, how many people on average does a COVID patient, according to the data, pass the virus to?
I don't know that. What do they say?
Somewhere between 8 and 11.
8 and 11.
Okay, so let's say it's 10 for easy math,
Okay.
because they published something about a group of monks recently, and they had one monk that they knew was infected with COVID, and they had 2 buses, and they put a bunch of monks on the bus with the infected COVID-19 monk, and the other bus had nobody infected, and they were on the bus ride for 2 hours. All 23 monks on the bus with the infected monk got infected. Nobody on the other bus got infected because nobody had the virus.
Yeah.
So how many people did that monk pass it to?
23, 22.
23.
Or
So
23.
now it would be 1 minus 1 over 23. Okay, so let's just say it's 10 people. 1 minus 1 over 10 is 1/10, means that you have to have a herd immunity or an effectiveness of a vaccine coupled with herd immunity of 90%. So when Fauci says that he's happy with a vaccine that'll be 50 to 70% effective, for that to work means that the rest of that immunity has to come from people that already got infected,
Okay.
or the vaccine isn't going to provide herd immunity. Game, set, match.
And he added a tag on the end that with the right health measures.
Yeah,
50,
with enough
70%.
other people infected over time.
Yeah, and then we could just keep you in your basement.
Hey, you know what? With enough people infected over time, you don't need a vaccine, do you, to get herd immunity?
This
I
is the
think
other
they
point.
called that Sweden.
Sweden, yeah, they did a good job, didn't they? I mean, people died. People are dying. And look, people are dying all over the world. Everyone's wearing masks. You're still getting the virus. You're still dying. So the masks aren't doing it. Vaccines doing nothing. How about this? Go out and get healthier. And not that that's
Absolutely.
it's not an easy thing to do.
How
but
about this? Don't cough on people. Don't sneeze on people.
Yes.
Wash your hands. Pretend like you've got a second grader education, and go make yourself healthier.
that's it.
Quit eating garbage food. Take better care of yourself. Work to get your diabetes under control. Work to get your blood pressure under control. You like salt? You have swollen ankles? Maybe you should pass on some of that salt,
Yeah.
so the food doesn't taste as good. Are you eating to live or living to eat? Did somebody use that phrase earlier today? It's a good phrase. I think it's out of the Bible, but it's out of a lot of other places too. The problem is that the comorbidities are the fault of the population as a whole.
Yeah.
And some of that is from all the misinformation that's been put out there by all the dietary garbage. There have been so many diets. I don't know if I'm looking in the dark or not. Sorry
now
about
you're
that.
better.
It's dark
That's
here.
better.
I don't know if that's better or worse. Is that better or worse?
You know what? Turn the light up towards the ceiling. And that'll be perfect. Because it's a little shiny on you, but that'll be
How's that?
much better. Yeah, perfect. Yeah, less of
Sorry
a shine
about
on
that.
your face. No, that's actually great because it was getting dark. I was gonna ask you to throw a light on.
Yeah. Now you can tell that as a nuclear cardiologist, I read a lot of my studies in the dark.
You know what's once you have that screen on, you know what I mean?
Yeah.
I'll shut off the house. If I got that screen on, I can work all day and night.
Yeah.
You know?
Yeah.
No, but I think
forgot
it's
what we were talking about.
well, I think what we were really getting into or starting to get
The
a
health,
handle
yeah.
on is
the
health.
diets, all the garbage diets that are sold out there by people, and I've got news for you. I've talked to most of the people who've written these diet books. I've got books out there that some people consider diet books, but the books reflect more, I think, about what you need to know so you can make decisions. Everybody loves to have recipes in these books, and I just cringe when people ask me that. And I come from a family that actually has set up several restaurant chains. I mean, the one side of the family has Fleming steakhouses and P.F. Chang's, and the other side of the family has things called Bishop's Cafeteria from the Midwest. And that's part and parcel of being a Fleming and being a Viking ancestry, is that's part of what the ancestry was. And I look at the stuff that people eat for food and the diet books that are promoted out there, and I'll tell you for a fact that most of these people that are selling you diet books don't have a clue what they're talking about, but they sure do make a lot of money.
Absolutely.
And the more they have talked and the more money they have made, the less healthy the world has become.
You know, I don't know if you're able to see this on this YouTube. I'm not sure what the delay is between me putting something up and you seeing it. I think it's about 15 seconds. Are you on the YouTube page by chance? On my page?
I tend to stay just on our other things, so let me
see if you could click it open real quick.
I probably need to refresh that.
Let me know once you have it open.
I see live now. Huh?
There you go. Click that. I want to show you a photo. Tell me when you're on. All right, and if you can, click off the volume and mute the volume just so we're not hearing it in the background.
Yeah, so what am I looking for now?
All right, I haven't put it on yet. I want to show you something here.
Okay, I'm up, I think.
All right, you should see this momentarily. This goes back to what you just said about the people that give us advice.
Yeah.
You should be seeing, hold on, I'm watching. There we go.
Oh, yeah, baby.
Oh, yeah.
I don't know what you want me to say about any of these people.
I think that's Chris Farley up on the top left. I'm just saying. No, that we also said he could have been. Do you remember the mayor from Toronto, the guy who looked like Chris Farley, who was like a crackhead?
Yeah. Who was always fighting people at meetings. Yeah.
Exactly. And bottom left, I love. She looks like the one who won Britain's Got Talent. Remember the lady with the teeth?
Wait a minute.
I'll put it back up there. I forget her name. Susan something. Susan. You guys know who I'm talking about. She was
Boyles?
Susan Boyles. That's Susan Boyles. Right?
Don't attack Susan Boyles. She had a lovely voice.
She had an amazing voice.
I couldn't have been more ecstatic for that little lady when she belted that out.
Oh, she was phenomenal.
That was phenomenal.
Honestly, this lady here ate 5 Susan Boyles. I'm just saying.
Yeah, that would probably be a better definition of that.
No, but it's funny. The people who do give us the advice look like that. Those are public health experts. And, when you can't go out and practice what you preach, like Nancy Pelosi, going and telling people that you can't live above the law, no one's above the law, and the same day she goes and, but this is the way these people live. I saw a couple weird videos. I see these celebrities. They're kind of like all in each other's faces. Like they know something we don't, or I don't know. It's a weird thing. Like everyone else has got masks on, but I see like The Rock and like he's hanging out with people and they're all like, hey, like face to face. I don't know. Either people are totally not taking this thing seriously or they know they don't have it. They get tested. I don't know. It just seems really weird to me. The celebrities seem to have a different set of information than we have. Either that or they're just...
Well, I'm guessing everybody has a different set of information than the research scientists that are actually working on this.
Oh,
I told people, so I have 2 papers out now at 2 different medical journals being looked at, and it's a matter of just putting it out there. And I'm used to rejections. You get used to rejections just dating girls, and in junior high and high school, right? So
I always say I'd rather have a rejection than the regret. Regret is the worst.
Yeah, the person who says they can't is right.
Yeah, they can't
because they don't bother to do it. I
told you my thing on impossible, right? Everyone says things are impossible, and there's an apostrophe there.
Right. And, and that can be a helpful way to look at it because I've never known anybody to solve a problem who gave up.
Yep.
What's the old adage? I found my keys in the last place I was looking.
Yeah, it's always in the last place
you always find, why would you keep looking once you found your keys?
Exactly. That's what makes it a funny thing too. It's like a little joke. I say to my kids, it's always in the last place you look.
Yeah, because if you're still looking, you have other problems that you need to be addressing.
Exactly. Yeah, that's a good point.
And as I tell people, my master's in psychology was in experimental psychology, not clinical. I don't want to listen to
Problems and
I'm not your psychologist.
Yeah.
I never will be. Mine was experimental, and I use that for my research benefit to better understand certain models. So yeah,
like a painter. A painter wants to have every brush. You know what I mean? You got to be able to know that canvas and understand how to pull out the colors and show the life that's there. I think it's a cool thing when I hear, especially someone who doesn't just stop at, just I'm going to be a doctor. I'm going to be a lawyer. I'm going to be a scientist. My brother-in-law is like, he's a stockbroker, but he's a lawyer. He's an entrepreneur, but stockbroker he becomes an attorney and he realizes he doesn't want to, do it. Just feels really like sleazy to him, and he's like, I think I want to stay in finance, but still has the Juris Doctor. It's like, why'd you freaking do the work? We don't know what we want to do with our lives. We go in directions and we try to figure things out. And sometimes you accumulate a ton of knowledge and experience, which could be huge for you down the line if you know how to wield that into something like what you have, a patent or something, and to hopefully change the world in some small way or big way.
Yeah, it's the patent, like so many things, it has the real advantage of making things much better for people. I'm determined, both for heart disease and cancers and these infections, because anything that changes the tissue conditions will be, it will show up and it will be measurable using the patent. And we're just about to the place right now where I told you that the patent was going to be free during the pandemic to assist with the development of treatment guidelines and to make people better. We're just about to the place right now where even that will cease to be free, because with the publication of these two papers, we will have spent 9 months, not just myself, but most of the work has been done in other countries. So I do have a little bit of privy knowledge about what's going on in places like India, like Italy, Cuba.
Cuba's working on stuff?
Philippines. Those are the four major areas that we've been able to work with these people and find out what's really going on with treatments and measure treatment successes and failures.
What kind of infection rate do they have in Cuba?
Well, I'm not sure exactly what the percentage is. I think the numbers I know, I think they've only 100 people have died in Cuba. I know it's thousands of people have been infected. I'm not sure what that rate is for the general population.
But it's so everywhere in the world it's found its way to every country essentially, right? At this point?
Yeah. I'm unaware of anybody who has been untouched by it, because again, it's a viral infection that is spread by respiratory pathways, and it's had time to do that.
Yeah.
It's not going away, just like the other viruses on planet Earth are not going away. One of the things that I've commented on to people, and I don't know if I've commented on to you, but if you think about how this virus was manipulated, it's inconceivable to me to believe that the people that have their fingerprints on this, using a phrase that I think at least colloquially is understandable, that they suddenly went, oh, we better quit doing this and destroy it all. Now, I don't buy for a moment that they've destroyed all that stuff, and I don't buy for a moment that they're not actively involved in more research and more manipulation, because that's what they do.
That's what they do.
And as long as they get funding, they're going to continue to do that. And you just I think we need to ask the question, what's next? I think we need to ask the question, who's paying for this? We know who paid for the last one, the U.S. taxpayer.
Interesting.
Did anybody else pay for it? I don't know. It's quite possible that if people think that the United States is the only place in the world that's playing with this stuff, I think you're seriously delusional, because there's no, I mean, let's be honest, the other nation states in the world are doing very similar things that we are doing as a country.
You know what's interesting? Think about this. This 50s, 60s, was it? When did the Cold War? What were the years for the Cold War? Was it 50s through like late 90s? Is that what it was? Something like that, or late? What was it? Late 80s?
All I know is I grew up during the heyday of it and during Vietnam. So I know we used to have duck and cover drills that we were going to be bombed.
Air raids.
And we ducked under. I mean, we ducked under our school desk, which when you think about it. School desk, nuclear weapon. Yeah, that was going to stop it.
It's a great idea. You know what you should have done is you should have gone in the doorway. That would have helped too.
Yeah, it does for especially earthquakes, right?
But my thinking is you had a nation. Well, you had the world really on high alert, and you had fear mongering for 50 years, maybe whatever it was, and now they're starting the new generation of fear mongering in order to create control. It's a control mechanism, right? I mean, what other reason would there be for you to shut down the entire world? Like even Cuba, I'm sure they've shut down Cuba for 100 deaths. And I don't know if they have, but I'm sure they have. The whole world shut down.
My understanding is that Cuba and South Africa have the most stringent restrictions, because I spoke to somebody in South Africa that recently too, have the highest restrictions on movement of people in the world.
Wow.
So if you think it's bad in this country, my understanding from the people I talk with in those countries is that we look like a walk in the park.
Wow.
So it tells you what people are willing to do. The only way any of this changes is with the dissemination of information and knowledge. And this is the Galilei effect, which is if you teach, which is again why the book was written and why we're in the process of getting it published, which is it can reach many more people. And I always encourage a person who buys a book and reads a book to not tell their friends to go buy a book, but to give their friend their book and let them read it.
Exactly.
Share the book.
Exactly.
Everybody on planet Earth does not need a copy of this book.
Pass it around.
Pass it around, because you're passing the virus around. You might as well pass the book around.
Absolutely. Give something positive and share that. Yeah. I got a mentor who does that. Every time I see him, hey, Mark, I got a book for you.
Yeah.
And it's brilliant because he's an entrepreneur. He's like crazy. He reads like a book a day. Like I can't. I'm creating. So I don't have the time,
right.
But like I appreciate that he's always giving me something, trying to broaden my knowledge, because he knows what I do. He tunes into the program. He's like, hey, I got some more stuff for you. And I love this guy too. He'd be great for us to talk to one day, because he's like, you know what, Mark? I'd like to talk to you about some things that I can't talk to my friends about. And he didn't mean Trump. He meant like, deep spiritual things that come out of the Real Talk program and people are afraid to talk about. But there's a lot in this universe we cannot see, but it's there. And, it would be nice if we talked about it more often and had some more frank conversations. And you know what I'm looking forward to one of these days is finding a topic that has nothing to do with coronavirus. COVID. Yeah, because, it's funny. I feel like this world is just so... We're so depressed with all this information that we're getting. It's bad. And did you see how many people suicide is higher than death from COVID-19? I don't know if it's like that every year. I don't know. But people are not, nobody's making money. A lot of people are still out of work. And then you have people posturing, the politicians. No one's helping out the people of this country. And I understand it. I know the whole point is let's continue to push the narrative. We got one side hates this side, the other side hates the other. So they're continuing to gaslight in order to get through the election and make their candidate look good, which, like I said, Sleep Sofa can never look good. But they're doing their best to try to make Trump look so bad that people are like, well, I guess I'll vote for a Sleep Sofa. And I think this is where this whole push is going. And I'm wondering if once we get all the information out there, maybe it makes sense to just get people, you know what, we're done with you. We're done with you. We already ripped apart COVID-19. We know You're all full of crap. It's a pandemic. You started this in order to control us. And yeah, there are people dying, and it's all your fault. You released something that you knew was going to be infectious, and you dialed it up to a 10. Yeah. And how dare you? Because now you're standing out there pointing your fingers when the whole point was to create so much confusion before this election. So much misdirection. So everyone's looking in one direction. They're saying, okay, look, sleepy, or I hate Trump. And it's all a big push to get people to vote for the wrong guy. I can't see it as any other thing. I can't. I don't know. Do you? Do you see this as being anything other than the election? Or it just seems weird to me that this is all going on.
I think that just about everything that's an issue gets used one way or another by people who want to use it to justify what they want to sell. And that's one of the reasons why I have a very limited tolerance on people misrepresenting things, because of the impact of this misrepresentation of things that they want to sell as a fact. One of the things that I used to tell students, it's been a while since I've done this with them, if you want to sell a concept, here's what you do. And I'm always leery about telling this to people because the implication is, so is this what I do? Dr. Fleming, is this what you do? And the answer is no, I don't need to, because I find enough information in the truth and science. I don't need to do this. But this is what I've seen people do. You start something, your statement, with something that we all know is true or we accept is true for whatever reason. And you end it with the garbage that you're trying to sell.
So give us an example.
You need to wear a mask to stop the transmission of COVID-19.
Okay.
All right?
Yep.
You're really beginning with, we really need to stop the transmission of COVID-19. Most of us would agree that would be a good thing. If we don't question whether that's possible, it's clear to understand that stopping the transmission of COVID-19 would be a good thing, right? Isn't that why we're all sitting at home? Isn't that why businesses are closed? Yep. Isn't that why students aren't in school? Isn't that why $3 trillion plus has come out of the federal budget that we don't even have, but it's pretend money anyway, to deal with this, okay? So virus is bad, no longer spread, good, okay? Okay. What you want to sell is everybody's going to put a mask on. In between there, you start to say, well, if you look at countries that wear masks, they seem to have less infection. Well, is that true? I mean, is China not going through some resurgence of this?
And they wear their masks, people.
Are we not continuing to have a continuation of this?
And we wear our masks, except for the
rioters. Is it not true that healthcare providers in the hospital wearing standard gear, the longer that they are exposed to COVID-19 patients, the more likely they will pick up COVID-19 even while they're wearing their personal protective equipment?
Absolutely.
The answer to that is yes. Okay. So all of that evidence gets blurred over with but it's the socially responsible thing to do. It's the patriotic thing to do, because you don't want to kill grandma down the street with breast cancer, and you don't want to kill the little child with leukemia. So you tug at the heartstrings and go, well, of course, nobody wants to kill the woman who's getting breast cancer treatment or the man getting prostate cancer treatment, like those are the only two that exist, but it's the only two that people talk about, or the little child with leukemia. Of course, we don't want to do that. No non-sociopathic psychopath would want to do that. Mm-hmm. Okay? Maybe that's where we should start with the premise, right? Because that's what they use. But there's nothing about any of the arguments in between that says we have proven that the use of these masks prevent the transmission of the virus. Oh, we've done cute things like we've given clouded spray for people to cough into masks, and you see the spray going like this. Yeah, what happens to that spray afterwards? It floats through the air. So it didn't stop diddly squat. It just shot it up and down, and then it moved with the air currents that exist in the air. You know, there are studies that show that that in asymptomatic individuals that aren't coughing, that there's no evidence that wearing a mask stops the transmission of the virus. But that's also because there's no evidence to suggest that an unmasked asymptomatic individual is transmitting the virus from person to person. They undoubtedly are transmitting some. They undoubtedly are. I mean, it's impossible to, it would be illogical.
We know they are.
Make the argument that you have COVID-19 in your nose and breathing in and out, you are not somehow blowing it in and out.
Yeah, regardless of asymptomatic, you're right. Because if you have it and you're pushing it out there, look at typhoid Mary, right?
Yeah.
I mean, look, it's just and this is what I was going to ask you earlier about even efficacy or whatever, but we are all different. So you can't expect the same results from something. And even if, let's just take hydroxychloroquine. Even if you looked at hydroxychloroquine, that's what I was asking you earlier, how much of a result would you need to see to be like, wow, that's effective? Because if you give it to 100 people and say 30 of them actually respond, is that a good thing or a bad thing? And if it actually cures 30 people out of 100, is that a bad thing? Is it a good thing? Does it mean that they're not cured because 70 people still didn't get cured from it? Like, I don't know how that works.
Let's hit that word cure.
Okay.
What do you mean by cure?
Maybe not cure, but maybe.
No. Go with it. Just go with it.
Okay.
I want you to do this because I know people are thinking this.
Okay.
What do you mean by cure?
I guess I would say take something and a few days later, I don't get the full effects of this virus where it just kind of drops it. So I still have it obviously when I take whatever it is, but it just kills it right then, and it takes a few days for it to get out of my system. That's what I would think of as cure for something like this. Is instead of it being a 14-day thing, I took something and a day or two later, I actually felt good again.
Right.
That to me would be cure.
Okay, so feeling better doesn't equal cure.
Okay.
Cure, I would argue that most people, when they think cure, means the problem no longer exists.
Okay.
And I would argue that viruses are just simply kept in check
they don't
by
go
your
anywhere.
body's immune system. Okay? They're under control. That's the function. They're probably not completely eradicated. What happens to the chickenpox virus after you get it? Does it go away?
No, I think you keep a antibody response to that, right?
It goes into what's called the dorsal root ganglia, which is part of your nervous system by your spine, and it goes quiet. What happens to people with tuberculosis? They form what's called a granuloma. Your immune system goes in and walls off, puts a fibrous layer around it, puts white blood cells around it, contains the tuberculin virus. And when we, as physicians, get chest X-rays, and you get your TIN test, your TIN test, to see if you have TB, because it'll test to see if you've been exposed to the antigen to make an antibody, which will produce a reddened area and, more important, an indurated or hard area. Okay. What do we do as physicians when you go, wow, that's a positive TB test? What do? We get a chest X-ray. Why? Because it's a respiratory infection, tuberculin. And we look for that granuloma on the chest X-ray. Now, what happens when people get really old and really sick and they have TB? That granuloma breaks down and they start coughing out tuberculosis again. What happens to the chickenpox virus when they get old and they get ill, or their diabetes flares up, which impairs their immune system? Well, the chickenpox virus comes back out. It's in the nerve root, so it comes out along the nerve. It goes to the skin supplied by that nerve, so it's called a dermatomal pattern, an area of the skin, dermis, dermatome. where it comes out, and the first thing the person feels is a burning sensation. And then you see this blistering, which has the virus, the varicella virus in it, and it's contagious and can be spread to other people.
Wow.
And they will get better and recover. Usually with treatment, they'll get better sooner. And what happens when they recover? The virus retreats and goes back into the dorsal root ganglia and awaits an opportunity for when the immune system no longer has it under control, and it can come out and make itself grow again.
Wow. So basically,
that's how these things work.
With chickenpox too, because we were always told once you get it, you never get it again. So realistically, you can.
Yeah, it's incorrect. That people have gotten it more than once. It's unusual to get the true chickenpox virus because the variants on it tend to be close enough that your antibodies that you made and your T cell response that you made do tend to pretty much will prevent you from getting it in. But you can. It's kind of like mononucleosis. You can get that more than once.
Yep. Now, what's the connection? What's the connection between chickenpox and smallpox? Same family?
No,
not at all.
Well, smallpox is it's a different virus. It's a different, altogether different. We haven't even eradicated smallpox because some intelligent humans have kept it in storage. So the countries, and this would be one of them.
Us.
We're not the only ones, though, have kept reservoirs of smallpox, right?
Wow.
Well, that's dandy, isn't it? I mean, why would you, if something is so dangerous that you were able to effectively eradicate it from people,
from the existence of this planet,
why in the world would we have kept samples of it? Well, there's only one reason why a government keeps samples of an infectious agent.
To do what's going on right now.
And it's not for good reasons.
Yeah, to release it on the planet. And this is where I didn't fully tie this up, but I feel like we're almost in this Cold War type of thing now where does that make sense in a way? Like, I feel like that.
Yeah, this represent, but here's the problem with these types of biohazards, let's call it that, shall we? So we don't use that nasty word that'll get you censored.
Yeah.
These biohazards that exist don't really know boundaries of countries, do they?
Mm-mm.
They don't know religious affiliations.
Skin color.
They don't know color. They don't know sexual orientation. They don't know age. They don't know any of that stuff.
They just look for a way in.
Yeah, they look for a host to provide them with the machinery to survive. And they don't look to kill the host, because if they kill the host,
they die.
They no longer have a place to live, and they die.
Yeah,
right?
Exactly. So they actually are hoping that we just continue on and let them live within.
Yeah.
That's pretty crazy.
They're kind of like teenagers.
I got a silly question for you.
They eat and reproduce and eat and reproduce and don't do anything.
Really? There we go. And you feed them ice cream during the day. I got a silly question. I asked this doctor friend who came on the very beginning of COVID. Actually, this is crazy. Greenwich doctor here in Connecticut. And first, he's on the front lines, and I'm interviewing. This is the first interview with a doctor. So excited to find out about COVID-19. He comes in the studio. He's like 6 feet away from me. He's like, look, I just diagnosed the very first case in the state of Connecticut like 15 minutes ago. And I'm like, what are you freaking doing in my studio? And he's like, no, I'm cool. I'm over here. And he's like, I feel fine. But at then we didn't know what was going on. Long story short, I asked him a question, and I'm going to ask you the same question, and I want to hear your response. He gave me one. He said we started hearing things about how this virus is not that strong. It's, if you drink coffee, for example, it could kill the virus, like hot water, blah, blah, blah. Now, you're giving me a look already right there, so you may have answered my question already. I had heard that something hot can kill, like a hot liquid could kill this virus, anything over 90-something degrees, something. Just let's pick that number, 95 degrees. Who cares? You can tell me I'm crazy.
You're 98.6 on an average, so you might want to go higher than that.
Let's say 130 degrees, whatever it is, you're hot
130,
coffee.
Wow, yeah. You and the virus will be dead.
Okay. Give me a number that doesn't kill me but kills the virus.
103, 104. That's why we get worried when you get those temperatures, because they tell us that you have something serious going on. And that number is driven by interleukins.
Okay.
that are released in this immune response, and they reset the hypothalamus to increase the body temperature with the intention of trying to make a less hospitable environment for the cells that are being infected, so that they will hopefully die, and then the virus will too.
Okay, so then that's a very interesting way of explaining it, because what I'd heard, and this is again all hearsay at the beginning, was that hot liquids could kill this thing. And so I just asked this doctor, okay, I drink coffee like crazy. And someone said every 15 minutes, if you drink hot fluids, every 15 minutes, you can maybe whatever. So I started saying to him, if I always drink hot coffee and I'm around people who have COVID-19, but I drink my hot coffee right after, could I theoretically kill the virus that I have in my mouth or something like that? And he said, it would be very hard, but it's not out of the realm of possibility that you would, if you do drink coffee like that.
I think you'd have to pour the coffee in your nose, wouldn't you?
Well, I guess you're right, because that's where it really affects us, is through the nose, not through the mouth, right?
Look, yes. Well, it can go through the mouth as well, but
you have the hairs in your nose.
Normally, unless you're a mouth breather, you're gonna, the vast majority is gonna go through your nose.
Yeah, that's true.
So me, I'm a scientist, and when people tell me something, and I go, well, have you proven that? Because if you're gonna go proposing that thought process, let's be honest, there's enough people grasping for straws. Just give me something I can do, it's one of the things I talk about in the book. The danger of what's happening from the misinformation is that people will pretty much do whatever you tell them to do, including surrendering all of their rights.
Absolutely.
If you will promise them and reinforce for them that what they are doing is correct and is making a difference. And what we see every day is what you are doing is correct and it's making a difference. Now, I'm not sure how to match that up with the ever increasing numbers of cases and deaths. Because if what you're doing is correct and it's making a difference, then explain to me the disconnect between that
and the
numbers continuing to go up.
Exactly.
If you're telling me that it's toxins in the environment or stress that is responsible for COVID-19, then explain to me why the cases of COVID-19 were going up in Los Angeles when we had the least amount of air pollution and we were the best city in the world as the cases are going up. But now the cases are coming down in numbers and people are driving more and the air pollution has gotten bad. There's a disconnect between the argument that it's the toxins in the air and the presence of COVID-19. They're not matching. In fact, they're just backwards of what they would have to be if it's the toxins. So if your fantasy land is it's the toxins, then you need to go over there and work with the people that believe it's all the toxins, and you people go solve COVID-19, while the rest of the scientists and I work here on this virus and try to figure out the best way to inhibit its attachment so it can't replicate, or inhibit its replication so that it can't stimulate an immune response, so it kind of stuns and dies in its tracks. Or if you get an immune response that needs to be addressed, that we correctly treat it with the correct medications that calm down and bring that immune response under control while we deal with the virus and get it under control.
So just to be clear, the coffee doesn't work.
You got it.
I'll tell you what's so funny. Since he said that to me, Dr. Fleming, like every time I get in the car, I'm like, I'm making my coffee. I take my sip. So you're right. I take what someone says to me and I live by it for the last 6 months. And I'm like, I got my hot coffee everywhere I go. And I'm swigging it around my mouth, taking that. But you're right. I breathe through my nose. I breathe through my mouth, and yeah, I have a crazy respirator mask on, but it means nothing. A lot of stuff is still getting in there, especially viruses. I saw a great photo the other day. Someone said, next time someone tells you that your N95 mask is effective, and they showed a picture of what virologists wear when they go into a room with viruses. It looks like spacesuits. They've got air coming in and out. I'm like, oh yeah, no, my N95 respirator mask is really doing something for me. Guys, build up your immune systems.
And the reason for that is because we take it seriously. These were the level. These BL4 level biohazard level 4 virology labs. The suits are worn, the air is pumped in, the air is pumped out. You're working under a hood, which suctions out the air in the area that you're working anyway. Typically, you're working with hands through into glove components where everything's been put on the inside.
So that's a double fold.
What?
So that's like double fold. So you're not only putting your hands in there, but and you also have that spacesuit on. So they are so prepared to be in that room that they're not just going in there and just putting their arms in. They got a hyperbaric chamber wherever everything's in there safe, but they're also wearing the suit too and putting their hands in. That's how dangerous these viruses are. I have a couple questions for you. I want to that they came on the side here. Let's see if we can get into them before, because I don't know how much time you have.
I'm open right now. I'm on a go. It's kind of like being on call.
Oh, I know. That's the thing. You never know.
I go.
So I just want to share a few things. Rebel Heart, love seeing you on. Head over to YouTube. Join us, Rebel. She just said that you can get shingles later. I think that we were talking about something earlier, and she said you can get shingles later on. She said,
so shingles is what the chickenpox virus is, and when it comes out, that is called herpes zoster, or what the lay public calls shingles. But herpes zoster is what we call it medically, and that is the chickenpox virus, the varicella virus coming back out. We just have a different name for it when it comes out along the dermatomes, and herpes zoster, and all of you call it shingles.
Very interesting. Next one along the line here is Rebel also asked if fetal tissues are used to grow viruses to produce vaccines.
Oh, God. Okay.
Okay, that's the lead in.
So that becomes one of the other issues about viruses and how clean are they. There are some vaccines that people have reported that there is potentially human fetal tissue involved in those vaccines. I have seen reports on both sides of that. I think that that comes out of the idea of allowing the viruses that are being used for the vaccines to replicate in human culture cells for the people that are obsessed using Cook's postulates of culturing and growing within cells. Although what we're seeing with this vaccine for COVID-19 is not something that would be cultured in cells, majority of it, but they're talking about just taking the genetic code, the mRNA, and injecting that into people. So from the point of view of whether there would be human, because I think this is the question, I think we've all seen or heard plandemic. I know Judy. I've spoken with her several times. Actually, the inflammation and cardiovascular disease theory that I developed, she has used on multiple occasions to explain what happens. And she was using my theory before I ever knew her. That there are undoubtedly contaminants in some vaccines that have been produced. I would doubt that that would exist for a COVID, that they're going to use the genetic material, because I actually view this as more dangerous than if they were doing the old style and maybe had contaminations in it. That's how concerned I am about the potential of the direct injection of this genetic material, because this is the first time we've actually talked about specifically delivering genetic code of some other organism into our cells.
Ever.
And ever. And the mechanism is equivalent to using a bacteriophage, which is a specialized virus that inserts genetic codes of the virus into bacteria, hence bacteriophage to inject. So bacteriophage to inject into a bacteria, and it's a virus. So I have, taken aside from all the discussions about whether the virus provides a benefit for people, which I believe I addressed earlier in what we were talking about. Then you get into these other questions about safety and efficacy. We kind of hit on with herd immunity, because that's what you have to achieve efficacy. Okay. And then there's the other efficacy of, do people make the antibodies? And there's more supporting data that they will make the T cells, the cytotoxic T cells, than they might the antibodies. But there's evidence that both will be made. So then that efficacy question is addressed. Then the question is, will you achieve satisfactory herd immunity? And shooting for something that you're going to say 50 to 70% effective is not going to get you the herd immunity that you need to impact something that's transmitted from one person to 10 other people. And if it's not that alarming, then we don't need to be worried about mass or 6 feet. But the reason why that has all come into play is because of how many people will you spread it to? So that's the efficacy issue. And then the harm issue has to do with the topic of, is it safe, or what I would view as harm? Because that's really the question. You're not asking is it safe. What you're really asking is whether it's harmful. We like to take that positive approach of it's safe, when the real question is, will it harm people? So this is where I will take and not go with the positivity approach, but the do no harm approach. And that boils down to whether there are contaminants in the vaccine, how clean is it? What are those contaminants? What are the consequences of those contaminants? And those questions. Yes, I forgot who you said asked that question. I don't have my glasses on. Yes, there are some vaccines that supposedly have that. Would I view that as a bad thing? Yes, I think I would say that's a bad thing.
Especially if you think about where those, the fetal tissue is obviously coming from, most likely an aborted fetus, right? I mean, most time they're using fetuses.
that's where, I think, so then I have to split those two things up into saying, okay, so there's the emotive issue of an aborted fetus, and there's the issue of simply being cells from something that's died, that is in and of itself an antigen. Okay, remember, this is like an organ transplant.
Mm-hmm.
This is, you're going to inject it into somebody, and it's going to be recognized as foreign to that person, and that is going to mount an immune response. But it's going to mount an immune response specific to that, which isn't the thing that you were trying to get an immune response mounted to. You were trying to, presumably, to some other virus or some other bacteria. And if you're mounting an immune response to multiple things at once, how effective are you going to be in mounting a true immune response to what you say you're vaccinating somebody for?
Rebel came over into the house with us, Doctor. Okay, so Rebel's here with us on Facebook now, and she asked if there are any heavy metals in the vaccine, or in the vaccine, or in the vaccines. I think she meant this vaccine, if you've heard anything about it, in the RNA.
Again, if I don't know. The bottom line is that I'm not in the group.
So you have no idea really what's in there yet.
So people use the term heavy metals in more than one way. I use heavy metals from the perspective of what a chemist and a physicist would use, as opposed to what I think you might use. So I don't consider aluminum a heavy metal, but I know that that's probably what she is referring to, because that's one of the ones that's most frequently referred to. So I don't consider it a heavy metal, but it is a metal. So, and of course, it's not something you want in there. I will tell you that there's a lot of things that get injected into you that that have things added to them that are not what you would expect. If you've ever seen somebody get D5W, which is dextrose 5% in water, or 5 grams per deciliter of water, or sugar water, when that was originally formulated, it is like sugar that you boil in a pan, caramel. It's caramelized. It has that color, okay? And the original D5W solutions in the IV bags is caramel colored. But the population freaked out when they were given that by vein, because they saw brown stuff going into them, and they didn't want that because it's brown, it's bad, it's got to be bad. No, it's D5W. It's the same thing you're getting in the clear solution that you don't oppose, except that acid is added to the IV bags to take and shift it from a caramel color to a clear color.
Interesting.
So acid is added so that patients won't
freak
object
out
to having D5W. Now, the point of that is, when people talk about not wanting things added to solution, here's an example where something got added to solution because people couldn't leave well enough alone and go, well, okay, it's brown and it's sugar water, and that's just the color of sugar water, you know? I mean, people drink, you know, soft drinks every day, and most of it's colored soft drinks, and you don't think a thing about pouring that into your stomach. I do, because I don't drink soft drinks. But you know,
but you're right. People they just a Coca-Cola,
right?
Just
so
throw it down the throat.
And I include that just to, again, because you know me as a scientist, I'm going to put it all out there and hit every one of these topics, because I think it's important for us as we critique things. I think that
we got
adding the metals obviously can have some effect. The question is, do you reach a level at which that produces a toxic response, and why is it there? You know, is there aluminum already in your body? Probably not, but there are things like iron, and you know, even calcium is to an extent. Well, never mind.
Well, I think Rebel added in, she said trimerizole and mercury, but then also, I mean, obviously our tie-in to autism and to, I don't know when they made that a law where you can't sue someone for a vaccine injury, but when you are not held liable for anything you do wrong, I don't know why you would have any safety precautions. It's just like, whatever, I'll throw mercury in there, I'll throw whatever the freak I want in there because no one can sue me. And
clearly I don't agree with them being held faultless.
Yeah.
I think that I mean, somewhere, and I think we've gone into this before, somebody got a deal somewhere in a back room.
Oh yeah.
For this, because if the people that signed off on that had somebody they cared about get a vaccine that had a consequence, they would be very, very upset. And I don't know how obvious this is to people, but you know, in 1976, after when I was out of high school, and I was working as an orderly because I thought I should work as an orderly because I thought that would be good experience for me to get if I was going into medicine, to see that side too. I actually had patients that had Guillain-Barré because they were given the swine flu vaccine. And 60 Minutes, I think, did a very nice special on that, where I think they stopped the population of the U.S. population when they had vaccinated 25% of the U.S. population. And Guillain-Barré, which is a neurologic abnormality that occurs and occurred as a result of the vaccination of people with swine flu, which was also a wonderful effort by the United States government to push through a vaccine. So when I hear all the other things about all the added components and fetal cells and metals going in the vaccines, I draw very much upon that personal experience of the people that I took care of as an orderly, who had Guillain-Barré syndrome, who couldn't walk. Some of them had great difficulty breathing because it was impairing their neurologic functions to their muscles, all because they had been vaccinated for swine flu H1N1, which is just one of the many varieties of the flu virus. It's come back since then. It will come back again. But I think that I think it's unconscionable to say that you can make a product and not be held responsible for the harm of that product. Period.
That's it.
Under you know as now as an attorney, I would tell you that it's unconscionable to me. It's even more unconscionable as a physician that big pharma, I don't care who's paying for it, can produce a product that can be harmful. I mean, you know that I have taken on big pharma, not as successfully as perhaps I should have, when one of those big pharmaceutical companies exposed people to 2 doses of radiation to have cardiac tests instead of 1 when only 1 was needed, and exposed people on the planet to 3 million extra curies of radiation, missed the opportunity to find critical heart disease, and made $20 billion in sales as a result. I do not think that these companies should have escape mechanisms.
But they do.
And I think it's unconscionable to give them a freebie out that you can't be sued, and then to mandate
a forced vaccination
of any sort, including in children.
Absolutely. That's my...
And I do believe that children should be vaccinated for certain infections, because I think you should all see what diphtheria and these other infectious diseases look like. The heart damage, the GI damage, the neurologic damage that these viruses do need the vaccines for these things. The paralysis from tetanus toxoid, if you pick up tetanus and you've not been vaccinated for it, can kill people. But by the same means, these are dangerous diseases that can severely impair long-term impairment. They're not, the viruses aren't killing the children. They're keeping them around with permanent brain damage, heart damage, lung damage, neurologic damage, kidney damage, or they're killing people with tetanus toxoid and paralyzing them and dying them. Those are the types of vaccines that provide a benefit, but they too need to be a clean vaccine, and they too should be held responsible to a standard that you can't make a defective product and get by with it, because if you're going to sell a product, you need to be responsible for that product. The problem with COVID-19 is I've been presented with no reason, with the explanation that I just provided you, with the time sequence for how these vaccines work to develop T cell and antibody responses, for the time sequence that's going to happen for people when they then get exposed to the COVID-19, for the harm of not being able to pay attention to the inflammothrombotic response, because you won't be seeing these patients because they're all going to get vaccinated all at once. You were worried about a flood on the hospitals and needing to flatten the curve. Well, you go vaccinating everybody, and if it has any of the potential of gearing up the inflammothrombotic response as the native COVID virus does, you won't need to worry about how many hospitals are overloaded or, as it is today, empty hospitals, or hospitals that really aren't verging at the. You will flood the system with people dying from the inflammothrombotic responses that are not being addressed because you just decided to vaccinate everybody en masse.
I think that's a good point. Obviously, I'm not an anti-vaxxer by any means. I do get nervous when I see the autism rate has gone from some crazy like 1 in 30,000 kids to 1 in 8 or 1 in 6, and they say 1 in 2 by 2030. That to me reeks of a pharmaceutical industry that cannot be held accountable for their product. To your point, if you're selling a product and you're injecting it into human beings, that should be held at the highest regard. And if there's something wrong there, like it should be, it's run through the tests. We know X, Y, and Z. When you go to buy your products, when you go to a CVS, it tells you every little thing that's in there. If you want to read through the paperwork, you should be able to have all that information. Always.
COVID-19, everybody I think thinks that when somebody comes out of the hospital with COVID-19, it's over and done. The data is very clear. I've talked about this inflammothrombotic response. Can you still hear me?
Yep.
Okay, I didn't know. I was getting silence.
Oh, no, I'm listening. Yeah.
But there is now very good data showing damage to the heart, what's called myocarditis, from COVID virus particles causing damage to the heart proper of people that haven't died. And that myocarditis is going to present itself with worsening and damage to the heart over time, producing weakened hearts, just like viral cardiomyopathies. That's where it gets the term. A virus causes a weakened heart. It does that by causing inflammation of the heart. That inflammation is called myocarditis. COVID-19 causes myocarditis of the heart. They're now seeing it in biopsy specimens. Kevin McCarran, who is a neurobiologist PhD in Japan. Kevin, if that's not the exact degree, I apologize. But I know it's neurology, and he's a PhD, and he's very tuned into what's going on neurologically. And I think he suspects that there's long-term sequelae that's going to occur neurologically. So anybody who thinks that we're seeing the end result of this, that we're not going to see the long-term sequelae effects of this virus, needs to think again. There's going to be consequences of this virus staying in people's bodies, having long-term effects, which means not only are we have to look at the long-term health effects of this virus in the people that do respond, and we're going to have to treat the, quote, heart failure, and we're going to have to treat the neurologic manifestations if we're going to minimize them. But you also then have to realize if that happens with the native virus, it's going to probably also happen with a vaccine of components of the virus, which means you cannot determine safety and long-term outcomes of this vaccine by November 1st.
There's no way.
Of 2020, or probably even November 1st of 2023.
Yeah, I mean, there's a very real possibility that this timeline of 2025, they're still looking for that right fit. You know, I mean, this is where we start to think about the bigger picture here. Is everybody still gets this? It is something that is killing a lot of people, and the key people, you have to make sure you get right to a doctor, and you have them keep you moving. And yeah, you got to look at this last video we had. You gave us a breakdown on what you said interferon. You had a bunch of other drugs that you said could work and could help. Again, there's no cure, guys. There's no cure. What you're doing is treating the symptoms, and if done effectively, people won't die. But the scary thing that's real is that this thing is not going anywhere, and whether you stay safe for a year, 6 months, 5 years, you could still get it. It's gonna be around, just as SARS-1 and everything else.
And you're doing more than treating the symptoms. You're trying to control the body's response to the virus so that the body doesn't cause harm to itself while dealing with the virus. You're trying to prevent that from happening while you get on top of the virus and let the body's immune system get on top of the virus and get it under control. And I didn't mean to shorten what you were saying, because what you were saying was very important. This is something that's going to be around long term. But you have to know that. You have to understand. You have to be educated about these viruses, because the general public right now is so fearful. They're going, please God, just let this go away so the world can be safe again. Guess what? One, it's not going away. Two, the world being safe again has nothing to do with this virus going away. The world being safe again is recognizing it's a virus, treat it like a virus.
You can't stop living.
Treat it, let your body respond. When for the people that have bad responses, you get treated to stop the inflammation of the blood clotting so that you don't die from it, and you will get over it. And there will probably be long-term effects to that. But there will be long-term effects to pneumococcal pneumonia. There will be long-term effects to meningitis that occurs in college students. There will be long-term effects to tuberculosis, to histoplasmosis, to chlamydia, to help me with one of the other syphilis.
But no, what you're doing is you're trying to explain to everybody that no matter what hits you hard, you're going to have long-term effects.
You will have long-term effects. You need to be taking better care of yourself to have the best health you can. You can't go back into hiding. Unless you've decided that 2020 was the epitome of human evolution, and we are now all going to go and fight for the caves that are left or the trees,
Underground living,
which I can't imagine that the rest of the animals are going to allow this to happen. I imagine them going, oh no, you fools got out of here a long time ago. We're not letting you people back in the forest.
I'll tell you what, if that was the case, Dr. Fleming, I would, for the first time in my life, be saying that Joe Biden is a genius. He's already started. He's already there. He's a groundhog, people. But Rebel's still kicking into here. She said that wouldn't the elderly people be greater at risk? And then she said, how do we support our immune system? You just mentioned that. So maybe you can give a couple tips to people in order to keep their immune systems up during this. And then she said, is the bubonic plague coming? I don't think so. It's never gone away. Same thing, Rebel. Like, one thing that Dr. Fleming has hit me with is that these viruses don't leave. They'll be here when we're all gone. And we just have been fortunate enough to stay away from the major ones. But bubonic plague is out there. I think it showed up in Colorado recently, right? Yeah.
The only difference between COVID-19 and all the other infections
is we're dealing with COVID.
Is that you paid to have it human intervened upon and changed.
Say that one more time. I missed it.
The only difference between COVID-19 and everything else that mankind has been dealing with is that this is the first time humans have played with it and made it different than what it would naturally be.
That's a very, very good point.
Now, guess what? Your immune system is still going to respond to that. Everybody's immune systems are still responding to that. Uncontrolled and unchecked, these immune systems have been killing people because the doctors have not been paying attention to what I first talked about in 1995, and I could bore you with all the other dates that I published on it. They didn't pay attention to the people who published on how to treat people on ventilators for the inflammation in the lungs called ARDS, acute respiratory distress syndrome, in these individuals, and subsequently people have died. Misinformation, a lot of people throwing out stupid stuff that has nothing to do with reality, but wanting to somehow become an important part of the discussion. That seems to be one of the problems, is that I think social media and Twitter and Facebook has somehow empowered everybody to believe that every little thought and opinion they have on every little topic is important and significant. You know what? If I'm talking to you about what to do for the economy and to change the stock market, and you're stupid enough to listen to me, you deserve the outcome that you get, because I'm not a stock expert.
Yeah.
Okay.
Hey, you got to buy that Moderna stock.
To me, and I don't have a right to be giving you my opinion on what to make the stock market do.
Yeah, that makes a lot of sense.
I don't personally believe I have a right to disseminate a bunch of information, whether I have any evidence that I'm right or not, because it's going to impact somebody. So my social patriotic duty is to literally be quiet and to not confuse the scenario. For all the people that are really not scientists working on this and really not medical doctors taking care of this type of thing,
leave it out.
I appreciate you want to be a part of the conversation. But the dissemination of just about anything you hear without the scientific validity of what it is causing more confusion.
That's accurate. Absolutely.
Which is dangerous. And it's causing fear. It's causing fear.
It's causing fear for sure.
An 80, again, using my example, an 80-some-year-old woman should not be deathly afraid of a 3-year-old girl coming next to her.
That's so true.
But that's what we have.
That's what we have right now.
Right? And so...
Our Real Talk brother Sig has one about 1918 flu. I was going to ask you something about this. He said that the 1918 flu people survived on a spoon of baking soda. I was going to ask you, do you think the people that died in 1918 from the flu, do you think that they mostly died from the thrombosis as well? Do you think there's a lot of the same thing? Is this something that they're because you said they realized with the standard flu that 12% of the time.
Yeah, and baking soda didn't do a damn thing for them.
That wasn't it. So people just died.
I had that conversation earlier today.
You did?
Okay. And baking soda and the pH of your body doesn't have, and I'm sorry, you can now tell where I'm at in this conversation, doesn't have a damn thing to do with this virus. Okay? Nothing. Nothing.
And you think, so if there was 20, 50, 70 million people that died in 1918, you think a lot of them died from thrombosis? They died from the fact that
I think they died from inflammable thrombotic diseases.
Wow.
Yep.
That's so telling.
And that's what's now coming out. This is the thing why I mentioned about the myocarditis. This is the thing where people are reckoning now in the medical field of maybe we need to be figuring out why these people's hearts are not pumping as strong as they should be. Getting biopsy specimens of the heart, which means we're seeing the virus in human living tissue having an effect, causing damage. This is why they're now recognizing that about 12% was, and this was the first paper. So when the first paper came out where somebody started looking at it, they said, well, wait a minute. In the last go round of influenza A, how many of these people had heart attacks from blood clots? 12%. Wow, nobody knew that was going on. But guess what? Inflammatory thrombotic process. Okay? And it's geared up by the immune system being activated in response to an infection.
And you also, again, there's no positives to COVID-19, but it is interesting that more information was uncovered while discovering COVID-19 and about the flu of all things.
Yeah. Well, and this is so, despite the fact that this was a human intervened upon virus, despite the fact that they got more than their money's worth with all the people with comorbidities. One of the first things I said, and you can go to that FMTVDM and Wix page under COVID-19 when I start talking about it, is this virus provides us with a huge, huge data source to learn from. This is a virus that has more genetic code than RNA viruses usually have. And yet, and the reason why they tend to have shorter genetic codes is because the shorter the genetic code, the less likely an error, the less likely it will extinguish itself. Yet this virus seems to have mechanisms for longer genetic code and to not have problems reproducing itself. As a scientist, that tells me that somewhere buried in this genetic code is a key to correcting genetic errors. And cancer is the result of genetic errors occurring in cells that are not caught, and the cells run amok. So COVID-19, believe it or not, as we dig into it more, holds a great potential to find answers for cures for cancer.
Well, that's interesting too. But then they're going to kill everybody who finds those. The FDA, right?
I'm sorry.
I think when Charles came on here to talk about 714X, he's like, yeah, every time someone has a cure for cancer, they kill them. So, I don't think it's a good thing to come up with a cure for cancer. because they will murder you.
Well, since cancer isn't just one disease, it's, and that's,
that's
when
true.
people says, do you have cancer? My first question is,
What cancer?
what type?
Yeah.
And then when I get to a body part, it's what type?
What type?
Because there's multiple types of cancers for,
For different
breast
types of
cancer,
body.
thyroid, you name it. It's not just one thing. There's not one type of leukemia. There's not one type of lymphoma. There's,
Lots. That's what
so
makes
it's
my
not
joke
like
funny.
one thing. What?
That's what makes my joke really funny when people are so anti-Trump. I say, look, Trump could come up with a cure for cancer, and the left
Yeah.
would say, yeah, but it was the wrong type of cancer.
That's cute. That's cute.
Right? I can imagine that. I could see CNN running with that one and be like, Trump comes up with a cure, but he like the crappiest cancer of all. Like, what a terrible president. I can totally see
Yeah.
that. Rebel asked if COVID was man-made. No, it wasn't man-made. It was man-modified, man or woman modified. And there's a very good chance, and they're not talking about it, but there's a very good chance it started in the United States, or it was a joint effort between, what'd you say, Fort Detrick and Wuhan, where they worked on this
Yeah,
together.
and there was some evidence dating back to Duke University
Duke University as well. Interesting.
in the early era. One of the things that's interesting, the Chinese, when they first provided the genetic code sequence for COVID-19, took it from multiple patients, all with the same symptoms. And then what you do is you do the genetic sequence for the genetic material that's there. And so you can tell whether the genetic sequence that you're running is human, because we already know what the human genome is. That was completed in 2003. A lot of intensified work that brought great discoveries and methods of accelerating the process of sorting this out occurred to allow that to happen.
How big of a task was that?
Code, and they were able to come up with the genetic code sequences from these different patients that all had the same symptoms, and compare the genetic sequences to find out that the genetic sequences were coming out of all these patients. This is Cook's Postulate 1, 2019, as opposed to cell culturing viruses of Cook's postulates of 1890s, which was all they had then. But we have sophisticated since then, and we know how to read the genetic code and find out what's really there. That's what determines what you are, what I am. Our genetic codes are different. They express different things. So we look different, we smell different, we act different, we respond to things differently. So they compared those genetic codes, and what they were able to do is determine the similarity of 99.9% genetic material between one of the reports I saw between 5 different patients. And then they compared that genetic code with SARS-1 and with MERS. And I think there was only about a 48% similarity with MERS and about a 78% similarity with SARS-1. That's a substantial difference in genetic material. I mean, there's a difference between humans and chimpanzees is,
1%,
some
right?
fraction of a percent. And yet these things are like 20 to 30% different in their genetic codes. So you can tell it's not human. You can tell it's specific. You can tell it's COVID-19. It's now identified itself. That's how we can tell the mutations, and where you can tell where a person got their COVID-19. Which mutations do they have? Was it from Wuhan? Was it from Italy, like the ones here in LA, or from Italy? But the ones from Italy came from Wuhan, and there was genetic shifts that occurred between Wuhan and Italy and the United States.
Wow.
And so I'm not sure where that was with the question. I know there was a question there, but we get into the genotyping. What was the question?
Well, you know what? I mean, we definitely were rolling on it, but I just was thinking, while you were talking, I was curious, how huge of a task was that and an accomplishment to map the human genome?
Well, when they first started off with it, substantially more challenging than once they learned, because one of the things that was learned with the people that were working on genetics is really how genetic sequences are made. One of the pieces of misinformation that had to do with people saying that COVID-19 was nothing but chromosome 8 from people, was people talking about the primer, the reverse primer, and the marker that was being looked for. And what you basically do is once you get the genetic sequence of something, there are certain start codes that are genetic codes that tell the RNA or the DNA where to start replicating, or the proteins to start being made in the ribosomes. They're called start codes. And there are stop codes that basically say, okay, we're done making this. And then you've got all the other codes, and there's 64 of them total. So there's only 64 to make everything from, based upon the 4 peptides or nucleotides. And so when they first started on that, you know, the information was basically you always make the genetic material or the protein from the 5' to the 3' end. And that's the forward primer. And so you can tell where to start. And that's what they're testing for with these PCR tests, is anything that starts at the forward primer and ends at the reverse primer. But the reverse primer does exactly that. It reads in reverse. So it reads from right to left. And so chromosome 8, which the people said was the bombshell, reads from left to right, and the reverse codon reads from right to left. So it's just backwards. And so it showed that they lacked the knowledge of immunology and of the field in general. And the important part is that the reverse primer can only make bits and pieces of the genetic code, and then requires other genetic material to splice those pieces together. And the entire time that these polymerases are splicing everything together, they're also doing something that we didn't realize before, which is that they are checking and correcting for errors in the code. And part of how they do that is they measure the width of the DNA helix, and if if the right nucleotides don't match up, it will produce a bulge in the width, and that will be detected as an incorrect width. And at the same time that they're trying to build DNA or RNA, those errors will be removed and restarted again to introduce the right thing. And all of that information allowed them to learn how to accelerate the process of running genetic code and replicating it. And with that process, to more rapidly determine multiple segments of genetic code simultaneously. And it was that type of thing that allowed them to accelerate the process of building the human genome, because before they got into that project, we were really just stumbling in the dark on, okay, we'll put adenine here and thymidine there and guanine there and cytosine there. But now, you know, we can do it much faster. And that's why, you know, PCR tests, which are an amplification method of taking in this case, the RNA and making DNA from it and amplifying it, you know, over the course of an hour, you can now make 1 million copies. And then you can get a fluorescein probe on there, which then signals a positive genetic sequence that is detected. And it's that ability to do that, you know, raises questions about, okay, so it's not as much, it's diagnostic in that it tells you that the genetic code from the virus is there, so you have the virus, but it's not diagnostic in that it doesn't really tell you what that means for you, or how symptomatic are you going to be, do you need treatment, what treatment, that type of thing. So
it's like a multiple choice. It's like yes or no. It doesn't share.
Yeah, it's on off. It's on off. Yeah. Do you get the fluorescent stain light or not? But you know, prior to doing the human genome, we didn't have that type of knowledge base. That was a learning process curve. And now, for all that money that was spent that people bellyached about being done because the scientists wanted to do it, Well, that was a lot of information we got. It also helps us know the difference between us and viruses and bacteria. And it gave us this vast knowledge base to allow us to rapidly gear up this type of stuff.
Well, you answered my question.
Yeah.
I was gonna say that is what you got was information.
Huge.
Yeah, absolutely. Rebel, I think I'll answer this for Dr. Fleming. She asked if it didn't come from a bat or another animal. I had heard in 2012 they found COVID-19 in a bat in China, brought it to maybe Fort Detrick, Duke University said possibly Wuhan, and they modified it there. So it was originally from a bat, and then us playing God, human beings, decided to see what we could do with it. And listen to what Dr. Fleming said. We still have caches of smallpox. Why? Why would they not just completely demolish that from the face of this earth? Because somewhere down the line they're going to need to use it.
It's science is really kind of a catch-22. I mean, you're looking at somebody who was taken in 7th grade and placed into a doctorate training program with the JFK administration. Yes, JFK, for the people that are looking, was dead, but his administration started the money movement for this project. Okay? He got assassinated in 1963, for those of you who don't think that I know about it. And I know 3 of the doctors that were there when his body was brought in. So
really, we should talk about that.
It's not lost on me that, he wasn't alive when I started my program, but the money that was laid out for it and the plans had already been placed in the early 60s.
That was like a legacy, right? Wasn't that kind of like a legacy for Kennedy?
It was a legacy for Kennedy, and I think the government, they got their share of little mutants like myself that are scientists. So my research career did begin in 7th grade. Thank you. For those of you that have noticed and complained about that being too early, I guess, for a human being. I don't remember them asking me whether I wanted to begin. I remember being taken out of the room with the other people and started. If you don't think that happens, if you don't think the government just arbitrarily decides to do things, I want you to just all take a look around you right now and see what has happened.
Not to mention, guys, keep this in mind. They have always been looking for an edge. And especially when Dr. Fleming was in school, he's growing up, you're talking about a time where Russia's trying to do things, we're trying to do things. They were looking for the brightest minds in order to try to have an edge. So
the things that were going on in the United States at that time was Vietnam, space race, and riots.
And all of it was...
Do we empathize with any of this today?
Yeah, because again, it's all about gaslighting. Everything that's going on now was what they were doing then. They lost control for a few years. We know it's all a shift in order to try to get power back. You don't like to talk politics at all. I hate talking politics, but I feel like it's a common sense thing. This entire thing just seems like, okay, you have the worst candidate in the history of time, and you have to just do whatever you can to try to fool Dr. Fleming into voting for a sleep sofa. And it's like the whole world is saying the same thing. And then you have half of the world hating someone for lies, really, and for editing, for phenomenal editing is the way I look at it. I don't know. I've been asking people to do one thing. If you are a guy who's in the camp of I hate Trump, do me one favor. Find your 5 favorite, torch and burn clips of Donald Trump from CNN, from MSNBC. And then just do me one favor. Take a note of the tie he's wearing, the background, whatever, suit, and the topic. Type it into Google and to YouTube. Watch the entire clip. And you'll have one thing go through your head. Geez, that looks a little different. It's never the same, guys. There's always more they don't want you to see. There's always, they're setting us a lot of murderers and rapists for these Mexicans. They're also setting us a lot of good ones. They don't show you that part. They show you that and then CNN goes on and gaslights. Yeah, he said all Mexicans are racists, they're rapists and murderers. And when you hear that and you don't watch the guy, you just hear CNN say things, it becomes so powerful. And if you've not seen, I'm going to play this when Dr. Fleming leaves the show. I'm playing you guys episode 25. It's the final episode of the Trump Show. And you see this clip. Somebody brilliantly put this together. It shows you every single person on the left and how they've been the ones saying, why aren't there people on the streets rioting? And why aren't there people? Pelosi and all of them are pushing for rioting on the streets. And now when they see that this guy's poll numbers are going this way, they start saying it's Trump rioting in the streets. So it's just, the hypocrisy is just silly. It's silly and it's common sense to me, but the world is blinded by the lies. And I just want to say thank you to Dr. Fleming for trying his best in order to cut through all the bull crap that this government, and it's not even the government, it's the media circus, is throwing at us in order to keep us on edge. Thank you for doing this, because it's crazy. They're censoring me.
Yeah.
Dr. Fleming said a really funny note last week. He goes, hey, they didn't censor our shows. And it's so true, because he's speaking truth, first of all. But secondly, you know why they censored me, Dr. Fleming? It happened to be the 3 days they censored me for COVID-19 false information, where apparently I discussed the origins of the Fluhan that day. Never discussed COVID all 3 days. It was a music night and celebrity impressions. But what I did those 3 days is I dropped a Donald Trump show. And I realized they don't even know what my show is. They just see Trump and they rip it down. They're censoring me for what they assume is somebody pitching Trump. Well, it's just a comedy show, but still, they pull anything down that says Donald Trump or is Donald Trump. And I'm scared for that last month of this process where you're not going to see me. There's a very good chance you guys won't see me. You'll be like, oh, Mark decided to stop doing Real Talk? No, I'm here. Search me out. It may not be YouTube. They may cut me on YouTube, Facebook. I'm everywhere. Just look for me. Don't think I stopped, because I didn't. I will be here. Dr. Fleming is going to teach me how to stay alive from this thing if I catch it. And then outside of that, I will find a mountaintop, Dr. Fleming. I will be on a mountaintop if I have to. Ooh. Oh, Rebel Heart wanted to say thank you for all of your work. And Trump said... Rebel said Trump never said bleach. No, actually, it was Windex. Look, it did it in Big Fat Greek Wedding. He didn't say that either, but it's my joke.
I remember that press conference, and okay, so I think when he said that the obligation of Burks was to stand up and go, right?
I don't think so.
But I also understand where my world is different than your world, where my world changed, as I said, in 7th grade, and yeah, I wouldn't change a moment of it. I wouldn't change all the benefits that I got from that. I wouldn't change even the criticisms that I've gotten. Every one of those has been an opportunity to learn and to move forward and to drive for more investigation. But that said, I do remember what all of you look like in school, not understanding science. And I understand how scary it is for many people, and I understand how easy it is to be afraid. Part of what I'm trying to do is to explain that some human intervention occurred that can't be undone. There are things that need to be looked at, like the inflammatory thrombotic response, that need to be addressed to keep people from dying. But by that same token, I really somehow need to get the message out there for all of you to quit being quite so afraid, to kind of get everybody to take a deep breath and ground themselves, or sit down, or whatever it is that you need to do to go, okay, that was surreal. And I need all of this to be reined back into medicine and science, away from all of you. I need you to be, I think, reading the book that I wrote so that you get what you need to know. But then I think that the next time this happens, all of you do not need to be involved in this. This is our job, not yours.
Absolutely.
I don't freak out. You do.
Yeah, Dr. Fleming said it best. If he freaks out, then you should be deathly afraid. But outside of that, most things, it's almost, my father's a builder. Before I got into real estate, I worked with my father for 13 years, renovating, building homes, working with clients, project managing, whatever. And I just remember thinking most times the answer and the solution, and this is construction, guys, so this will make sense. It's a common sense solution. Someone's like, oh my goodness, I saw that this thing. Okay, well, we just have to put a beam here in order to hold the weight. But everything is a common sense solution in construction. And people ask the stupidest questions in the world. And it just gets me to think, because I did that for 13 years. I look at it and I'd be like, really? And I'm sure that's how Dr. Fleming looks at people when they're like, oh, well, what if I drink coffee? Would it kill the COVID-19? And Dr. Fleming's like, are you freaking kidding me, Mark? But realistically, this is what I'm saying is it's a common sense response to a very, very controlled fear. Okay, the fear is very clear to all of us. It's a Cold War type of fear that they've just instilled on us. And Dr. Fleming's right. We should not be involved in disseminating false information. That's the scientists, the doctors' responsibility. But what we do need
to
is more people
disseminate false information
or disseminate information in order to give us the proper information.
I know.
Yeah, I'm sorry. We're almost at 3 hours.
No, but some of them are disseminating false
information. Yeah,
that's why
true.
I picked it that time for that show. Go ahead.
No, but I do think that what we're getting to is we need to be able to have freedom of speech for people like Dr. Fleming, because if they're being censored for speaking truth, and then you see Facebook going on pages and saying, "Oh, well, we have to false information on this one," that's a problem. You cannot censor a doctor, a medical professional who went to school and knows more than you, Mark Zuckerberg, and any of your censors. You can't pull down that information because you don't know what's right. And citing the WHO, the people who are in bed with China, I just don't. I'm having a hard time. And so this is why it is a noble effort for Dr. Fleming to come out here and to deal with the ridicule. Let's be honest, guys. Do you know how many people don't like to get the truth? They want to be fooled. They like to just stay in that bubble and just continue to think that everything's the way that they're told. But I choose to hear from Dr. Fleming. I choose to hear from Mary M. Hanane, who's going to be interviewing Dr. Fleming this week. And these people are searching for the light. And these are my friends. That's all I can say. My friends are the people that are searching for the light and trying to bring it to the surface. And I'll consider you a friend always, Dr. Fleming, for that, because this world, it's a short period of time that we get to spend together, but it is a reason we're here. Everyone thinks it's like a chance that we're here together. In the history of time, the amount of souls that have been on this planet, and for us to be here at the same time, there's a reason. We're here to try to do something, to make a change in order for us to continue on. Generations don't continue if we can't figure this out. Not the COVID thing, but this existence together.
Right.
So I don't know.
Yeah. There's a lot of the throwing around of the phrase of "we're in this together." I'm not sure how much I really think that's true. It sounds good. It would be better. It would literally be better if people would be thinking about how we can work together on all of the problems. And I really, one of the reasons politically, I've told you I'm independent.
Yeah.
And but in the true sense of the word, I dislike people on both sides of the aisle.
I do too, but you you have to agree with me that he's asleep sofa, right? I mean, come on.
I'm not going to make a political comment.
I know.
This is your program. You can do whatever you want.
I'm just joking. Look, I said today too, they both have issues. They're both, you could look at Donald Trump and say he's brash and he's this extremely obnoxious man who's a billionaire and grew up with a gold spoon, all these things. But you could also look at that same guy and say he doesn't get paid to get crap done every day for the last 4 years, and he's willing to do it for another 4. And then I know a guy who continues to have he can't answer a question unless he knows the answer. that's a problem, you know? So that's my biggest fear. Like if the guy could have a conversation, I would say this is going to be a tight race because this guy can fight, but he won't come out of his ground. He's a ground dog. He's out of the cricket ground. No, but, so I don't know. I try to stay down the middle because I'm like you. Like I really don't say I have a dog in the race. I do, I guess, lean more towards the idea of being able to make something of yourself in life and not be given everything and say, oh, here's that water. I want you to teach me how to freaking pull that water out of the ground. So I know that's more of the Republican mentality, is to teach people how to do things and not just to give them things and then to keep them down, which is more of that, you know, lefty type of mentality. But I grew up with the lefty mentality. I mean, right? What's that Churchill saying? If you're young and you're conservative, you have no heart. If you're old and you're liberal, you have no soul. Is that what he said? Something like that? I believe so.
Sounds good.
It does. But it's true. I mean, we grow through an existence and we change every 7 years, they say, but we change. And eventually you start to be a little bit more conservative when you realize that hard work means something, and getting given everything is not what it's about. It's about finding a way to create something of your own. Anyway, now I'm rambling at 3 hours. 2 hours, 45 minutes.
I'm sure my students would somehow have something to say about that.
Yeah. Anything else you want to add to, okay, right now we have 11 people with us over on YouTube. I love you all. And Dr. Fleming has been with us. This is the 4th trip around the sun, I say.
Are there any questions that, I guess I should put this where I can look at it? Any questions that anybody wants to ask before I wish you all a good night and a happy Labor Day?
Let's see if anybody has anything. Let me go back. This is just a response. Rebel agrees that fear and stress can lower our immune system. And yeah, I think we're there. And throwing a mask on is obviously not going to be anything good for you. Not taking in the natural. I mean, just breathing in the day. Isn't that something? Doesn't that give you anything for your health benefit to go outside and just breathe in the air? And is that anything?
I think everybody has a different perspective on what they need to do that is good for them. I've always been I grew up in Iowa. I've always been an advocate of getting outside and doing things. I have several degrees, and one of the things that I feel very comfortable on, although it has been way too long, is being out in the country. The thing that I think scares most people in big cities. When I was in medical school, we had people come to the University of Iowa where I trained as a medical student, and they would come from big cities, and we would show them what farm animals really look like. And you want to talk about scared humans. When you show them what a bull looks like that has a ring through its nose and is tied in because of how aggressive it is, and you show them how smart pigs are and how aggressive they are and how easily they will kill a child out in the field if they get to them, and how strong their jaws are. And you know, I always love it when people don't know how to ride a horse and then get around horses, because horses know. Horses are very smart, and it's always fun to watch somebody try to ride a horse who's never ridden a horse.
It's a confidence thing, right?
All of that. I'm sorry?
It's a confidence thing with everything in life, right? Like you ride a horse once, you ride a bike, whatever, but when you get to a point where your legs are not tight against that horse, you're not like grabbing. I've never ridden a horse, but I think I'd have to sit on that horse and pretend that I've done it before. That's the only thing.
Well, the horse would know. That's the thing.
Yeah.
And so I'll share something with you. This is completely off COVID-19. Here's a new thing for you.
I love it.
If you walk out to a horse and you want a horse to come, you do this.
Pat it on the chest. Really? Is that the sound of the heart?
No, it calls the horse.
Oh, okay. So like patting on the chest.
Yep.
Like
anybody who's never done that and never been around horses would not know that. And anybody, I mean, I remember I several years ago, there was a family and they wanted to show their kids the horses, and so the horses were out in the field, way away from the fence. And the family was going, oh, they're never going to get a chance to feed an apple to a horse because I bred apples. Okay, because apples, they'll eat sugar cubes, but they love apples. And I went, and you see the horses just come over to the to the
Wow,
fence.
that's pretty cool.
But the animals, no. Horses, no.
Horses are smart, right? Very
They are
smart.
smarter than some people,
That's not saying much.
and they're genuine.
The horses
They're
are genuine. Do you know what freaks me out about horses? That bowling
Their teeth.
ball eye. No, that
Their
eye.
what?
Their eyes are like massive. They got like a bowling ball as an
Yeah,
eye. I kind of want to stick it in there and just throw a strike. I'm just thinking, like, oh.
Jeez.
I'm just kidding. We know we have to keep a little humor here, right, Dr. Fleming?
Yes. They have adorable eyes. Okay, what wild stallions?
The wild stallions. Oh,
yeah, we used to. So where I grew up at, there was something called the Dairy Cattle Congress, and people from all over the world brought their livestock, including wild stallions, and we had a rodeo. So I grew up knowing people like Dale Evans and shoot, I can't remember all the names anymore. A lot of the cowboys, a lot of the cowgirls, a lot of the entertainers. I knew Sonny and Cher. I knew just a wide variety of them. Neil Diamond from growing up as a kid and working there. But they would bring the stallions. They would bring the Budweiser, Clydesdales. My father was raised on a farm with Morgans, which is a horse that's very similar to Clydesdales. They're beautiful, majestic horses. The one that my father had was blind from lightning that struck him when he was out in the field. And this was the most gentle animal, according to my father, because, of course, that was when he was a boy growing up. I never got to meet him. I saw pictures. But
I can tell you one funny story. I can
What?
tell you one interesting story about a horse. My father was born in Portugal, and he moved here when he was 6 years old. But when they lived in a nice piece of land in Portugal. My grandfather was the sheriff in town, and they used to mine for tungsten in the backyard. There's a great story behind all this too, but they had this horse, and the horse was so smart. My dad used to get on the horse, and he's like 3-4 years old, and he'd ride the horse out of the stable, and every time the horse would get to the door, it would get down on its knees, and it would walk out because my dad was on top, and it knew it could hit its head. My dad could hit his head on the top of the door. So the horse would actually get onto its knees, and it would crawl out of the stable so my father, the 4 or 5-year-old kid, wouldn't hit his head. That's a smart horse right there.
That's a very smart horse, and it shows you how compassionate an animal they are.
Absolutely. But that's the only horse story I know. My dad told me that when I was a kid, and I've always held on to that story as like a pretty cool thing to know.
That's a good story. The horse would not do that for an adult.
It wouldn't do it for an adult. It just could tell it was a child.
It would simply go, look, if you're not smart enough to duck, you would get hit. But
Wow.
I find the intelligence and the compassion of that horse, because your father was only 4 or 5,
Recognized that.
recognized that and took care of
It's amazing.
him.
It's
Yeah.
amazing. I love that. So let me see if there's people are chatting over here. They're talking about nano silver. I know you've discussed that before. I don't know what your thoughts are on nano silver.
There's no, but it's very strange to talk about taking nano silver for COVID-19 and then to criticize metals in vaccines.
Oh, that's a good point. That's a very good point.
But there's no data that shows that nano silvers provides any treatment benefit for COVID-19 or anything else. But that's just an important point to consider. You can't criticize it under one circumstance and bless it for another. It either is a metal with a toxic effect or it's not.
That's a valid point right there, because everyone wants to talk about, putting mercury and all these other metals into these vaccines.
I like to come up with a valid point every once in a while.
I like that a lot.
Keeps the critics off base. Off balance.
So Sig said Gordon Peterson says his ingestible silver products can destroy the coronavirus and help protect people from contracting the deadly illness. The Department of Justice says that is flat out wrong. I think you're right. Is it Gordon
and
or
my
Jordan?
comment on that is
Gordon.
Neither does Jordan Peterson nor the Department of Justice have any data on that one way or the other. Thank you very much.
Yeah, look, you know what?
They're not scientists. They're not physicians. They're welcome to have their opinions, but there's the problem with people entering their opinions on something that they don't know anything about.
And the other thing too, and you could agree or disagree with this, but in the 1800s, late 1800s, the snake oil salesman, you had a guy selling you something that he's like, yeah, did you see this thing?
We have new terms for them today. They have certain belief systems that they're still selling. But yeah, go ahead. I'm sorry.
Yeah. So what do they call them today? Is it still snake oil salesman, or do they call them something different?
Well, there's a whole group of them that I talked to this morning on one of my debates. But yeah, snake oil salesman is just
a good term for it, right? So basically, it's like, hey, I got this product that's going to cure.
Do you know how the FDA got into power? What really started the development of the FDA as a legitimate agency?
I'm just going to guess that they sold snake oil. I'm just kidding. What happened?
They used to try to help people deal with. Well, there was the issue of snake oil and alcohol in the 1800s, and that got some action by the federal government. But what really got it geared up was people trying to sell a diet pill to people in the early 1900s. And so they would sell this little pill, and you only had to take one or two, and you only had to do it once, and you would lose weight. And it was 100% effective.
Really?
Inside the pill were strongyloides eggs, intestine worm eggs. You swallowed the pill. The acid in the stomach dissolved the pill. The eggs hatched. The strongyloides attached themselves to your intestines. And all of the food that you ate, they absorbed the nutritional value of. So you got none, and you lost weight, and you became very thin.
Tapeworms?
Yeah. Strongyloides, tapeworms. Now, the FDA got into it because that's not healthy. And that really gave them the leverage and the power that they needed to say, we need a federal agency to control this inappropriate behavior, because see what is going on.
See what they did?
It's not something to control people selling garbage for money.
Sig kills me. So Sig kills me. Two things. Sig wants to know, he said you were just about to ask Dr. Fleming, what's the best to take for our immune systems at the beginning stages of COVID? That's one question. Then he's going back to another thing that we'll go back to after.
The same thing that you should have been doing before you got it.
Just eating healthy, exercising.
Improving your diet and lifestyle. If one of the classic things that I think people think about is zinc.
Yeah.
And the reality is that there's enough zinc already in your body, unless you have an unusual deficiency, to deal with the coronavirus. So that some of the studies that were done looking at hydroxychloroquine out of the University of Oklahoma compared virus loads, different viruses, in different combinations of chloroquine and zinc. And then they did immunohistostaining to look for the virus so they could see whether the virus was replicating. This is not COVID-19. This is before COVID-19. And what they discovered was that the addition of zinc provided very little impact. It added a little bit to it. Massive amounts of zinc added a minuscule difference. What was important was the chloroquine opening the zinc ionophore channel for the zinc outside the cell to enter into the cell to have its impact on preventing replication of the virus.
Is that actually like an inhibitor in a way? Is that what that did?
Zinc, one of the things that zinc does is it inhibits the RNA-dependent RNA polymerase, which is the enzyme that allows the proteins to be made, or the RNA to be replicated, and then for the virus to reproduce itself. It interferes with that process. But that means it also interferes for every process of a virus trying to replicate that way, not just COVID-19. So you probably already have enough, but the reality is you should be doing the things prior to COVID that are healthier for you. You know, for example, some people talk about taking additional vitamin C. Well, vitamin C is a water-soluble vitamin. So if you take more vitamin C, let's say today you take no vitamin C, and now you decide you're going to take 2,000 milligrams of vitamin C every day for the rest of your life. Will that have any benefit for you? And the answer is that will benefit you for roughly 72 hours because it's a water-soluble vitamin. So you will take 2,000 milligrams into your body that you hadn't been doing. It will take roughly 72 hours for your kidneys to figure out that you have more vitamin C floating around than you did 3 days before. Because it's water soluble, that vitamin C will now be excreted every day in the water going out in your urine because it's water soluble. And every day you take 2,000, it will just keep pumping that same amount out. Now, what will happen when you quit taking vitamin C? For 3 days, your kidneys will think you're still taking 2,000 milligrams a day. And for 3 days, it will constantly flush out vitamin C until at the end of 3 days, it realizes, whoops, you're no longer taking that much vitamin C and you go down. Why did the original Linus Pauling work look so confusing with vitamin C and viruses? Because crummy people were doing science and they weren't doing it well. And so some people said, look, vitamin C helps for the common cold. Oh, no, vitamin C doesn't help for the common cold. Well, what did it do in the end? When you put all the papers together by good scientists and lousy scientists, or people that wanted to pretend they were scientists doing science, what the data showed is that the duration of the viral infection was shortened by
Vitamin
3
C.
days.
Oh, interesting.
The amount of time it took the body to figure out it was a water-soluble vitamin being added, so you got 3 days. So instead of lasting 10 days, on average, it lasted 7. Well, how long do viruses really last? 7 to 10 days. So when you look at doctors or listen to doctors go, well, that didn't really help. It didn't because it's a water-soluble vitamin. Is it important in immune function? Yes, it has a role in immune function. But simply taking more doesn't mean your body's been fooled into keeping more. It's a water-soluble vitamin. So there's only 4 vitamins that aren't water-soluble. So all the B vitamins are water-soluble. All the stuff they talk about taking, oh, now take it, it's water-soluble. So for 72 hours, you've probably tricked the system. But after that, guess what? Your biological mechanisms aren't that stupid. That's how you are part of a species that has survived for all these years. It works. Okay, and the only vitamins that aren't water soluble are vitamin A, K, E, and D. Okay, and so what happens if you get too much vitamin A, K, E, and D? They're not water soluble; they are fat soluble.
So you just get
fatter. They build up in fat cells, and they cause damage to areas that have more fat tissue, which is brain tissue, heart tissue, those types of tissues, and that's why they cause damage. The damage that they do. It's none of this stuff is magic. It's all science. It's all medicine.
You just answered for Rebel. She asked about vitamin D. Yeah. So basically, Rebel asked too. So what you were saying. So basically, we have enough zinc in our system, and the combination with the zinc you currently have in your system, and with the hydroxychloroquine at the beginning stages, could have an effect.
The problem, and somebody had asked me this earlier today. Why not go along with the idea of taking hydroxychloroquine and zinc if it's not going to harm anybody, even though there may not be evidence to show that it works? And the reality is, you could make that argument then about sticking anything else in your body, because if you haven't showed it works and it maybe doesn't hurt you, does it do you any good? And I would argue that until you prove that something does good, hydroxychloroquine, or a vaccine, you have not impressed me with an argument that you should be taking it. Now, we've had enough people that have been sick that the only reason why we don't have good science about hydroxychloroquine and zinc is that you have a bunch of very pathetic people who don't know what they're doing scientifically and haven't done the type of research that they've done, but they want to convince you now that you should take hydroxychloroquine and zinc.
Yeah.
Well, just as much as I disagree with governors telling doctors how to practice medicine, I disagree with doctors telling you to take a product that they haven't proven is beneficial for you.
Yeah.
And I don't care who they are or how if even if it doesn't harm you, they haven't shown it helps you. So my argument stands whether I'm talking about hydroxychloroquine and zinc and zithromycin, or whether I'm talking about a vaccine. You have to prove to me, or anything else, if a medicine you're taking, or a treatment you're taking, or a diet you are taking does not provide a positive beneficial effect, then why are you doing it?
Well, that's a good point. I mean,
you have to get honest. Okay, zithromycin doesn't work by the way that they're talking about. It comes out in the book. There's evidence actually that shows that zithromycin is what's the virus that causes microcephaly that everybody was worried about a couple years that still exists? It's still running around.
Not meningitis,
but
that's not
Zika virus. That there's actually data that shows that zithromycin inhibits the growth of Zika virus, but it's not the way that they tell you that zithromycin works. It actually works differently than what it's commonly talked about, and there's a reason for that, and that's because if the drug companies fessed up to how zithromycin worked, then their claim that it doesn't have an impact on human cells goes right out the window, and you'll have to read that in the book to get the fuller explanation of that. I'll save that one for the book. I have to save something for the book.
Absolutely.
Kind of stuff to save for the book, trust me.
We may have to schedule a time in the near future to talk about the book. So that would be pretty cool. I mean, we explored a lot tonight, guys. Anything else real quick before Dr. Fleming goes?
Yes, Sig, I have my glasses on so I can read this. Zithromax is one of the trade names for azithromycin.
Okay. Same thing. And let's see what else we have. Fleming shoots down nanosilver, not colloidal different. I'm not sure what colloidal different is.
Colloidal?
Colloidal different.
Colloidal is are metals, and there's no data that shows that works either. You have to show me solid scientific data that something works, or I'm not going to go along with it. I'm sorry, I'm just not going to do it.
I love Sig. Listen to this, Dr. Fleming. Sig said, "Thank you, Dr. Fleming. I'm scared of you." I love that. Oh my goodness.
I went into a room once, well, more than once, but I remember a time I went into a patient's room, and when I do an examination with somebody, I do what I consider a fairly thorough, but it's not a thorough, but it's apparently much more thorough exam than most physicians do. And I was checking this guy's pulses in his feet, and I was explaining to him that that we needed to change treatment, that the treatment he was getting wasn't working, that I don't know why he was getting what he was getting, and changing the treatment. He says, you remind me of, who's the doctor on television that they do? House. He says, you remind me of House.
That's
and
hilarious.
I said, okay, wait a minute. I've seen that program, and I'm not sure which direction I'm supposed to take.
I know that's true, because he's a bit of an unhinged character, but I'll tell you, he's a great doctor.
And he said, just simply from the point of view of how thorough you are, and how it's obvious that your brain works differently, and you just slice through this and explain why something's not working, and why we need to change to something else, and why the treatment should work, and we're not going to wait as long as most people do. but we're going to have you back in a shorter period of time because I want to know if the treatment's working, So, I have a routine thing of a time sequence that I bring people back based upon what I'm looking for, and how severe the problem is. And I think people are not used to that. And then it's a matter of we're going to slice through this and get to the bottom of this, because I don't enjoy having people coming back to see me multiple times because something's not working. And I don't enjoy stretching things out over time. I really am a firm believer that your job is to come in and see me. You don't like seeing me. I get it. You'd rather be doing almost anything except going to the dentist. No insult for the dentist, but let's be honest. There's nothing you do that I like.
Yeah, because Sig's asking if there's any herbal that you like, if there are any herbals or any sort of...
There is no scientific data of any vitamin or mineral or herbal product that is effective on COVID-19. That being said, there's plenty of information out there talking about different compounds. The medicines that we do, physicians get a lot of flack for prescribing drugs because they're made by a pharmaceutical company. But they're almost always made by a pharmaceutical company after they're found in nature. The anti-rejection drugs, the FK506, which is what I know it as because that's when it was an experimental drug, was produced by a mold in a lake in Canada. And it was discovered because somebody found this pristine lake that was crystal clear that had nothing growing in it in Canada. And when they investigated it, there was this fungi growing that released FK506, and that prevents tissue rejection. It completely blunts the immune response, which, now that I think of it, would probably be one dandy treatment for COVID-19 because it would completely shut down your immune response. So you wouldn't get an inflammatory thrombotic response, but I think that's a little overkill for COVID-19. But every one of these is discovered naturally. I had one of the cardiologists that trained me when I was going through cardiology training used to tell me that he used to grind digitalis as a leaf in a mortar and pestle at the patient's bedside when he was in training, because all they had was the natural leaf that digitalis was in. And so they would grind it up and parcel it out in small scoops for the patient to swallow as a medication. Aspirin was first, I think, a product of a tree. These things are first typically discovered in nature.
Penicillin came from
then
phlox,
you ask yourself the question, is there something that's very active in this that we don't need to put everything else into? Can we make it in large enough quantities to be useful for it? Chemotherapy was discovered after we used chemical musters for World War I to try to poison the enemy, and then it was discovered that it also poisoned cancers. So it's not because chemotherapy was designed to poison people, it's just that it interferes with the replication of DNA, and cancers have to replicate their DNA to survive. And so the side effects of chemotherapy are seen in the cells that most actively reproduce, which are cancers, which you want to kill. But unfortunately, things like your GI tract that has to constantly be made because of the food you're ingesting, and the blood cells of your body that are constantly being used up. And so what do you see with people that get chemotherapy? You see anemia, you see low white counts, you see reduction of platelets, you see nausea and vomiting and diarrhea, you see the cells that are most active. So, was that being designed to cause problems to people? No, it was designed to affect cells that are reproducing themselves. As we get smarter, those treatments get targeted. But, nitrogen mustard was naturally occurring, as is arsenic and strychnine and hemlock. So just because it's not made in a lab and it's naturally occurring doesn't mean it's good for you. I'm pretty sure that a sufficient dose of hemlock will cure everybody with COVID-19 by killing them.
Exactly. Okay. So we discussed, I think, on the very first episode, something I want to just throw at you real quick, because you just said most of the drugs that they are using currently started in the Amazon or whatever. They started in nature. They were brought into a pharmacology. How do they call that? Is it pharmacology? Essentially, they just create a drug out of it.
Pharmacology means drugs. It doesn't mean poisons. It means drugs.
Okay, so they take these naturally occurring products and they bring them to life, and then they sell the product to you.
Yeah, they figure out what works. That means they have to do research.
They do the research first. So I asked you this a while back, and this is not, I don't think, has anything to do with this terrain theory stupid thing you were saying that it doesn't make sense, because you tried to explain it to me last time. But I do have a theory. I threw it at you once, and you've shot down silver. You've shot down a lot of other things like that.
I'm just saying there's no data to support any of this stuff.
No
and
data.
You have to think about this. Why would adding silver have an impact? This is where research gets started. When you design a research study, and you said you listened to that one video I did about research projects, you have to ask yourself the question, what am I working with? In this case, I'm working with a virus. I'm working with how the virus attaches, how it replicates, how it spreads itself, how the immune system responds to it. Okay, that tells me where I need to be looking for a treatment. Is there anything in any of those steps that silver is involved with? And the answer is no. And so if the answer is no, then the next question is, then how in the world could silver be involved successfully in the treatment of COVID-19? And the answer is it can't be, because it has nothing to do with any of these mechanisms from beginning to end. So you ask yourself the questions, what things do? Okay, well, could remdesivir? Absolutely. Remdesivir is a prodrug that gets converted inside the body and fools the virus into including it in the place of one of the nucleotides, adenosine. Okay, and because it's not adenosine, it produces a malfunction in the genetic code, which essentially helps to terminate the virus. But as we've seen, this virus, as I mentioned, has some interesting stuff in it where it says, look, it knows how, it's got longer genome or genetic code than is usual for a virus. This thing has genetic material in it that corrects for those errors. So the simple thought of just throwing something that's going to try to goof up its RNA replication didn't fully pan out, as we could see, because there's no data that it improves survival.
Well, I think that's interesting. I want to quickly say, my buddy Nick, you got to head over to YouTube, buddy. He's on Instagram watching the show. It's like 30 seconds behind. And join us over on the tube, my friend. And I just want to quickly go back. So, Dr. Fleming, every time I do have a question, you'll either give me the straight up, like, unvarnished truth on it and shoot it down, or you'll say, you know what, that's interesting, Mark. And this one I think is interesting. You tell me if I'm totally nuts. I think I'm nuts. But the concept here is that a drug is either found in nature, or not this terrain theory, but that you have the ability to create something within you, not by belief, maybe more within your mind, if your mind's chemically based anyway. Are you able to generate the certain type of vibrational energy? I don't know. I'm just speaking here, but to create a internal healing process for yourself for things. Is that a thing that's ever been researched before? He didn't laugh. That's good. He didn't laugh, people. At least he's going to think about that for a second. It may not be as stupid a question as it seemed.
I'm trying to be kind.
Okay, good. See, he was going to laugh at me. It's chemical, right? The brain is chemical reactions?
Your body cannot make anything out of a thought process without there already being a pathway for which that chemical already exists. So, you may respond to pain.
Okay.
And you may make substance P to try to block that pain. That is not your brain going, gosh, I wish I had something that would take away the pain. That is a biological organism, you, already having the ability to make substance P to produce a blockage. We have morphine type receptors in enkephalin and endorphin that we make that basically work through morphine equivalent receptors, which is why morphine works. Because just because somebody in a lab somewhere said, well, let's make this chemical structure based upon what we're seeing, that didn't help it to work. It's because there's already a receptor there working inside the body because of enkephalins and endorphins that are made. Now, why does acupuncture and acupressure work? At one point in time, you would have heard people say it doesn't work. And you would hear other people say, yes, it works. We know it works. People like me would say, well, if it works, it can't work by magic. It's not just a thought that you want something to happen.
Yeah.
And so it turns out that when acupuncture, more effective than acupressure, works, it works by stimulating the nerves that make endorphins and enkephalins, which take away pain. So, did somebody somewhere along the way obviously stumble upon the meridians that these are the places to stick pins because people get pain relief? Obviously somebody did, but it wasn't their sticking the pin in that caused a thought process to make it. It's because the pins probably got stuck lots of places, and it's when somebody hit the right one that somebody went, oh.
Yeah, there was a reaction. That's interesting.
Okay. And
Trial
over
and error.
time, the people recorded that, and that became passed down as meridians that became effective in that practice. Now, did they know it? No, but it wasn't because of magic or a thought process. So no, if your question to me is, can you will yourself better? I would say that if in the process of stimulating nerve pathways, those nerve pathways also stimulate other cells to do what they do that make you better, then I would say that would happen. But if you're saying that there's nothing that already exists within your body to solve the problem, and you now have decided you're going to will yourself better, then I would say you're going to have to show me some research data to show that, because you have just now stepped into the
Twilight Zone
midichlorian realm.
Well, you made sense there to me, because so basically if you don't have that ability within you, if you've never created the ability before, your body doesn't know what it is.
If that chemical pathway doesn't already exist biologically within the cells that exist in your body, your willing it does not magically produce new types of cells that will come up with something that will answer that problem.
I think that is something that should be researched, because I've seen what positive energy can do, and you've seen it, how people can change, and being in a hospital bed and seeing family come in and having that positivity lift them into healing.
Yes, I do. And so here would be my first response to that. Trying to think of the name of the chemical. There is a chemical that's produced in the human brain that is very positive. That is the result of human touch, and women develop it when babies breastfeed as a result of the breastfeeding.
Oh, interesting.
And that chemical is released, and that produces a healing sensation in the woman, but it is the chemical itself is doing it, and it's released by virtue of the baby nursing from the mother. Now, there's a biological benefit for that existing. If you had infants that breastfed from a mother who didn't have that genetic capability, that mother would not develop the loving, caring nature consequential to that chemical reaction that the mother does who does make that chemical. And therefore, the mother who doesn't make that chemical would be less inclined to protect her young and they would probably die off, as would then her genes over time. So the perpetuation of the species, where there is a positive mechanism for survival, has produced those chemicals that do produce that healing benefit. But it is already within people, and it is either breastfeeding like an infant, or going in and touching the hands of someone you love. It's the same chemical, I'm trying to remember it, that occurs when people kiss, when they have a good kissing experience that produces that euphoria.
It's like an endorphin, but at the highest level.
Yeah. Right.
So now you
that has a biological benefit, and that is wired into it. So that is the consequence of those behaviors, but it's because those cells and that system already exist within us. And we do have the mechanism within us to produce a healthy state. Obviously, an organism that doesn't have that built in won't live as long, won't survive as long, isn't as viable. So those people that have that and perpetuate that, that's a good thing for the human species. It's not that something's magically being done. It's we are disseminating the traits. And my biggest argument on that is see the harm that has been done to COVID patients by isolating them in these hospitals away from the people that provide them the ability to do that. Because I have never had a patient tell me, no matter how good my bedside manner is, that I ever made them feel as good with the touch of my hand, although I've had them tell me that touch is helpful. Never had them tell me that it has done for them what someone they love has done for them with that touch.
Absolutely. Absolutely. I want to quickly just say, what up, Dag? Bulldag in the house. He finally get on here at 3 hours and 26 minutes. Bulldag is finally with us. But you know, Dr. Fleming, you answered what I was about to say. You led me there, and then you answered it because you're a genius. I was going to say, so yeah, we do have something already in us. So theoretically, if we could connect to that, we could heal ourselves from anything. It may not be COVID-19, but having the ability to generate health, and that maybe is a higher level of an immune system, cancer, whatever. So you're still pushing everything away. It's already within you. So that connecting to what I call pure love, or the highest level of light. And if you could generate that, and you're not calling it something, and this is where I wanted to just kind of talk about this very freely. You're not calling it a cure to anything. You're just, the highest level of health is something within you. And if you can vibrate at that level when you are sick, and I'm just curious if anybody's ever researched it, because I feel like I've done stuff like that before, not for myself, but for others, and just feeling for them and pushing out light towards others and seeing it a result. And again, there's no papers or anything, but it's happened.
But there's actually been a number of papers that have been talking about prayer, and some people show there's benefits and some people show there aren't.
Interesting.
And my problem on that is that I go to the fact that most people have such a pathetic ability to do research. That, and it's being demonstrated today with the very drugs that we just talked about. To do this right, I think that a scientist and a physician has an ethical and moral obligation to do this correctly, because doing it incorrectly provides no help. It provides no real answers. Doing it incorrectly provides misinformation and harmful distribution of things that only confuses the scenario. I hope you don't have to take people out of 7th grade and convert their life into a scientist to develop good scientists. I would hope that good scientists can exist in other scenarios. But the search of knowledge and truth and understanding requires that fairly sophisticated, anally retentive type A personality that just won't accept sloppiness in the research or the answers.
Well, I do have one tag along though. and this may be something that can't be calculable. We discussed something early on today, and we've said this a few times, but if you don't believe in yourself, first of all, you will always fail. And so if you are someone who's looking for a result and you have someone who believes and someone who doesn't, you're going to see this person fail every single time because they don't believe they can actually accomplish that goal. But I'm pretty sure if you took me and anybody else who knows they will, you're going to get that result, but that's not going to always be that way to prove that it works.
Right.
Does that make sense?
So, yeah, I think that people who don't think that they can succeed never will. They're never going to be the people to find the answers, because they've already set them up for, I'm not going to find the answers. But the scientists that I'm talking about, like myself, my attitude is I can find, don't take this wrong, please don't take this as arrogant, I can find any answer if I have enough time and enough information to get me to that answer. Interestingly enough, and the people that I hang out with, my little handful of people on diet and nutrition and health and inflammation, I will tell you that there is very good information that shows that a proper diet that controls for all the inflammatory factors that I talk about in the theory actually is the same diet that when the telomeres of chromosomes are studied, and it's the unraveling of the telomeres are the ends of chromosomes that kind of keep chromosomes from unraveling and just flying apart.
Oh, okay.
And every cell replication, the telomere on the end gets shorter and shorter and shorter. So there's a predetermined cell length and therefore a predetermined amount of time that humans can live. Well, here's the fascinating thing. There's very good data that shows that by cutting down total calories, total saturated fat, eliminating the garbage in the diet, that you can actually elongate telomeres. And it's been shown, which means that with the lengthening of the telomeres, there is no definitive time to cell death, which means that cells can keep replicating without health problems, without the development of cancers, and continue to replicate at the same stage that they already are, in other words, without aging.
So how
that is already built into the system, and it has been compromised by the very things that cause all these comorbidities. And that entire process occurs almost exclusively. We talk about genetic material. There are really two places in the human cell that there is genetic material. All of you, if you've heard about it in biology, have heard about the nucleus. The mitochondria also have its own separate genetic material. That is the powerhouse of the cell. That is where all of those food factors go into. So the reduction of all those harmful things eventually feed into the mitochondria, because that's where the proteins, the carbohydrates, and the fats all get converted eventually to produce the ATP, which is the energy that runs the cell, adenosine triphosphate. And it is the telomeres on those chromosomes that get elongated and stabilized based upon the foods that you're eating. So the fact that we see people get unhealthy, the fact that we see comorbidities that result in an overactivated immunothrombotic response when these viruses and other antigens come into the body, can to a certain extent be traced to how we treat our bodies as to whether we continue to keep our bodies in a healthy state in balance, or whether we let the immune system and the health of our cells deteriorate to the place that the response to the outside antigens become the death of us.
You guys got that? Did you guys get that response? We just had my favorite number on for a few seconds there, Dr. Fleming. 13.
What was your favorite number?
13. was born on the 13th. You know,
Oh,
do you
okay.
think I always, and this is such a look,
Oh,
I like
13 viewers. Okay.
yeah, we had 13 people on YouTube with us, and I just love 13. It's my favorite number. And I always thought it was interesting. This is super side note because I don't want to keep you. 3 hours, 33 minutes, and 33 seconds. I just looked and saw that. Can you believe it?
Okay.
And then we're talking about 13 at the same. Okay, guys, there's something to this, okay? So 13, I'm going to tell you this quickly because I think you'll enjoy this story.
Okay.
My grandmother is Portuguese. My father, everybody's Portuguese in my family. And so my grandmother, she has this thing for the number 13, or she did, and she was very much against it. Superstitious as can be. Portuguese
Right.
old lady, 4'11", super cute. And she'd had these crazy superstitions. And this one about 13 was a big one. My Aunt Mary was born on June 13th. Do you know her entire life? My grandmother said that she was not born on June 13th. The hospital made a mistake. She was born on June 3rd. So they celebrated June 3rd her entire life. She died of cancer, unfortunately. And so my grandmother's still around. She's 79, and I'm driving her to CVS. I'm 17, 18 years old. And I said, Grandma, I got to ask you, what's your problem with 13? You know, I was born on April 13th. Oh my gods. I don't want to hear it. No. And I said, Grandma, why? What's your problem with 13? She said, well, I'll tell you. Judas was the 13th. Mm. Jesus and the 12 apostles.
Right.
Jesus. And I said, without even, this is something I could see you saying, Dr. Fleming. I looked at her just deadpan. I said, Grandma, but Jesus always put everybody else in front of him. So Jesus was the 13th. And she started laughing. I got a belly laugh out of my 79-year-old grandma. And I think in that moment, I broke her superstition. And she realized how silly she's being. Because honestly, if that is where that all came from, Jesus would have put all 12 of the apostles in front of him and then walked through the door last. Because I know that's anybody who cares for this planet or cares for their fellow man, I would do that. So I feel like that's exactly what he would have done. And so in that moment, I realized why 13 is the greatest number in history, because Jesus was the 13th. My perspective.
Well, I think it's the responsibility. I would like to think that medicine and science, this is the ethical and moral thing that I've talked about, is about putting everybody else in front of you and trying to get these answers. And that's probably, my ancestry is Norwegian to Belgium to England to the States. And when my British component kicks in, you see me get very, very stoic. My children knew they were in trouble when I just walked out of a room.
You just get up and walk out. I love that.
And wouldn't say anything. But I do think it's very important. And I think when people see me get animated, it is not because I have lost any level of sophistication or science, but it's the importance of what we're talking about. And it's how misinformation is dangerous. You know, the people that have died with COVID-19 have died because the inflammation and blood clotting wasn't addressed.
Yeah. And
that's
predominant, right? That's most of the deaths were because of this.
That is
response.
Not acceptable. To ignore this information or to take the attitude that you weren't the one who developed the theory or it wasn't developed at your university, that you're going to ignore it. Those people are still dead, and their blood is on the hands of the people who didn't address these issues. People that disseminate misinformation that can cause more confusion, that's on them. And I don't care if it's from a theory that has no basis in fact, or frightening people into thinking that you're going to kill the person down the street because you're exposing them to a virus, or using it for political gain. The people at the CDC and NIH and NIAID, the National Institute of Allergy and Infectious Disease, which is a branch of NIH, National Institutes of Health, the Centers for Disease Control, the Public Health Service, have spent 9 months providing opinions about what works and what doesn't work without doing solid scientific research to investigate what needs to be done, arguing amongst themselves like second graders, and then arguing with the principal, which is Trump. And then the other kids in the playground come in to start sharing the information and misinformation, and that's the journalists and the people on Twitter. I don't know what it will take for people to realize how important this is, but it's important not only that we get a handle on COVID-19, but everything that's going to follow it, because this is not the last virus. This is why I raised the question of what do you think these people are doing who worked on it to begin with? If you think they all went and hid in a sewer somewhere hoping not to be caught, that's not what they're doing. They're continuing to investigate. They're continuing to research. They're continuing to manipulate. They will. That's what they do for a living.
Absolutely.
The people who are using their knowledge base of those researchers are doing exactly what they do for a living, which is finding out how this can be used to get the outcome that they want. And it doesn't matter to these people that there's 180 some thousand dead Americans or hundreds of thousands of dead people in the world. This is not on their agenda list of caring. And the only way this changes is for the people to become better educated, to learn what really needs to be done, and to stop fighting and spreading misinformation.
That's really what it comes down to. And Sig, stop buying stuff. He said buying.
Wait a minute. Who bought the electromagnetic stuff?
That was Sig, and he returned it. Thank you for giving him that advice. He returned that. He said he's been buying stuff, but you keep giving him good advice. He keeps returning things.
Yeah, maybe just not buy anything that they sell on whatever that all-night channel is.
Oh yeah, the home shopping.
I remember what was Big Bang Theory. What was it? Penny bought Leonard a sweater because he was going somewhere. It was a sleeping thing that was a sweater to keep him warm when he was going to the Antarctica, and he was trying to figure out if Penny really cared for him or loved him, and she didn't want to admit it. And he said, well, what does this show, this thing that she bought, which is a sweater that just covers the whole body that you wrap? And she says that drinking and a credit card while watching
Home Shopping
whatever
Club?
that home shopping network are not a good idea.
That is so funny. That's hilarious.
So
I've seen stories. I mean, I remember, I think when I was a kid, my parents bought a computer like that, like middle of the night. I was like, what the hell is this thing? Got some freaking stupid big PC. Like, oh yeah, we're at the home shopping camp. I just remember I was like a 9-year-old and this big box came, and I know it was an HSN thing. Like, 11 o'clock, maybe a couple extra drinks. Only happened once because my parents don't drink. They must have had like a big party one night. And they're like, oh, I wonder what's on HSN. I don't know. Oh my goodness. Guys, Dr. Fleming killed it again tonight. Oh. And listen, I obviously, this, anytime you want to come back and chat more about anything, I'm going to keep leaning into this and look into some research more about the mind and the ability to locate these trigger points that we may already have within us to heal ourselves. And like I said, I've seen things before that I can't explain. I've done things before I can't explain. And it all has to do with a love that comes out of me towards another individual. And I could sometimes feel it. I can feel some power that I'm just connecting with, and then I'm giving. And I know there's something to it. I just don't know how to explain it.
Yeah, and we touched on this the first time, but if you want to prove something, then I challenge you to prove it, like I do everything else. No, and I explained to you the first time that uh, in a completely different perspective, but you can't connect this dot directly with what you're trying to do. That I started off physics as a well, particle physics is what I considered my area in quantum mechanics, and I now consider myself much more a string theorist. But it's not like the string theory world is waiting for me to come up with something on string theory, because let's be honest, I think most people have accepted that my pathway in science has gone way down this pathway in medicine. It all connects for what I've done. It's all connected. Even though it may look like the pieces are disconnected, they are actually all completely connected through. But I don't think that the physics world is any longer looking for me to come up with a novel theory on string theory or anything else.
No, but but the thing is, this gets back to what I always say. We each have, and you seem to have multiple, and I think I bring something to the table with the beat seat and with this and the celebrity impressions, but we have at least one thing that we do. I call it a unique genius that we have to locate. Sometimes it takes a day, a year, sometimes 40 years for me to put it all together. But something within us I call the unique genius. And once you connect with it, our goal, our purpose is to bring it to the surface and share it with the world. And then I think the other thing is we have a secondary mission. Each and every one of us, you're sitting there, if you're watching this, you have a mission, and it's to help. It's to do something for your fellow man. And you have to figure out how. But we're not here to just be like ditch diggers. We're here to help each other level up to the next day and to the next opportunity. And I challenge you to buck the system, to go against all the negativity. Next time you see someone you don't agree with, smile at them. Say, I respect your opinion. I challenge you. What do you say to that, Dr. Fleming? Do you challenge people to come out and be more open and care and do what we're doing, which is to try to affect a positive change one person at a time? That's my motto on this program.
Obviously my goal is to try to make a better world as a result of my being here, and I try to stay positive with that. I will not say that I'm perfect at that, because if you one of my original mentors said it best when he said, Richard does not suffer fools gladly. And so if I hear you repeatedly say something which is just absolute garbage and is harmful, you will find me to very quickly cap it.
Yeah. Well,
because it's dangerous, and I view that danger as anti-positive. So you can't make the world better if your practice is to disseminate misinformation. And that's even true of even if you firmly believe it, because at some point in time you have to, if I challenge everything I think of every day. Nobody is a bigger critic of my research and my work than myself. And I have some trolls out there that would try to beg to differ, I think, because I think some of them have their, they have nothing better to do than to try to see if they can attack or criticize that. But trust me when I tell you, nobody is a bigger critic of my work than me, because it's the only way that I can make certain that I'm not selling myself a bill of goods, and that the information I'm continuing to provide is the best, because I can't provide the best care or answers if I allow myself to be fooled. So I therefore cannot allow somebody else to perpetuate misinformation because they think it's a good idea. Then you need to prove it's a good idea, or you need to actually develop a good idea and develop something that's positive for the planet.
My wife calls that calling people out. My wife calls it calling people out.
That's right.
She'll just like, look, you know what? And you know what? You're a better person when you do it, because this goes back to the regret thing I was talking about. When you don't say how you're really feeling, you actually are chipping away at your happiness. It's a weird thing, but your intuition's telling you to speak up. And when you don't speak up, you're actually harming your well-being. That's my philosophy.
David Skorton and Mel Marcus and a couple of the other people that were in cardiology at the University of Iowa and when I was in training were some of the smartest minds that I know in cardiology, and they helped to develop Cine-CT, and White and Wilson developed intravascular ultrasound for the coronary arteries, and Mel Marcus helped develop Cine-CT, and Mel's where I just picked out an apartment in Coralville, in the city that I lived in when I went to medical school, which was in Iowa City. Donna, who was my neighbor right across the hallway, turned out to be Mel's maid. She went and cleaned Mel's apartment, home, and which was quite the thing. And I got to rotate with Mel and learn from Mel, and I got to see Cine-CT in its infancy much more. People have no idea what it looked like originally, and to see the jerky pattern of what we were watching as blood moved inside the chambers of the heart. And the reason for mentioning Mel is I remember sitting in O'Hare Airport, and I remember being very busy from a conference that I was coming back from in a hurry to get back to where I needed to be. And I'm sitting there at my gate, and it's dark. And Mel was not a small man. Mel was huge. So he was on the escalator, carrying him down O'Hare. And Mel had to stand sideways on the escalator. That's how wide Mel was.
Wow.
I saw Mel out of the corner of my eye, and as I looked at him, he was headed. And I could have gotten up and run after Mel and just say, "Hi, Mel. Hi." And I didn't. That was a moment in my life. Because the next thing I knew, Mel died from cancer. Mel was an instrumental figure in my educational process. He was a man that I revered and still do. The opportunity that I had to say goodbye was at that moment, and I passed it up. That was the last time I have passed up an opportunity, even if I had to run down the block.
I love that. I love that
to make a comment to someone who's important to me in my life.
You've got
Many of the people that have trained me, that gave their knowledge base to me for me to build upon, are now dead. Mel being one of those examples. So yes, how we treat each other, the obligations we have to those who have trained us to carry forward, to learn more, to provide better care for people, to help educate people. Very key, very critical, very important.
And also, you know, it's interesting that missed opportunity to say goodbye to Mel. It changed your life for the positive. It was a negative that changed you for a positive. You still look back with that regret, missing that one opportunity. And I think that's the takeaway I get is, you know, realize when you've messed up, guys. Realize when you've got to do more and when you really got to follow that burning within you. You can't push it down.
You genuinely have to do what you think is right. You know, Star Trek, William Shatner is not the best actor in the world
No,
by any stretch of the imagination. But there is a line in one of the new Star Trek movies, which is not the new ones now, but the first movies that came out, where he's being court-martialed because he went against orders, because he went after Spock's dead body, when Spock was shot down to the planet and then Genesis occurred. and Spock's father is talking to Kirk, and because Kirk has lost his command, he's lost everything important to himself that he's worked for, all because he went out of his way and he did this for Spock because it was, well, you'll get in a moment. And Spock's father said, as an ambassador, says you gave up everything because you did that. And Kirk's answer, his line that they thought through was, had I not, it would have cost me my immortal soul.
Jeez. And because you know what? It's something that is, sometimes the decision is so important to your own happiness.
Right.
And if you don't do what you
So
need
all
to
of the
do.
decisions that I've made in my life on the scientific research and the abuse and the criticisms and the attacks have carried that in mind, that it doesn't really matter what all of that has been. Every one of those was for the betterment of the patient and the correcting of what is right and finding the answers to make it better. So with that in mind, you would understand why I would have little tolerance for people spreading misinformation.
Oh, for sure.
They're
For
harming
sure.
people.
Absolutely. Absolutely. And this is why I think you have to continue to call people out. So brilliant. Dr. Fleming, it was a pleasure again. We got 4 hours and 3 hours and 55 minutes.
On vaccines.
On vaccines. You know what, though? We did a lot more chatting about stuff I really like to talk about, which has nothing to do with the stuff that's freaking us out, just conversation, you know. And thank you for, letting me have my crazy, whimsy thoughts about how we could connect our minds to an energy that's out there that maybe you filled in a little gap for me, because I didn't think about before that we may already have those connections within us in order to heal. And maybe that's why I've seen some things before. And I want to lean into it a little. Not that I can provide anything that will give you like, hey, look, that's something. But if I can prove that something exists to me, I'll let you know.
Yeah, the only people who have to prove anything to me are my children.
Yeah, that's a good thing.
And the bottom line on that is that they are still the three most important people on the planet.
You have 3 kids? What do you have? Boys, girls, what do you have?
I have a daughter and 2 sons.
I got a son and 2 daughters. That's very nice. I love having 3 kids. I was one of 3 kids. Were you one of 3 kids?
I was delighted to have 3 children. I think that.
Were you actually one of 3? Did you have 2 brothers or sisters? Did you have 2 siblings?
Yes, I'm the youngest. I'm of the 3. Yeah.
Isn't it weird? Like we're both 3. I don't know. It's weird.
One to replace each parent and one for the world. Is the way that it was always explained.
I never heard that before. That's hilarious. But so you were one of 3. I was the youngest of 3. Hold on a second. You were the baby of the family of 3. I was the baby of 3. I'm just thinking cool things. I love 13. I don't know what that number means to you, but I know it's a prime. Is it 13 a prime?
It's one more after 12 and one less than 14.
I love how you just bring it back to reality, Dr. Fleming. You're like, yeah, in China, 4 is a bad number. Explain it. Explain that.
Yes. That last time I think I mentioned to you that when you said that, gave that story, that one of the Brazilian students when I was in high school told me that it was either Wednesday or Thursday, and it was either it was either like Wednesday the 12th or Thursday the 11th was the superstitious date in Brazil.
Yeah.
And I just found that interesting. I thought not only are we stupid enough to have it in this country, but the Brazilians have their own version of stupidity.
Exactly.
With no basis in fact. It's like when you go into a hotel and you say you want to go to the 13th floor, and they say there's no 13th floor. No,
really
the one
is.
that you have marked 14 is actually your 13th floor. I don't know how to tell you this, but if you count them up, this is your 13th floor. I'm, telling you.
It's funny that you say that, because when someone says they have 18 floors, do they really have 17?
Yeah, they do. If they're missing their 13. It's kind of like, how old are you? And I do this with my sister. I think she just turned 70.
But she's
and
really
I tell
71.
her, so you're 71.
Yeah, she's really 71. I tell
And
people
she
the
goes,
same
no,
thing.
I'm 70. And I said, no, you've completed 70 years. You are now 71.
See, we think I've been saying that for years. Everybody thinks I'm crazy. I'm like, my kids are not 1 when they turn 1. They're really 2. You know, I'm like, they're starting their second year. Yeah. And I always thought that. I'm like, I'm 42, but I started my 43rd year in life. No one thinks about it that way. It's like, I don't know.
You don't even want to know how old I am.
I mean, look, you said 76.
You've got general dates.
I know, but you said 76, so I have to figure 68. I'm just guessing.
No, I'm not that old. Thank you.
Wait a second. I'm sorry, 62.
I'm a little older than that, but that's close enough.
Because I would say I'm born 78. And you were around because I figured they're 2022, somewhere around there.
You were born in 1978. I had already graduated from high school and had my doctorate.
Okay, so then, so I was thinking you were about 20, so you'd be roughly 60, somewhere in that range. But anyway, look, time goes by quick, and I just think it's interesting. You're the baby of 3. I'm the baby of 3. We both thought about the same thing about going through our first year. I don't know if that's something everybody thinks about, but I just thought it was weird. Everybody says months. What the hell is this? No, 9 months old. I'm like, what? I don't know. Anyway, Dr. Fleming, 4 hours. Wait, hold on. You should stick around for literally 30 seconds because we'll be at 4 hours. We might as well make it official.
Okay, we'll stick 30 seconds. One last question.
Yeah, one last question from anybody here for Dr. Fleming, or just a thank you for all of his service to this country and to this world.
Well.
I mean, look, honestly, who else is putting in 4 hours worth of medical information that's going to help out there? I mean, some people are doing it, but they're probably getting paid for it. You're doing it because you're trying to help man and womankind. So with that, I will say, my friend, at 4 hours.
Mostly the horses.
Mostly the bowling ball-eyed horses. Absolutely. Dr. Fleming, 100% pleasure having you on again. Look forward to hopefully doing this again for maybe a 5th run around the sun. And thank you again. Thank you so much. I'll drop this and send it to you tomorrow. Have a great evening. Guys, I'm not going anywhere, so don't go anywhere, okay?
Happy Labor Day, everybody. Get some rest.
Thanks, Dr. Fleming. Take care. I'll see you soon, okay? All right, nobody go anywhere. I'm sticking around with you. Dr. Fleming killed it, guys. He's amazing. How cool was that? Holy cow. Holy cow. That was one of the greatest real talks we've had because we got into a lot of other things that I've always wanted to talk about. And I want to just tag along something I'm thinking about right this second, but thinking about those moments where you want to make sure you don't look back with regret. I was driving home after work one day and I'm heading to the highway, and it's just to back up. So my grandmother, at the time, she's in hospice, and I had gone down with my family to see her, my kids, with my wife, and I have 3 kids. Okay, so like, it's crazy that Dr. Fleming had 3 kids. He's the youngest of 3 kids. I'm the youngest of 3 kids. I have 3 kids. I don't know. It's pretty cool stuff. We both thought about this thing about our, that first year, you're actually really starting your second year. You're not your 1 year old, But regardless of that, so my grandmother's in hospice, and she's about 35 minutes away in the opposite direction. And I'm heading home, and I just thought to myself, I'd gone to see her already, and she wasn't doing well. I mean, she's in hospice, I'm driving home, and I just had this intuition, this feeling, this urge that said, go see Grandma. So I called my wife, and I just said, look, I hope this is okay, but I'm going to run down to see my grandma. And she goes, yes. This is the greatest. She goes, yes. Go spend some time with her alone. And I remember thinking, like, I love my wife. Like, what an amazing response. I was like, is it okay? I'm going to go see my grandma. Just going. She goes, yes. Go spend some time with her alone. You went with the kids last time. You're holding with your youngest. I don't like to say my kids' names. You're holding the babies. You're holding the baby, and you're not really spending the time. Go and spend time with your grandma alone. So I go down. I'm getting kind of shivers thinking about this. I go in and see her, and she's just like touched that I came to see her. And it was out of the blue. It was on my way home. I work every single day, so this is just another day. But I just had this intuition to go see her. So I run down. I spent an hour and a half with her. Talked about all kinds of stuff. I fed her because she was at the point where she couldn't really. She's dying of cancer, very old, but she got to live a long life. So it wasn't that she was like a young dying of cancer. Still bad, but I'm feeding her, having a conversation with her and talking to her about the kids. And she always had this really adorable Portuguese accent to her. And she used to call me filho, which means child. And anyway, so I got to spend an hour and a half with her. And she was in a wheelchair at this point, so I fed her and then I walked her around. Just had a nice conversation. And I just remember I wanted to make sure I said what I needed to say in order for her to understand what she means to me. And so I spent that time with her and I said it all. I let her know. You know, look, one of the things that I've been able to do my entire life is express myself. Is to be able to say what's really going on inside my heart. And I looked at her and I said it all, and we had a connection. We had a moment that was just ours. It was just something that we can, or for me, that I could remember. I left, and the next day my grandmother passed away. Now, I don't know what that is, but I do know I almost got on the highway in the opposite direction to go home. I still can feel that moment. I'm driving. It's right to go see Grandma or left 15 minutes to go home. And I'm tired. I'm hungry. End of the day, I want to go home. You know, something's telling me to go see Grandma. Greatest thing is to follow your intuition. And I'll tell you something I've been saying for a while. I haven't said this in a while, but I've been live for 617 days in a row, so you'd have to search to find these moments. The only time I've ever been wrong is when I've listened to man or woman, and not when I've listened to my intuition. I don't think, very, very rarely am I wrong when I follow my intuition. It's my friends, it's my whoever that lead me in the wrong direction my whole life. I got in trouble because of a friend. Whatever it is. The only thing that's been true to me is living in the moment and leading with light. That's what I've been trying to talk to with Dr. Fleming too, is leading with light, because I have seen some things, I've done some things that we're not going to talk about now, but stick around. I've opened up Pandora's box to about 78%. Once you guys finally figure out what's going on here and what we're doing here, it'll all come together. For now, I'm going to play you something, because I've been live for 4 hours and 6 minutes. I need some more to drink. Let's see. Let me quickly say hi to all my people here, guys. First of all, could I say how much I love you guys? Seriously, how awesome are you for sticking around for Dr. Fleming? And Rebel, thanks so much for adding so many questions. Daryl, you're the man, brother. Yeah, I'm just a youngin', Daryl. Fleming killed it, didn't he? Daryl said Dr. Fleming just was like on. And Sig, don't worry about it, Sig. My buddy Sig's worried about, don't worry about Dr. Fleming. He wants you to do well. He wants you to be safe. Paul, my brother, good to see you, pal. Oh, Rebel's been died for 30 years. Ooh. I had a friend who passed a few years ago, and he used to say, he was like 37, and he'd be like, yeah, I'm sorry, he was like 47, and he would say, I'm 40E. Every time he'd be like, yeah, I'm 40D, you know, and he'd just say he was like, he stay the number but add a letter. It was kind of funny. He died of a drug overdose. Sad. Very sad. I actually had a falling out with the guy prior, but he just wasn't really the nicest guy. I mean, but it's sad when something like that happens, you know. Right now, too, what we're dealing with is you got like all of these people losing their faith in man because of the fake news out there. That's why, you know what we're doing right now is we're gonna play you guys a face swap. I wanted to play you guys something here, first of all, just to get the energy back up. I've been live for 4:08. We need to pull this up. Ready? Check this out. Oh, Sig, you're the best, brother. Ready? Check this out.
Very willing to let the American public judge my physical and mental my physical as well as my mental fitness, my mental fitness, my mental fitness.
Look, I can't help it that you chose a sleep sofa as your candidate.
My physical as well as my mental fitness, my mental fitness, my mental.
He's a sleep sofa. Every time he goes out, people like, yo, Joe, what you got going on? He's like, I don't know. My Aunt Judy told me to come on out.
Joe, open up your eyes, sleep sofa, Joe.
We're writing a rap to that. I swear it has to happen. All right, look at this, guys. I'm going to run upstairs and grab a little coffee, and let me play you. This is episode 25. I think this is a fire episode that finished off the Donald Trump show. Let me rock this. It's Hammerlin Jameson live from the studio with the final episode of the Donald Trump show. Ladies and gentlemen, Donald Trump.
Thank you. Thank you for joining me on the final episode of the Donald Trump show. That's right. We're wrapping it up. People don't like all of the episodes on the sleep sofa. Look, let's be honest, he's such a bad candidate that they have to try to distract you with all kinds of fake news. Like the newest, did you see? We destroyed them with our RNC. The numbers start going belly up. So now they're trying to spin the narrative. So wait, let me get this straight. The Trump supporters are the ones who are rioting in the streets? Why don't we take a look a little closer and see what's really going on?
I am very willing to let the American public judge my physical and mental my physical as well as my mental fitness.
Sleep sofa, you just failed the test.
My physical and mental my physical as well as my mental fitness, my mental fitness.
Wow, tongue-tied, bumbling Biden. Welcome to the show.
I just don't even know why there aren't uprisings all over the country, and maybe there will be.
There she is, Nancy Pelosi. Oh, how is that hairdo? No mask, huh? Oh, but no one's above the law. But you, huh, Nancy Pelosi? Look, let's get the gaslighting going. Here we go.
People need to start taking to the streets. This is a dictator.
When did Glenn Beck turn into such a chooch? I know, it's not really him, but that squarehead sure looks like him.
You know, there needs to be unrest in the streets for as long as there's unrest in our lives.
Wait a minute, but didn't you say the Trumpers were the ones out on the streets? Who's lying now? Laverne Cox?
Show me where it says that protests are supposed to be polite and peaceful.
Well, it's called the First Amendment of the United States, Chris Quobover. You should probably read it sometime.
Do something about your dad's immigration practices, you feckless.
Wow, super classy. You should do something about that face. You've got RBF. Resting bee face. That's right.
When they go low, we kick them.
See, behind closed doors, it's not when they go low, we go high. It's when they go low, we kick them. They've been kicking the hell out of the Trumpers since I came down the escalator, really.
How do you resist the temptation to run up and wring her neck?
I mean, news reporters threatening violence? Guys, are you paying attention?
Biggest terror threat in this country is white men, most of them radicalized up to the right.
Now this one's hilarious. Don Lemonhead. Are you kidding me? All of the rioting on the streets is your left-wing Antifa scumbags. Let's think about this logically. For the last 90 days, the press has been saying, oh, peaceful protests. They wouldn't have done that if it was for Trump.
Thought he should have punched him in the face. I said, even if you lost, he insulted your wife.
Yes.
He came down the escalator and called Mexicans rapists and murderers. He said, well, what do you think I should have done? I said, I think you should have punched him in the face and then gotten out of the race. You would have been a hero.
Yes.
He came down the escalator and called Mexicans rapists and murderers.
Look, there's a gaslight right there. I never said all Mexicans were rapists and murderers. Just that they're sending a lot of them. Guess what, though? Sleepy said very similar things in 2006.
I'd like to punch him in the face.
Robert De Niro, the most overrated actor in the 20th century. I mean, look, I get it. The one character you played in Raging Bull, and you think, like, you could continue the same guy? Look, you're terrible in everything else. The same character over and over and over. Let's squint our eyes and talk the same. So I'm not really putting too much stock in Bobby De Niro.
I said if we were in high school, I'd take him behind the gym and beat the hell out of him.
You see that? Sleep Sofa Joe is the one who's behind all of the gaslighting. Sleep Sofa, bumbling Biden. He wants to fight me behind the school. Look, let's go, Sleepy.
Very willing to let the American public judge my physical and mental my physical as well as my mental fitness.
I just had to watch that again. Oh my goodness, he's such a marble-mouthed, muffin-headed bumbler. Sleeping on his sleep sofa, little Joey futon.
Punch some people in the face!
I think that werewolf made Winona Ryder pee her pants. Is what it looked like there. Let's watch that again.
Punch some people in the face!
Yep, I think so. And also Matthew Modine. Looks like he's cast for the part of Val Kilmer.
When was the last time an actor assassinated a president?
Well, ancient history would tell us that it was John Wilkes Booth. He shot my favorite president of all time, Abraham Lincoln. And of course, he was the first Republican, but most people don't know that. But I have to say, Johnny Depp, I used to like you when you played Jack Sparrow. Who knew you'd turn into a real-life scumbag pirate? Do you have scurvy?
They're still going to have to go out and put a bullet in Donald Trump, and that's a fact.
Now, that's the first time I've ever heard that. Pensy, do we have this guy's information?
Yes, Mr. President. We have the location on one beaker from Sesame Street.
Where is John Wilkes Booth when you need him?
Very clever. I see your husband is the ghost of Christmas past, so you got that going for you.
This way. That's it right there. Pull it up.
Remember this one? Somehow I still look better than Kathy.
I have thought an awful lot about blowing up the White House.
Do you remember this when Madonna stood outside the White House right after I won? You guys have been doing this since day one.
A Missouri state senator is under investigation by the Secret Service after saying she hopes President Trump is assassinated.
What the frig is wrong with this country?
I will go and take Trump out tonight.
This Maxine Waters, she's one of the worst of them all.
And if you see anybody from that cabinet in a restaurant, in a department store, at a gasoline station, you get out and you create a crowd. And you push back on them. And you tell them they're not welcome anymore, anywhere.
This is when it got bad. Maxine Waters standing there, lighting the fire, telling, get in people's faces. Do you remember when that started happening? People having dinner and being yelled at of restaurants? Yeah, that was all them. But no, let's blame Trump somehow.
And sadly, the domestic enemies to our voting system and our honoring our Constitution are right at 1600 Pennsylvania Avenue.
Are you kidding me? This is poison right here, right? She poisons everything. I offered $10 billion to the Postal Service, and she said no. They're the ones who are destroying America. The Democrat socialism is just communism, really. Talk to anybody who's dealt with people who are like, hey, socialism, and then 5 years later it's a communist country. It's going to happen here under Sleeps Over Joe.
They're not going to stop before Election Day in November, and they're not going to stop after Election Day.
For the record, this is the vice presidential candidate for the Democrat Party.
And that should be, everyone should take note of that on both levels, that this isn't, they're not going to let up, and they should not.
They're not going to let up, and they should not. So wait, if they're your people, and they shouldn't and will not, how did they become my people?
If you think we're rallying now, you ain't seen nothing yet.
Look, I think I've made my point. That the people on the left are crap, really. And all they've done since the beginning of 16 is try to derail my presidency. And they're trying extra hard right now. And it's all because of this.
I am very willing to let the American public judge my physical and mental my physical as well as my mental fitness, my mental fitness, my mental fitness.
Look, I can't help it that you chose a sleep sofa as your candidate. But that doesn't mean you could gaslight for the last 4 years, and that when your poll numbers are starting to drop, you just spin it and say, oh no, it's all Trump. The public can see through your lies. Look, this has been quite an experience having my own talk show, the Donald Trump Show. But every good thing comes to an end, so I guess this is it. Maybe we'll see you sometime in the future. It's Donald Trump, signing off.
That's right, people. Guess who I got sitting with me? Max Scott. Max, say what's up. Say what's up to everybody. You say hi to everybody, Max? Say what's up. I'm Max. I'm hanging out over here. I'm the Max Scott of the Real Talk Showgram. You're the Max Scott of the Real Talk Showgram. On the Showgram. I never thought about that before. So, guys, we had a killer night. What do you think about episode 25? What's up, buddy? You want to say hi? You want to say hi to my people? Say what's up. My name is Max. So, Max, I'm going to play something short and sweet real quick, okay? Because Daryl didn't see that much of the goodness yesterday. So, hey, what's the matter? You want me to take you up? I'll put you, don't get fresh, all right? I know, you're a good boy. Let me play you episode 1, okay? This is, I think, hopefully I could keep Max here long enough. Episode 1 of the Donald Trump Show is pretty cool. Check this out. Daryl, let me know what you think of this. Sig's seen this about 78 times. Dagger's seen it about 54 times. Denise has seen it probably 70, 96, 4, 7, 4. I'm going to do Joe Biden number 600 million billion. Look, my Aunt Judy told me. What's wrong, Max Scott? What's the matter? You want to go back upstairs? Yeah? You're not cooling? You're not cooling the gang? Yeah, what's up, man? What's the matter for you? What, you crazy? What, you crazy? Oh, that's a good pup right there. That's a good pup. Don't bite me. Don't bite me, man. I'm just kidding. No, seriously, don't ever bite me again. All right, so check it out. Episode 1 of the Donald Trump Show. Here we go. It's Hammerlin Jameson live from the studio with the very first episode of the Donald Trump Show. Ladies and gentlemen, Donald J. Trump.
Look, I want to thank you for joining me on a brand new episode of the Donald Trump Show. That's right. We're going to be here every week delivering truth about the Biden campaign because no one's telling you what's really going on. I'm going to pull back the curtain and you're going to see what Joe Biden is really up to. Here we go.
We choose science over fiction. We choose truth over facts.
Will somebody please alert Mr. Biden that truth and facts are the same thing? I think he's been watching too much fake news on CNN. Okay, what else do we have from this blubbering train wreck?
My name's Joe Biden. I'm a Democratic candidate for the United States Senate. Look me over. If you like what you see, help out. If not, vote for the other Biden. Give me a look, though, okay?
Now, first of all, who's the other Biden? Who is the other Biden? I'm wondering, because if it's Hunter Biden, he'll be in jail. But if there's another Biden, perhaps he can actually complete a sentence. That Biden I'd like to hear from. Okay, let's see what else we've got.
Trust.
Like his strange hold on Defense Secretary Ash Carter's wife, Stephanie.
Sleep Sofa Joe has been doing this for years. He's a creeper. And we're going to put a stop to him.
I like the way your hair smells. Let me give you a little kiss here.
And can you believe? Look at how he's touching that little girl. Honestly, I'm a little worried about that little girl. Sleep Sofa Joe has been doing all kinds of racist things for years. I'm just going to show you a few of the clips. Take a look at this one, for example.
You cannot go to a 7-Eleven or a Dunkin' Donuts unless you have a slight Indian accent. I'm not joking.
Look, I'm surprised you guys are fine with hearing Joe Biden say you need an Indian accent in order to go to Dunkin' Donuts. Yeah, I've been to Dunkin' Donuts many times. I don't have an Indian accent. But let's continue on. I have a lot more to play for you. Now check out this clip, for example.
Poor kids are just as bright and just as talented as white kids.
Racist Joe strikes again. Poor kids are just as talented and bright as white kids? What does that even mean? This is getting good, guys. What's next?
Play the radio. Make sure the television, make sure you have the record player on at night.
Really, Joe? That's a good idea. We'll get the record player out. How about we go and actually light a fire and we do smoke signals? How about that? What do we have next from Sleep Sofa Joe?
Think about it. We hold these truths to be self-evident. All men and women created by you know the thing.
The question is, do you know the thing, Joe? Do you know the thing, Sleep Sofa Joe? The thing, Joe, is that we are all created equal. That's right. God is the creator of all, not Satan and your adrenochrome. Okay, let's get one more at least. How about one more?
I'm not going to be a mule. I got something to do. I got to go do boom, boom, boom.
Did Sleep Sofa Joe just say he has to go do a poop-a-doop? I think he said it right in front of his crowd. I would never say that right in front of my crowd. If I'm going to take a poop-a-doop, I'm doing it on my own time, not in front of people. I don't know. It's a little weird there. Look, let's give him a chance to redeem himself. One more, okay?
You got more questions, but I tell you, if you have a problem figuring out whether you're for me or Trump, then you ain't black.
Wow. Really? Look, I'm not sure what else to say after watching that ridiculousness. But that's Sleep Sofa Joe. Are you going to vote for that guy? How about you? Look, if that's the case, this world's crazy.
Oh, episode 1. Rebel. Oh, my goodness. How awesome would it be if Donald ever saw one of my Trump shows? One day he will, right? When you guys spread the word to the right people, and all of a sudden this program is on TV and not on YouTube, or maybe we have enough people here to see it and get it to Trump. That may be a thing. But while I bring Max upstairs, why don't I lead you into episode 2? I'm kind of showing you a few things that you can get ready for tomorrow, because tomorrow I am playing every episode from the prequel all the way to episode 25. But here's number 2. All right, Max, we're going.
It's Hammerlin Jameson live from the studio with the prequel to the Donald Trump Show. Ladies and gentlemen, Donald J. Trump.
Look, I've got to tell you, I'm completely in awe. It's like the Twilight Zone we're living in right now. Do you see the Sleep Sofa? I mean, everything he does, I'm just totally blown away by. Did you see this clip? Check this one out. This will blow your mind.
And by the way, I sit on the stand, and it get hot. I got hairy legs that turn blonde in the sun. And the kids used to come up and reach in the pool and rub my leg down so it was straight, and then watch the hair come back up again. They'd look at it. So I learned about roaches. I learned about kids jumping on my lap. And I've loved kids jumping on my lap.
Exactly. I mean, Sleep Sofa Joe talking about his white hair on his legs is kind of weird, right? But no, people love him for it. And how about this one?
The rapidly rising I don't know.
I don't even understand how people could continue to support Joe Biden. He's halfway through the first sentence and he forgets what he's talking about. He's like, I don't know. I have no idea. I'm just kind of sitting here. Look, we're going to be in trouble if you have Sleep Sofa Joe in as president. Let's check out this final clip.
Unnecessarily, now we have over 120 million dead from COVID.
Can you believe this? Can you believe Sleep Sofa Joe? 120 million? Really, Sleep Sofa? That's probably how many people would have died if Hillary Clinton had won, or if Sleep Sofa Joe was in charge of the country. It's 120,000, which is 120,000 too many. You could thank the G-hole. That's right, President G-hole. It's all his fault. And we're going to get him to pay. Big league. I'm going to send him a bill. And with it will be a huge stamp right across the center that says, "You're a G-hole."
All right, how long you guys been waiting? I had to get a bowl of cereal, guys. Gotta get me some honeycombs while I'm upstairs. I mean, what the hey, right? I'm talking about some honeycombs. Are you kidding me? It's 4 hours and 30 minutes into this program. You darn right I'm gonna get some honeycombs. Oh, my people. Denise, she's back. I love it. Oh, I am so glad you are home, Denise. Yes, you are with your other family. And I'm so glad to see you here. We're going to get into some stuff because we really have to reflect on the Dr. Fleming experience. That was really awesome tonight. And looking forward to reviewing some of that because I always have to listen back. He's just so smart. Sometimes when I'm listening to the response, I get it, like a lot of it, but there's so much detail. You got to go back and you got to peel back the layers in order to understand the full complexity behind the answer. Anyway, I am obviously very tired at 4 hours and 30 minutes in. However, I love you guys. So let's get into it. I'm going to play you guys something. I'll eat this bowl of cereal. Maybe we'll do 3 more hours. Who's going to hang out? Look, we just got someone else join the show. Who came in? You're awesome. I just want to clear something up, okay? We've been live for 4 hours and 30 minutes. I'm going to be live every day for the rest of my life with you guys, okay? I'm here to connect with you. I'm here to remind you that we are better together. Who wrote that song? We're better together. Ooh, we're going to play. I got to get the guitar out. What the freak, right? I mean, can I do that? My man Anonymous is on. That's my brother. He came in. Okay, Anonymous, I'm going to play you something because right now I got to eat some food. This is weird. I put on episode 2. And it came in as the prequel. Let's try this one more time.
It's Hammerlin Jameson live from the studio with the prequel to the Donald Trump Show. Ladies and gentlemen, Donald J. Trump. It's Hammerlin Jameson live from the studio with the prequel to the...
That is not good. So episode 2 didn't come through? That's really weird. Let me try this one more time. I don't think this is right, guys. Let's just see.
It's Hammerlin Jameson live from the studio with the prequel.
No. All right. Well, I'm going to play you guys something else then for now. Yes, you could share anything you want on Twitter. I don't have many people on Twitter. Yes. Okay. By the way, Denise, Sig, Dag, everybody who's been with me for a while, Rebel, say hello to Anonymous. Say hello to Daryl. Say hello to anybody else who's here. These are my people. And anybody who's new to this program, say hello to Sig, say hello to Dag, say hello to Denise, say hello to Paul, say hello to everybody who's on with us. And if I didn't say your name just now, just remind me that you're with us because I've been on for 4 hours and 32 minutes. I'm a little tired at the moment. But I got a second, third, fifth wind. Do you guys know what the hell the second, third, fifth wind is? It's crazy. Okay. Oh, yeah, I got it. Oh, my goodness. Dag's the man. Second, third, fifth wind is this. Everybody has a second wind, guys. Come on. Some people get a third wind, right? I skip the fourth wind. I go right to the freaking fifth wind. I don't need a third. What? I'm going to fifth wind. Second, third, fifth. It's a thing. All right? Look it up. Anyway, let me play you something here so I can eat this bowl of cereal before it goes totally bad. All right? I got something for you here. I've got something for you. This was just a funny thing about Nancy Pelosi. Check it out. Here we go.
It's Hammerl and Jameson. Donald J. Trump back with episode 3 of The Trump Show.
I want to thank you for joining me on episode 3 of the Donald J. Trump Show. Today, we talk about poison. That's right. Don't drink the poison. It's going to kill many people more than coronavirus. Yeah, poison. That's right. Nancy Pelosi. Yeah, I'm sorry. Some people don't know that we do call her poison. Let's take a look at this clip here. I want you to hear what she has to say.
You demonize, and then we call it the wrap-up smear. If you want to talk politics, you call it the wrap-up smear.
Let's be honest, Nancy, you know nothing about politics. And wrap-up smear? Really? That's what you've been doing to me? Sounds like something you got from your OBGYN. But whatever.
You smear somebody with falsehoods and all the rest, and then you merchandise it.
I'm sorry, Nancy, can you say that one more time? What was that?
You smear somebody with falsehoods and all the rest, and then you merchandise it.
Look, she's creating fake news. She told the reporters, you create a story. Let's get back to this clip.
And then you write it.
Can you freaking believe this?
Unless they see it's reported in the press that this, and this, so they have that validation that the press reported the smear.
You write the story after we report the falsehoods, and it becomes a validated story by the news, by you, the fake news garbage.
It's called the wrap-up smear. Now I'm going to merchandise the press's report.
Also, when she says merchandising it, who is she, Mel Brooks from Spaceballs? Spaceballs the flamethrower. Yeah, okay, poison, whatever.
Now I'm going to merchandise the press's report on the smear that we made. And it's a tactic. And it's self-evident.
You see there, she says it's self-evident because we've been doing it to Trump since he came down the escalator. Well, I have to tell you that I'm happy that I found out about this poison. Now I can put all of my efforts towards taking you down to Chinatown. That's right. We will drain Pelosi and Schumer from the swamp.
All right, you guys are freaking awesome. We just went up to 11 again. Guys, I'll tell you what. I'll stay with you all night. All right? I'll just keep getting bowls of cereal. Honey, I got honeycombs. I got freaking Frosted Flakes upstairs. I got 25 of these. We can roll through them all. You keep spreading the word, and let's jump that number up. I want me here all freaking night. Anyway, we've been here for 4 hours and 36 minutes. This is like a norm, okay? Every day of my life, we've been doing 2 to 5. We're going to go to 9 tonight. I'll play the whole freaking thing right now, I swear. Except I can't find episode 2. I guess I erased it. I'm an idiot. Let me see. Yeah, I thought I had it. I don't know what I did there. But I will look for it. Maybe I could just recreate it right now for you. Big League? How about that, Big League Pires, huh? Okay, so I'm going to play you guys this. This is episode 4. We're going to skip over 2 because we couldn't find it. Here we go.
It's Hammerl and Jameson back with episode 4 of the Donald Trump Show.
Thank you very much for joining me for episode 4 of the Donald Trump Show. Tonight, we get back into Sleep Sofa Joe. Look, we've got a lot of clips to get through, so let's get started.
I'm coming directly to you for ask a quick favor.
I can't believe they use this as their pitch on YouTube. I mean, I've come for you to... It sounds like something out of Close Encounters of a Third Kind. Sleep Sofa, are you from a different planet? I'm trying to figure out what the hell it is that comes out of your mouth. Sounds like gobbledygook.
I can hardly wait to debate him on stage. I want people to see me standing next to him and him standing next to me. We'll see who's sleepy.
Mr. Vice President, thank you. Thanks for your time. Please come back in less than 13 years, sir.
All right, Chuck. Thank you very much.
All right. It's Chris, but anyway.
Chris. I just did Chris. No, I just did Chuck. I tell you what, man, these are back-to-back. Anyway.
Sleepy, hello? It's not Chuck, okay? But you have a problem with back-to-back meetings? How do you think you're going to do back-to-back-to-back-to-back-to-back when you're president? Look, he's going to have to take a poop-a-doop in between, remember?
Why doesn't he just act like a president? That's a stupid way to say it.
You know,
I guess,
Donald
but
Trump
I
was
really
asked
wish
on...
Sorry.
Go ahead.
No, probably best I don't.
You know, I feel kind of bad for Sleep Sofa. I mean, he looks like he's going to cry. He's like an old puppy dog whining for a bowl of milk. Look, Sleep Sofa, I'm sorry. You know, you have to act confidently if you're going to be president of the United States.
I tell you what, I'm so darn proud. And those poor people who have lost, anyway.
This is your brain on drugs. That's right. Any questions?
I would see to it immediately moving toward, we're in fact in a position now that if in fact we dealt with mitigation across the board, just what we did in the last administration and before, leading to a standard that we provide efficiency for appliances.
Have you ever seen that scene in Scanners? It's kind of reminds me, I wonder if they're going to do, you know how they keep doing, oh, we're doing Jaws over. You think they'll do Scanners over and maybe have Sleep Sofa Joe in his, one of the lead characters? I would watch that, even though he makes me want to fall asleep.
I'm ready on day one after more than 3 years in office. Why isn't Donald Trump ready? Mr. President, wake up.
Can you believe that? Did he really just say for me to wake up? Is this Pinocchio and Geppetto is in the background pulling strings? Because it doesn't even look like he's alive. I feel so bad for this guy. I'm going to demolish him when we get into a debate. I mean, honestly, he doesn't even know who the hell he is. And you guys are going to vote for this guy? He's up by how many points? I mean, what the? He can't even speak, people. He said he's going to beat himself. Did you see that one? This is Sleep Sofa Joe saying how he's going to beat himself.
I'm prepared to say that I have a record of over 40 years and that I'm going to beat Joe Biden.
Well, let's hear that one more time. Joe, can you do that one more time for us?
I'm going to beat Joe Biden. Joe Biden. I'm going to beat Joe Biden.
Look, I think that's a good place for us to call it a day. He's going to beat himself. I guess I should just hang back and maybe let him fall on the sword. He may walk outside to get the mail and forget to put his pantalones on. Could be a problem. Anyway, I'll see you tomorrow on the next Trump show. That's right. Have a good night.
Oh my goodness. Freaking Sleepy is the worst. Oh, Anonymous. Okay, so I'm going to share a couple of the names I've come up with on the show for all of these ridiculous people. First of all, you got Sleep Sofa Joe. Look, he's a sleep sofa. No matter what, if you look in the cushions of the sleep sofa, you're bound to find some racism, really. And then you have poison. Look, don't drink the poison, okay? That's number 2. The other one is, I'm not sure if you know that we are dealing with this virus. It's called the fluon. That's right. It comes from Wuhan, so we might as well call it the fluon. And of course, it was dropped on this planet by the one and only President G-Hole. That's right. He's a G-Hole. Look, no matter how you look at it, he's a G-Hole, really. And then we have my favorite probably of all, which is, I don't know, is that it? I may have run through them all, actually. I'm tired, guys. I got freaking Max freaking out. It's 1:45 in the morning. He wants me to go and walk him again. It's unbelievable.
Winning big league, though. Look.
All right, so I'm going to play something longer so I can walk this dog. I got one funny for you. This one's going to make you laugh a little bit because I keep getting censored by Facebook. You all right? These jerks they're censoring my show. All right. Let me tell you a little something about that. All right. Here we go.
It's Haverl and Jameson live with episode 17 of the Donald Trump Show.
Thank you for joining me on episode 17 of the Donald Trump Show. Tonight we talk about Facebook and how much it sucks, right? I mean, seriously, Zuckerberg. I gave him every opportunity to do the right thing. But he keeps censoring the conservative point of view. Look, if you're going to censor everybody. Let's take a look at some of these clips and see what's going on out there.
You have previously given testimony to the Congress saying that there is not editorial manipulation that disadvantages conservatives.
So you're telling me that Mark Zuckerberg told Congress that he does not censor conservative content? That is laughable, really, right?
Just like in the case of Google, there have been whistleblowers from Facebook that not only have offered evidence indicating your testimony was not truthful, but there's even video that suggests that content moderators that you employ are out there disadvantaging conservative content.
You ever seen Mark Zuckerberg sweat before? Watch this.
I'm wondering if you are familiar with the experiences of Zach McElroy and Ryan Hartwig, two people who participated in Facebook content review.
Ah, friend of the Real Talk Show, Ryan Hartwig. Look, if you want to hear the real scoop about Zucks, you should check out the 3 times that Ryan was on the Real Talk Show. Anyway, let's see what else is here.
And what is your response to the very damning video evidence and the testimony from them that the culture that you lead within Facebook is one that disadvantages conservatives and leads to content manipulation?
Now that is a question I would like the answer to.
I'm somewhat familiar with the concerns that they've raised. As I've said, we aim to be a platform for all ideas.
Is Zuckerberg out of his freaking mind? What is he talking about? The last thing that you are is a platform for all ideas.
We got into this because we want to give everyone a voice.
Everybody gets a voice. Unless you disagree with Mark Zuckerberg's political leanings, of course.
I certainly do not want our platforms to be run in a way that has any ideological bias.
An ideological bias? Are you serious? You know you Zuck, right? I mean, you 100% are biased against me. You're biased against anybody who loves America.
And I want people to be able to discuss a range of issues.
A range of issues that you choose, right, Zucks?
When people raise concerns like that, we do look into them to make sure that that everyone in our operation is behaving and upholding the standards that we would like.
So basically you're saying that everything's going to plan.
I know that we have ongoing training in what we do.
I think what we're trying to tell you is that your training sucks.
I'm concerned that the content review does reflect the values of the company, but those values don't in fact give everyone a voice. They prejudice against certain content.
Matt Gaetz with the left hook.
It seems disingenuous for you to suggest that these videos come out that are very damning, that show the people that you trust with content moderation admitting on video that they disadvantage conservatives, that they label people who support the president as a way to push down their content and limit the reach of that content.
Just like the way you've been holding down the Real Talk Show. You don't like it when they push the Trumper. Look, you can't stop the Trump.
For you to then come to us many months later after that was all over the news and the internet and say, well, you know, you'll get back to us and you do a little training, it seems to suggest that you don't take these allegations and this evidence very seriously.
Is it me, or does Mark Zuckerberg look like an Antifa guy right now? Look at that look in his eyes. He doesn't like being told what to do.
would you at least be willing to acknowledge, based on the irrefutable evidence before us that you don't seem to have investigated, that it is possible that at Facebook, your employees do have the power to disadvantage conservative viewpoints, and that they in fact have used that power in ways that we need to root out?
Oh my, Zuckerberg's got his hand in the cookie jar.
Congressman, my testimony in the past and today is about what our principles are as a company and what we try to do.
What you're trying to do is steal an election from Trump.
And when you fire people as a consequence of their politics...
Wait, what?
Do you think that that impacts the culture and perhaps empowers some of the content moderators to also treat people worse as a consequence of their politics?
I'm not aware of any case where we have fired someone on behalf of their politics, and I would say that that would be an inappropriate thing for us to do.
Now, I have it on good authority that they got rid of Ryan for his political leanings as well, but let's listen in to what Matt Gaetz has to say here.
Why did you fire Palmer Luckey? Palmer Luckey's NDA with you, I only have 10 seconds, but Palmer Luckey's NDA with you doesn't allow him to talk to anyone except government officials. I'm a government official. I've seen the messages where you have specifically directed Mr. Luckey to make statements regarding his politics for the benefit of your company.
I'm pretty sure that's a no-no, right?
So I think both in the case of these content moderators and in the case of the testimony you just gave regarding Mr. Luckey and firing people over their politics, there is serious question as to whether or not you're giving truthful testimony here or whether it's lying before Congress. I see my time's expired and I'll yield back.
Bravo! Mr. Gaetz, you have arrived. I can't believe what I just heard. You took Zucks down. Almost like you're a billionaire. Maybe one day you'll be a billionaire, at least 120 millionaire like Pelosi. I don't know. Anyway, look, let's see if there's anything else here.
We certainly try to do this in a way that is neutral to all viewpoints. We want to be a platform for all ideas.
Is that Mark Zuckerberg or Mark Zuckerbat? We're a platform for all, for people to have a voice, everyone but Trump.
I don't think you build a social product with the goal of giving people a voice if you don't believe that people being able to express a wide variety of things is ultimately valuable for the world. And we try to make sure that our policies and our operations ultimately reflect and carry that out.
Then how could you ever censor the Trump when you know the world values everything that I say?
In terms of the people setting the policies, I think it is valuable to have people with a diversity of viewpoints involved so we can make sure that we have the different viewpoints represented in the policy development process.
Guys, look, it's Diversity Mark.
And we also consult with a number of outside groups whenever we develop new policies to make sure that we're taking into account all perspectives.
Are you kidding me? That sounds like something that he just made up.
I mean, you said you reach out to outside groups. Can you think of one conservative outside group that you reach out to and use as a content moderator?
I have to say, this guy's fantastic. His line of questioning gets right to the heart of it.
Congressman,
Did you hear that? Yeah, you're caught out, Mark. I'll tell you, this should be the trial of Mark Zuckerberg.
Real quickly, can you briefly explain the approval process for third-party fact checkers and how many fact checkers does Facebook employ?
We work with about 70 fact-checking partners around the world, and the goal of the program is to limit the distribution of viral hoaxes, so things that are clearly false.
So you're not doctors, but you feel you could censor any doctor who talks about success that they're having on coronavirus. I think that's an overstep of your powers there, Zuckerdick.
But we don't ourselves want to be in the business of determining what is true and what is false. That feels like an inappropriate role for us to play.
Says the guy who's playing that role. Look, I have a feeling we're going to have a part 2 of Facebook Zucks, so stay tuned. And I'll see you tomorrow on the next Donald Trump Show. Have a great night.
Unbelievable. How long? How long have I been off the screen while you've been waiting for me to show up, people? Hammerlin Jameson ready to let off the fake news. That's not it. Where's Hammer? There's the ham.
It's Hammerlin Jameson live with episode 17 of the Donald.
All right, so that's the Zuckerty episode. Let's see what I missed over here. Sorry, I was in the middle of getting myself cleared out over there. Let's see. Anonymous, what are you doing, buddy? Listen, this is a platform for the planet. No matter what. Oh my goodness, you're out of your mind. The names we've come up with on the show, it's funny. Everything that I've come up with on this show is silly. Like President G-Hole, really. And Nancy Pelosi. But I think my favorite is to call Joe Biden Sleep Sofa Joe. I have this idea I'm going to do my Joe Biden impression. I just need someone to film me. Come on down to Sleep Sofa Joe's. Look, we got all kinds of sleep sofas, all different colors and fabrics and sizes. Try the Senator, a lumpy miss, just like me. My Aunt Judy told me. All right, let's see what we got over here. I'm going to play you guys something that you're going to really dig on, okay? Hiding Biden, that's right. You know, the other one good, Rebel, here's a really funny one too. So, we haven't seen Jen in the last couple of days, but when Jen comes on, he came up with a few good ones. He came up with a great one. Joey Futon. Look, it's Joey Futon. You put him in your futon, and it's cool, right? I'm going to go all the way to episode 24 real quick. We're moving around. Check it out.
It's Hammerlin Jameson live from the studio. Ladies and gentlemen, Donald Trump with episode 24 of the Donald Trump Show.
Thank you. Thank you very much for joining me on episode 24 of the Donald Trump Show. That's right, tonight we're talking about bumbling Biden sleeps over Joe. Some people call him Joey Futon. And we had a fake video of him falling asleep on camera. I've got to tell you, it looked real. Because he sleeps all the time, I thought he absolutely fell asleep on camera. We're going to take a look at some clips of the sleep sofa. Can you press the VCR? Let's go.
COVID has taken this year, just since the outbreak, has taken more than 100 years.
It's taken 100 years? What the hell is Sleep Sofa Joe talking about? Look, coronavirus has already taken 100 years.
Look, here's the lives. When you think about it.
Look, everybody, it's bumbling Biden. He decided to pop his head out of the hole. It's Groundhog Day. Oh, 6 more weeks of race wars, apparently.
More lives this year than any other year.
Look, I understand that Sleep Sofa has taken over a ton of Bernie's policies, but what's with trying to look like Larry David? Is he trying to become Bernie? I don't know. I'm trying to figure it out.
More than 180,000 lives in just 6 months.
Oh, so now Trump is responsible for the comorbidities of the United States. I didn't realize that, Sleep Sofa Joe. You know, there was roughly 10,000 people that died from COVID alone. The rest had 2+ comorbidities. We have a lot of problems here, Sleep Sofa. In office for 47 years, and everybody got unhealthy on your watch.
An average of 1,000 people dying every day in the month of August.
And there he goes again. Sleepy, I've got the numbers right here. It wasn't 1,000 a day. I mean, let's just do simple math. I know you're good at simple things. But we had 120,000 deaths in the first 1 million cases. And we're up to like 183, I think. And that's 63 more. Over 6 million more cases. So where do you get your math, Sleep Sofa?
You really feel safer under Donald Trump?
So let's get this straight. I keep offering assistance to all of these Democrat cities. They send me very upsetting letters. They made me cry, really. Maybe if you came out against the violence that your lefties are doing there, Sleepy, then we would be able to have a conversation.
Mr. Trump.
It's Mr. President to you. You want me to call you Mr. Magoo?
You want to talk about fear?
Let's talk fear, Sleepy. Mr. Dramatic Pause. Or did you just forget your train of thought again?
Do you know what people are afraid of in America?
That somehow a Sleep Sofa will become president, and his vice president will push him down the steps in order to become president.
Afraid they're going to get COVID.
You're right, Sleep Sofa Joe. They're afraid they're going to get a virus that 99.6% of the people survive from. They're more afraid of getting you as president, really.
They're afraid they're going to get sick and die.
You know, Sleepy, you're right. People don't get sick and die when Joe Biden is president. Nobody died when Barack and Biden were president. Remember that, people?
And that is in no small part because of you.
Hey, Sleepy, what happened at the beginning of all this when I decided to close the borders to China? And you said, he's a xenophobe, he's a racist, we should impeach him. And what happened there? I think we'd have a lot more dead people, so why don't you go back into your cave and take a nap? And I'll see you on the next Donald Trump show. Have a good night.
Freaking Trump show. Can't believe I retired it. 25 episodes and a prequel. It's enough. I think it's enough. Possibly enough. I'm not really sure. Did you guys see this? This is insanity. What the hell is going on over here? Hold on a second. That's not it. What the hell? This is me doing about 14 voices.
It's Hammerlin Jameson with episode 22 of the Donald Trump Show. Ladies and gentlemen, Donald J. Trump.
Thank you. Thank you very much for inviting me to speak at the 600th episode of the Mark Pires Real Talk Show. It's been quite a journey. I have to say, he's done a lot of face swaps. He's done a lot of different shows about the Trumper. But on top of that, he's got some episodes of the Trump Show that are pretty good. Making fun of Pelosi, Sleeps Over Joe. You know, we're calling him Joey Futon now as well. He's a futon. You can get futons or sleep sofas when you stop by Sleep Sofa Joe's warehouse. Comes in 7 fabrics and sizes. The Senator, it's a lumpy mess. Just like the Sleep Sofa, really. Look, I've got a few people that want to say happy 600th day to Mark, so let's get into it and see who we got. Number 2, it's been 600 days, and he's still alive.
No matter what we try, Dr. Evil, he keeps broadcasting.
But Dr. Evil, he did not follow our projections. Silence! Enough of this insolence. Everybody gather around. Look, I've got a plan. If we can just... Wait, no, hold on. Where are you taking me? Wait, let me go back because I'm trying to share my plan with them. Okay, let's send in the murder hornets. Are you kidding me? Dr. Evil called? Look, I'm kind of pissed at Dr. Evil right now. Pocket dialed me last time. And I think he's working with Fauci and Bill Gates. That's right, Evil Gates. Anyway, that's another story. What else we got? Yeah, I got one for you. It's Mark Pires' 600th day in a row. And I called Artie to see if he wants to say anything. Hey, Artie. Yeah, I'll say hi. 600 days. That's freaking crazy. Congratulations. You know, I don't know about you, but I miss that tag team duo. Seriously, Norm Macdonald and Artie Lang? That's a match made in heaven. I'm wondering if God had that plan. Look, if we put these two together, they're going to make magic happen. Anyway, what else we have?
Hi, Mark. It's Mark Zuckerberg. Look, congratulations on 600 shows, but I'm going to continue to block your show because I don't like your content. Maybe if you didn't talk about Donald Trump, I wouldn't suppress your program. But I zuck.
So wait, let me get this straight. So you censor the Real Talk program, and then you're going to call and say congratulations? Oh, congratulations, Mark, for broadcasting and me blocking you every single time. You're doing great at getting it nowhere. Anyway, what else we got?
My name is Chuck Schumer. I'm here to talk about Sleep Sofa Joe and Mark Pires, 600 days in a row. It's pretty impressive if it was not Mark Pires. If it was a Joe Biden or a Democrat, I would really think it's great.
I gotta tell you, I almost hate this guy as much as Pelosi. All right, who's next?
I just wanted to wish Mark Pires a happy 600 days. That's a lot of days in a row. And we've been working on the coronavirus vaccine for like 20 years now. So I know what he's going through. But it's quite an effort. And I'm hoping that he can get people to take our vaccine.
Look, we all know you're trying to vaccinate the world, Bill. And I just want to strap you down and give you the first dose.
Well, hi, Mark. It's Sleep Sofa Joe Biden. I know you've been calling me Joey Futon, but look, I plan on beating Donald Trump in November. The fact is, I got an earpiece in. They're telling me everything to say. And if I don't say it right, I got the teleprompter as a backup. My Aunt Judy told me I could be a heck of a president, Mark. So I'm counting on you for your vote. Gotta beat Donald Trump, and we need the Real Talk show.
Normally I'd be like, that's cool, but it sleeps over Joe, and I'm actually kind of surprised he didn't fall asleep, Mark, during his little speech there. But there's still time between now and November for Sleep Sofa Joe to fall asleep on his futon. That's right, Joey Futon. What do we got next?
Hey, Mark, it's Al Pacino. Just want to wish you happy 600.
Not many people cooler than Al Pacino. You know, I'd love to get a cappuccino with Al Pacino. Maybe a Dunkachino with Al Pacino. I don't know.
My name is Andrew Cuomo. I've been here doing this Real Talk program a few times now. It's 600 days. You know, I was on here last at 500 days. I said this guy's going to go over. There's no way he's not doing under 1,000. Okay? But look, COVID's serious. If you need some PPE, you can send them to New York, and I'll put them in the nursing homes. Look, I gotta go, but happy 600, Mark.
Freaking Cuomo, right? Unbelievable. How's your Cuomo doing? Andrew, I'm pretty sure Mark does not want to hear from Cuomo. But you have a really nice Cuomo, much better than mine. Guys, what's up? Gary V. Look, 600 days in a row, Mark Pires, Real Talk. I can't believe it. This guy's on fire. He's going to go all the way to maybe 15,000 days. And look, I just got to tell you, nobody else has got that. Nobody else is doing it. So crushing it. 600 days, crushing it. I think this guy's going to go until the sun burns out. I mean, I've never seen anything like this. Those are some kind words for the Real Talk show from Gary V. Gary Vaynerchuk, I'm not sure. If you don't know Gary V, then you must not be on social media. He's a good guy. He's rising up. Anyway, 600 days in a row is a big deal, and Gary V believes it. What else we got? Anything else here?
Mark, I just heard the news. 600 days in a row. I can't believe it. Last time we talked, it was 500 days, and you just go. You like the Energizer Bunny. Oh, no. I did. I told you back then at 500, put your head down. Just go, man. No one can stop the bright light within. 600 is nothing. Look, Mark, go until the stars burn out.
we actually found somebody cooler than Al Pacino. Christopher Walken's the man. Do you ever see him in Dead Zone? It touches things, and he can see the future. I wish Trump could do that for November. Find out who's going to win. Me or Sleep Sofa Joe. Look, remember, you can sleep on the sleep sofa all you want. You also may find some change in the cushions in the sleep sofa if you're looking around for some spare change. That's all Sleep Sofa Joe has is kind of like loose memories. And also he takes naps on his Joey futon. That's right. I'll see you guys on the next Donald Trump show, but 600 days of real talk. Looking forward to hitting 700, 800, all the way to 1,000. And then we go and put our foot on the gas. That's right, people. We're just getting started. It's going to take time, people, but we're going to win big league. Have a good night.
Oh, my goodness. Yeah, Mom, come over. You're over on the D Live. We need to get you over to the Tube again. You were with us last night. Hopefully you'll join us. So, guys, that episode was pretty cool, right? I love all these Trump episodes. That one is where I just played every episode. Shows you a little bit of my range. I got a funny little side clip because I'm starting to get tired here, guys. But if you rise, I gotta keep going. Anyway, check this out. This is a funny little bit.
Hammerl and Jameson live from the studio. Donald Trump coming at us from the Rose Garden.
Look, I'm telling you right now, the country turns to crap with Sleep Sofa Joe. In the Oval Office, he's going to get rid of the chair at the desk, and instead he's going to put a sleep sofa right there. Oh, wait, no, I'm sorry. I'm getting a word in my ear right now that he will be the Sleep Sofa in the White House. They're going to call him Sleep Sofa 1. They're going to have a nickname for Biden. It's going to be Sleep Sofa 1. Like for me, they call me Mr. Billions. And look, we all have a nickname. Just Sleep Sofa is going to be Sleep Sofa 1. I don't know. We're going to work on that one, especially, well, we'll come up with the titles before Sleep Sofa takes over office for me. I can see it already. Sleep Sofa 1 on the move. It's going to be hilarious. Patsy and I have been talking about it behind the scenes. I said, look, worst case scenario, Patsy. If we can't beat the Sleep Sofa, then leave him a nice present as he arrives into the Oval Office. Oh, yes, please, I'll take my coffee. Oh, he's already taking a nap. Sleep Sofa 1 is napping. Oh, I could see it already. I almost want to lose, just so I could speak to the Secret Service afterwards and hear all about it. But anyway, we'll get back to that. I think I'll see you tomorrow for the next Trump show.
Anon, I'm pretty sure he has no idea what the hell I do. And I just have fun. Honestly, I think that unfortunately Sleep Sofa Joe is just the worst. He's a sleep sofa. It's not that I call him. He literally is a sleep sofa. You could take a nap on him. Why would I not nap on the sleep sofa if he's so comfortable to put my head on? But he may sniff it and start licking my ear or something. He's such a creeper. Anyway, I want to play... I don't know if I'll play you the whole thing, but this first line makes me laugh so hard. Check this out.
It's Hammerl and Jameson live from the studio. Donald Trump discusses President Xi and Biden.
Thank you. Thank you very much. So glad to be standing in front of you on this Friday. We've got a lot to discuss. China, do you hear about Bill Barr? Attorney General Bill Barr got up and said China is the worst thing to happen to America since China. That's right. We already had a problem with China, and we kind of let them come back. I think it may have been Reagan. It's not a good thing, I know. But China becomes part of the World Trade Organization again. And then, of course, they're going to let them do all kinds of things and they're taking advantage of our country. It's important for you to understand that we're going to hold China and President Xi accountable. That's right. I know. Look, the Wuhan, China, they had their worst year in 67 years. And it's because of Trump. So we have to try to give them another bad year. Nobody has put more time and effort in than my number 2. That's right, Mike Pence, the greatest number 2. Mikey Pence. I call him Pensy. That's right, we have nicknames. Pensy. Of course, we call Biden Sleep Sofa Joe, or Bumbling Biden. He's a bumbling Biden. I joke that he's a bumbling Biden sleeping on the sleep sofa, but he really instead is the sleep sofa. Look, if I lose, it's going to be doubly bad because Sleep Sofa Joe is going to beat me. The guy can't even string 3 words together without a teleprompter. But look, we'll see what happens in the debates. Looking forward to it, Sleep Sofa. Bumbly, 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 bumbly. We'll have a lot of fun. Anyway, look, I gotta go.
Oh, my goodness. I gotta tell you, Anon, the stuff that comes out, I have no idea, man. Seriously, it's so crazy how my mind works on these things. I'm going to play you another one. Just because I want to show Anon something pretty cool. So, everybody has a problem with Trump. Everybody has a problem with Trump wanting to build a wall, right? Look, we need to build a wall. We're going to try to keep the really bad murderers and rapists out of the country, okay? Look, we have a couple of friggin' doors they could come through. Just put your name down on a piece of paper or something. What the frig? You can't do that? Are you kidding me? So anyway, this is what happens. The Great Wall of Trump.
It's Hammerlin Jameson live from the studio with episode 9 of the Donald Trump Show, The Great Wall of Trump.
Thank you very much for joining me. Episode 9 of the Donald Trump Show. That's right. We're going to get into it today. I've got a lot to share with you. Border wall. Everybody's always saying, Trump, when are you going to build the border wall? We're building the wall. But they gave me such a hard time. Such a hard time.
The President of the United States, having failed to get Mexico to pay for his ineffective, unnecessary border wall.
We'll get back to Schumer and Pelosi after some other clips. I think you guys may like these others. It will put it all into perspective. It's Trump Show. I'm just going to show you how other presidents felt about immigration.
The bill before us will certainly do some good.
Well, let's start with that. He says he wants to do some good. Let's see what's next.
It will authorize some badly needed funding for better fences and better security along our borders.
Holy cow. Obama wanted to put up a fence. Nobody cares. I want to build a wall stronger. They have a problem with that. We're talking Three Little Pigs, people. He wants to use a fence. I'm talking about a wall that the big bad wolf can't blow down.
The fence is now basically complete.
Wow, Barack, you got 5 years out of that fence. Good job. We had to start building an actual wall because what you did was crap.
Maybe they'll need a moat.
Or maybe they'll need a wall.
Maybe they want alligators in the moat.
Now that one I have to give Barack. That was hilarious. Still, I'll take the wall.
Every place in this country are rightly disturbed by the large numbers of illegal aliens entering our country.
Bill Clinton says illegal aliens and everybody applauds and they get behind him. But Trump does and they call him a xenophobe and a racist.
The jobs they hold might otherwise be held by citizens or legal immigrants. The public service they use impose burdens on our taxpayers.
You see, they're always with you when they need the vote. But as soon as they get in office, they turn on you. Get used to it, people. It's the way it's always been with the Democrats.
That's why our administration has moved aggressively to secure our borders more.
Can you believe that?
By deporting twice as many criminal aliens as ever before.
Maybe I should hire Bill to say his words / my words on the campaign trail.
I voted for a fence. I voted unlike most Democrats, and some of you won't like it. I voted for 700-mile fence.
Wait, Sleep Sofa Joe voted for a fence too?
Let me tell you something, folks. People are driving across that border with tons, hear me, tons of everything from byproducts from methamphetamine to cocaine to heroin.
And listening to Sleep Sofa talk about the same issues I have with illegal aliens is just kind of laughable.
It's all coming up through corrupt Mexico.
Joe Biden mentions the drugs. He mentions the illegal aliens coming across the border. And he wants 700 miles of fence. No problem. He's not a xenophobe. He's not a racist. You call Trump whatever you want. That's the problem. You guys just make up your fake news. What do we have next? Anything left?
Former presidents have said to him that they wish that they had built a wall. Do you recall President Obama ever saying that?
Come on.
Bumbling Biden. At it again. Look, guys, you could tell it's a double talk situation with Biden. Everybody before me wanted a wall. Remember when Schumer said ineffective wall?
Construction of a 630-mile border fence create a significant barrier to illegal immigration on our southern land border.
So let me get this straight. In 2009, a fence is significant, but in 2020, a wall is ineffective? Really? Everybody before me wanted a wall. Trump gets it done.
All right. I'm scattering around because, Anon, you have to come back tomorrow and see all 26 episodes of this show, but I'm going to rock you on to episode 7 real quick. But I want to just make a clear... I want to make a line across the sand that we're living in a world right now that's kind of sad. And you know what? It's really easy to get sucked into it. It's really easy to start all of a sudden, like, responding in kind. And what I think we need to figure out how to do here on this platform is to find the funny in what's not necessarily vulgar and what's not necessarily offensive. It's weird to say. Something that I think is interesting, and I've had a few people mention, I've been live for 617 days. I don't think I've ever sworn. Maybe I've let an F-bomb slip randomly when I'm in the middle of a really heated moment, but I don't think so. A couple of words, I'm almost there. But anyway, I try to make people laugh without swearing, without saying anything that's offensive, but that being said, the snowflakes of this world are so offended by anything. You're a racist no matter what you say. My philosophy is this. I've been live for 617 days in a row. I do right now 5 hours and 21 minutes right now. Do you guys realize how we've been on for 5 hours and 21 minutes? And I'm here because what I'm meant to do is connect this planet. I know what I'm meant to do. I've been doing it, but nobody's been showing up. And you guys are here now. Now, when I mean nobody's been showing up, Sig's been showing up, Dag's been showing up, Denise has been showing up, Paul's been showing up. And now, my new friends are here. And Anon, you're my new friend. And I'll say this, that I hope you understand it. I got a space in my heart for each and every one of you guys. And all I could ask is when you come here on this platform, just remember that I'm about love and I'm about us connecting. And if we can do that together, and just keep in your mind that you can go any other platform out there and you can get that out, the other thing. But here, I want you to dig deep and I want you to find something positive and then bring it to the surface. Because I'll tell you what happened last week is Jen, who's not on today. Jen is a cool dude. And Jen was on here and he starts throwing out ideas. Because he was loving Sleep Sofa Joe. He starts throwing out ideas and he goes, what about Joey Futon? And at first I thought he was saying I look like Joey Fatone. I'm like, what? I look like Joey Fatone? And he goes, no, Joey Futon. And I'm like, oh my goodness, are you freaking kidding me? That's genius. That is the most brilliant name besides Sleeps Over Joe and I'm Bumbling Biden. Look, he's a Sleeps Over Joe, Bumbling Biden, taking a nap on his Joey Futon, really. And so I got this because, I don't know, guys, something weird happens when we start connecting positively. And it's not a weird thing. It's a very beautiful thing. And creativity is there in the moment of like people reaching out and connecting. And we're right now being pushed into a new society where they keep calling it a new normal, where we're not even allowed to shake hands anymore. We can't even hug people anymore. It's a really weird world we're living in. And I just hope that we can all together connect. If there's one place on this planet, on this platform, that you guys can come and be like, I don't have to worry about anybody coming after me, knocking me down. All I know is when I go to the Real Talk platform, everyone's lifting me up. And just keep that in mind whenever you're feeling down. Whenever you had one of those days and you're just like, I got to get something to just kick me to a new level. I start this show every day. I'm doing something for Nan right now. He's going to see for the first time. I start my show every day like this. It's Monday. It's Mark Pires. I had to do that for Anon. So I used to do this originally. I'd be like, and it's real talk. And then all of a sudden, I started doing like that. I was like, and it's real talk. And then my mic was like in the way. So I did the baseball swing. Didn't realize that. And all of a sudden now I was like, what's with the baseball swing? And I realized it when I'm like, Mark Pires Real Talk. By the way, this is my song. Something to die for. Listen, there is something to live for. There's something to die for. And to me, it's this program. I've been live for 617 days in a row with you because I think it's important for us to come out here and connect every day. And I'll do it every day for the rest of my days. And I hope I could stay healthy. Now, honestly, doing 5 hours and 25 minutes when I'm planning on coming out tomorrow to do the entire Donald Trump saga, which I'm calling the Donald Trump Show. But I'm going to play you one more, at least. Because you guys are with me. And now you're growing. We got 9 on. We're going to be on until 10 in the morning. What the freak. I got something great for you. So this is what I wanted to play for Anon because I think he's going to really dig this. And this is probably one of the funniest episodes in the world for one reason. Where is it? Okay, here we go. Guys. Rap rock? Really? Check this out.
Hammerlin Jameson, live from the studio. Donald Trump joins us for the 7th episode of The Donald Trump Show.
Thank you very much for joining me on episode 7 of The Donald Trump Show. We're going to get right into it today. I've got a lot more on Sleeps Over Joe. That's right, we're calling him Bumbling Biden as well now. So let's get into it. What do we got? First clip of the show.
We gotta reassure, look, my message to everybody I talk to is we're gonna get through this.
Are you sure, Joe? It looks like you can't even get through a sentence.
We provide a Medicare option. That's exactly what Rap Rock and I talked about in the beginning.
I'm sorry, did he just call Barack Rap Rock? I didn't realize he had a pet name for Barack Obama. Hey, Rap Rock, let's get together and go and talk about that foreign policy. Hey, Rap Rock, you want to get together and play some basketball? Hey, Rap Rock, could you make me a PB&J? Absolutely hilarious.
I made a mistake. I said it 14 years ago. I trusted George Bush to keep his word. He said he was not going to go into Iraq.
This is when it gets really interesting. You ready?
Only
only way we're going to get rid of Saddam Hussein. And it's going to require guys like you in uniform to be back on foot in the desert, taking taking Saddam down.
Wait, I'm sorry, but didn't you just say that you were against the war, Sleepsover? I think he's losing his memory again.
From the moment shock and awe started, from that moment, I was opposed to the effort and I was outspoken.
Let's take a look at Outspoken Joe. Yes, maybe his news. Maybe we'll call him Outspoken Joe if it's good. Let's see.
Some of my own party have said that it was a mistake to go to Iraq in the first place. But the cost of not acting against Saddam, I think, would have been much greater. The President of the United States is a bold leader, and he is popular.
No, after that clip, that's it. We're going to call him Backtrack Biden. That's right. He backtracks. He said that he didn't support the war, that he's talking about George Bush like they're best friends. I'm not sure what's true with Sleepsover Joe.
When I marched in the civil rights movement, I marched with tens of thousands of others to change attitudes. And we changed attitudes.
When I was about the age of the guy standing over there, I got involved in the civil rights movement.
And now, the truth.
I was not an activist. I was not out marching. I was not down in Selma. I was not anywhere else.
Okay, so basically, Sleepsover Joe never did any actual protesting, although he's been campaigning on it for his entire career.
The first year in law school, I decided I didn't want to be in law school and ended up in the bottom 2/3 of my class, and then decided I wanted to stay, went back to law school, and in fact ended up in the top half of my class.
Look, I really want you to pay attention to the detail in this video right here.
I think I probably have a much higher IQ than you do, I suspect.
I'm pretty sure that your IQ is a moving number, Sleepsover.
I went to law school on a full academic scholarship, the only one in my class to have a full academic scholarship.
So let's get to the truth.
Senator Joseph Biden may have more explaining to do.
The new questions stem from taped remarks of Biden during an April campaign appearance in New Hampshire.
And in fact ended up in the top half of my class. I won the International Moot Court competition. I was the outstanding student in the political science department at the end of my year. I graduated with 3 degrees from undergraduate school and 165 credits, only need 123 credits, and I'd be delighted to sit down and compare my IQ to yours if you'd like, Frank.
If I can say one thing.
Look, the facts are Sleepsover Joe was a terrible student.
Biden now concedes he did not graduate in the top half of his law school class.
He didn't?
That he does not have 3 degrees from college.
He doesn't?
And that he was not named outstanding political science student in college.
Really?
Newsweek says Biden actually went to school on a half scholarship, ended up near the bottom of his class, and won only 1 degree, not 3.
I'm sorry. I can't stop laughing. Back then, I guess they didn't fact check you in real time. That must have been a couple weeks later. So funny.
Now Biden says Newsweek is right. His memory had failed him.
Sleepsover Joe makes up things. Bumbling Biden. Did you hear him bumble there? He's a bumbler. Bumbling Biden strikes again. Bumbling Biden. Look, he's a bumbler. You know it, right?
So you saw a couple of really good episodes. I'm going to play one more that I think is really funny. Well, they're all really funny, guys. That's the thing. Like, you're not going to miss on any of them. I got one that's going to kill you. Okay. My favorite number is 13. We talked about it a few times tonight. And when I got to episode 13 of the Donald Trump show, I was really nervous because I had 12 really good episodes in a row, and I'm like, I don't want to destroy it on my favorite number. How could I ever one-up number 12, 1 through 12, and do something really good on 13? And all of a sudden, the clip presented itself to me. And you guys will remember this clip as soon as you see it. Here we go.
It's Haverl and Jameson with the exclusive Donald Trump with episode 13 of the Donald Trump Show.
Thank you very much for joining me on episode 13 of the Donald Trump Show. Tonight, We're talking about this stupid ad that just came out. Did you see this? Sleep Sofa. That's right. He's sitting with Obama. They're sitting together. And actually, I thought Joe was going to fall asleep a few times, but Obama, I guess he's pretty charismatic. He kept his attention. So let's get to it.
I don't understand his inability to get a sense of what people are going through.
That's very interesting, Joe. I'm wondering if you'll ever be able to get a sentence out without sounding like you're falling asleep.
He just can't relate in any way.
I can't relate. That's funny. I can't relate to your communist leanings, no, Sleep Sofa Joe. That I cannot relate to.
One of the things that I have always known about you, Joe, it's the reason why I wanted you to be my vice president and the reason why you were so effective.
Effective? He was effective at smelling young girls' hair and whispering in their ears. But what else did Sleep Sofa Joe do while he was in the White House?
Ways in which presidents motivate people. By doing something really ignobling. Doing something really ignobling.
I believe Joe thinks that ignoble's a good word.
Ignobling. Important, and people go, oh. Or to do something really bad.
Oh, wait, Sleep Sofa, you've got me confused now, because ignoble means dishonorable, and then you said really good, or really bad. I'm really confused, Sleep Sofa. I think you're not really sure what the dictionary definition is for ignoble.
This guy has generated a sense out there that people are waking up to, that he ran by deliberately dividing people from the moment he came down that escalator.
Wrong. I've been connecting people to the truth, Sleep Sofa. That you, Obama, and all of your cronies have been taking advantage of this country. You for 44 years. I don't know how that has been possible.
I think people are now going, I don't want my kid growing up that way.
Wait, hold on, Sleepy. So you're telling me kids don't want to grow up winning? Oh, no, they want to be losers like Sleep Sofa Joe. Joe, they all want to be winners, okay? Stop telling people to lose. I shouldn't be surprised, though. Being vice president is like winning the silver medal at the Olympics.
You know what it's like as much as anybody.
What are we talking about now? Falling asleep on camera? Pooping your pants? Just elaborate, Barack.
To be in the White House during a crisis.
Oh, I'm sure you got a lot of great information out of Bobblehead Joe.
You know what it's like to have to...
I just have to ask, why does it take Barack so long to form, like, the simplest of sentences?
Get laws passed through Congress.
You know, I'm really glad you brought that up, Barack. Because Sleep Sofa Joe does have some experience drafting the crime bill in 1994 that put a lot of people in jail. Too many to count, I believe.
You know what it's like to deal with foreign leaders.
Barack Obama with another direct hit. How did you do in Ukraine, Joe? That's right. And how about your son, Hunter? Been looking for him. I have a couple of questions. Attorney Bill Barr will be calling him. You may want to let your son know.
You know what it's like and how lonely it can be.
Look, you're probably right, Barack. It must get really lonely for Sleep Sofa Joe, those couple of thoughts running through his head on a daily. It's okay, Joe. Just take a nap.
To make tough decisions where not every decision is going to be perfect, but you got to make them.
You know, Barack, it's kind of hard for Joe to make any decisions at this point.
And to take responsibility for it.
I do have to say I give that to Sleep Sofa. I've heard him say he's going to do a boom, 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 so he does take responsibility for his poopers. Okay, does it or does it not seem like Barack is thinking the same thing?
And the thing I've got confidence in, Joe, is your heart and your character and the fact that you are going to be able to reassemble.
Okay, so wait a second. What is Sleep Sofa? Bumbling Biden going to reassemble? He can't even assemble a sentence. He doesn't remember his name half the time. He said he's Joe Biden's husband, Joe Biden. That's stupid.
Reassemble the kind of government that cares about people and brings people together.
Look, I think Joe could bring people together for a nice nap, okay? But he's not going to accomplish anything except be the Muppet puppet for the left. I have to laugh, though, Barack. You say to help and care for people, but you're the ones who are causing all the problems right now. Anyhow, this was the 13th episode of the Donald Trump Show. We're going to continue to dig deep into the sleep sofa and find what's in the cushions. And I'll see you tomorrow at the next Donald Trump Show.
Oh my goodness. So guys, that was a killer episode. But I'm seeing you guys talk on the side here about Planet Nibiru. And I want to chat about that a little. We know we've been so caught up in Dr. Fleming and coronavirus and everything else going on. I watched a documentary. It wasn't a documentary, it was actually like a VHS tape switched to DVD called Ancient Alien Civilizations and something else. Ancient Alien Civilizations was basically what it called, something like that. With Dr. Jeremiah Sitchin. Is it Jeremiah or was it? Yeah, it was Jeremiah, right? Or Zachariah. Zachariah Sitchin. Jeremiah Sitchin. I think it was Zachariah. Dude killed me. I mean, literally, I played this for my straight up genius scientist friend who works at a facility similar to, like, you know, the UTC. You guys know UTC? Anyway. He watched this with me, and there's a couple things that stood out. One of them was that, you know, the ancient Babylonians, they wrote Sumerians, they cataloged all of their thoughts and their history on stone tablets. And he made a point of saying, you know, you think your VCR is so high tech. And we didn't have phones, but we think our phones are really high tech. And all of a sudden, in 10,000 years, how's that cell phone doing? How's that carrier? How's the VCR? How's that running for you? The tape that they made? All gone. But those stone tablets. So, what's high tech? And I'm like, man, I love this guy. So he starts telling me about, and by me, I mean us, that there's a handful of people in this world that know how to read ancient Sumerian. He's one of them. So, you know, some of these texts that I've come across stick out as strange. For example, they talk about 10 planets. And actually, I think it's 12, because they talk about the sun and the moon. He says, geez, 12 planets, sun and the moon being included. That means that there's 10. Now, I maintain that Pluto's a freaking planet. I don't know what these a-holes did out there, but it's a planet. I don't care how small it is. It's a freaking planet. Okay, so there's your ninth, and then you have Nibiru, and so he starts explaining something. One of the different stories or texts that they came across was that the Earth is the 7th planet in the solar system. 7th? It's the 3rd, isn't it? Because we see it as sun out, and we are the 3rd rock from the sun. Whoever was told the story, whoever cataloged this story, placed us as the 7th planet. And the only way that would make sense, Zachariah, thank you, Anon, The only way it would make sense, Zachariah said, is if you came from outside in. And as you pass each planet, geez, the seventh one would be the Earth. Throughout time, they've always said that this theory or whatever was written was crazy because they thought that there were 6 planets, there were 7 planets, there were 8 planets. They've always continued to see things as soon as they've had the technology or created the wherewithal, the ability to see that far into the galaxy. And Galileo, I think, had a lot to do with that, right? And I know Dr. Fleming likes to talk about Galileo. Galileo, I think, is the one who invented the telescope. Someone correct me if I'm wrong. Galileo created a lot of cool stuff. Helicopter, form of airplane, I think, too. Form of the airplane. But the dude cataloged the human anatomy. I mean, he's just an extremely interesting genius. Point being, through time, scientists have continued to be proved wrong. And even to this day, we still believe, I believe, that there are 9 planets, and potentially there is a planet on a 3,600 year orbit. Is it 3,600 or 3,400 years? Somebody let me know. Anunnaki. That's right. 3,400 years, I think, right? Or is it 36? No, I think it's 36. Somebody fill me in here. This has been about 6 years since I've seen this, guys. That's how much of an impression it had on me. Every 3,400 or every 3,600 years, Nibiru, Planet X, its orbit is close enough for it to make a journey or to take a journey from there to the planet Earth. I don't know if it's to exchange minerals, if it's to procreate, who knows. But this is the story that I've been told. At some point, this thing's going to be in range. There's someone, it's not on anybody's radar yet except for my man Planet X, Scott, right? Is that what we're talking about here? Is Scott the only one who knows where it is? But Anunnaki. Now, this is a story in itself. Everyone thinks it means giants, right? It's not giants. What did Zachariah say? Again, it wasn't about them being giants. It's about those from above, those that come from above, right? Anunnaki means really those who have come from above. So think about it. Everybody thinks, that these are giants. Nobody's ever found giant bones, so we know it's not that. Those who come from above. We've been visited throughout time. I always thought it was quite interesting that you had Roswell, and then immediately we had microwave ovens and all these crazy things and televisions and microchips. It's pretty clear. It's pretty clear that we've just been reverse engineering everything. And it's like everything else in life. People see something and they steal it. We're the worst. We're stealing from freaking aliens. I can almost see like a group. Oh, freaking Max. I can almost see a group of people that are specifically looking for alien ships so they could find the newest tech. Are you kidding me? It's freaking 250, dude. 251. Get it right. All right, guys, we've been live for 5 hours, 46 minutes, and 54 seconds. And I'm not done yet. 3,600 years, Sigger said. Sig, you rock, buddy. And the bottom line is, I hope we are here when it finds. So I haven't had a chance to catch up on Scott's page yet. How far is this thing away? What's the theory or thought process right now on how far it is from us? Because I'd be down with taking a trip there. Let's do a real talk show from Nibiru.
Ladies and gentlemen, Hammerlin.
Uh-oh, yeah, Max is crying. Okay, let me put on a clip for you guys so I can go up and walk him, okay? Here we go. My wife is sending me messages. Let me give you a long one here for a second just so I can go and I'll come right back, okay? Oh, here's the Don Lemon clip. You guys are going to love this. This is going to blow your mind. How sour is that Don Lemon?
Hammerlin Jameson live from the studio. Donald Trump is back with episode 10. How sour is that Don Lemon?
Thank you for joining me on episode 10 of the Donald Trump Show. That's right. Today, we're going to continue our journey, destroying fake news. Today, we're going to look at CNN. Don Lemon. That's right, we call him Con Lemonhead here, but I have an old clip that came across my desk I wanted to share with you guys. So give me your perspectives, okay? Take a look at this.
It got some, many on the political right, wondering why the so-called liberal media wasn't talking about other problems in the black community.
That's interesting, Lemon. Why? Why would you say? This is 2013, by the way.
The outrage that I have is in the lack of really the national attention to what is an epidemic of crime in the black community, committed largely by blacks.
These are the same stats we're talking about now, and everyone calls us racist for bringing up.
Why aren't we talking about it? Good question. Actually, that's not a good question. We've talked about it many times on this show.
You have?
And on CNN.
You see, he could tell he was lying because he took a longer breath.
So that's the reason I didn't want to discuss at length crime in the African-American community or how to fix other ills that seem to be plaguing the community in general. But now that the jury has reached its verdict, one that everyone must accept, it's time now for some tough love on the subject.
Some tough love from the lemon. Sounds good to me.
Someone on another network got the chance to go first because I couldn't go during the week. I'm only here on the weekend, so listen to this.
The reason there is so much violence and chaos is the disintegration of the African American family.
He's got a point.
He does?
In fact, he's got more than a point.
Wow. Don Lemon agrees with Bill O'Reilly. Who knew that was coming?
Drugs hustling gangs. Nobody forces them to do that. Again, it is a personal decision.
He is right about that too. But in my estimation, he doesn't go far enough.
Oh, Don Lemon's a mathematician now. Yes, I'd like to hear your estimation.
Black people, if you really want to fix the problem, here's just 5 things that you should think about doing.
Here we go. Con Lemonhead, 2013, 5 ways to fix the black community. Let's hear it.
Here's number 5. Pull up your pants.
Pants on the ground. Pants on the ground. Looking like a fool with your pants on the ground.
Number 4 now is the N-word.
Oh, my. Here we go.
I understand poetic license, but consider this. I hosted a special on the N-word, suggesting that black people stop using it, and that entertainers stop deluding yourselves or themselves and others that you're somehow taking the word back.
I am curious what people think of that comment.
A lot of African Americans took offense to that too.
Oh, he answered it.
Now number 3, respect where you live.
Is this a special message to the people in Chippy, Chaz? What are they calling themselves this week? I think it's a message to Chap.
Start small by not dropping trash, littering in your own communities.
Imagine if they played this over the loudspeakers in Chap.
I've lived in several predominantly white neighborhoods in my life. I rarely, if ever, witness people littering.
Here comes a cheap shot at his community.
I live in Harlem now. It's an historically black neighborhood. Every single day I see adults and children dropping their trash on the ground when a garbage can is just feet away.
Wow, stereotype much?
Just being honest here.
Interesting. When did you decide to get rid of the honesty policy, Lemon?
Number 2, finish school. You want to break the cycle of poverty? Stop telling kids they're acting white because they go to school or they speak proper English.
What Don Lemon is saying right now would be considered racist in 2020.
A high school dropout makes on average $19,000 a year.
Wait, a year?
A high school graduate makes $28,000 a year.
Just graduating, you make 33% more per year.
A college graduate makes $51,000 a year.
That stat is less impressive to me. It costs like $50,000 a year for college. A college graduate makes $51,000?
Over the course of a career, a college grad will make nearly $1 million more than a high school graduate. That's a lot of money.
Yes, $1 million is a lot of money. It's a lot of money to the people of the United States of America. Not so much for Trump. I've got billions, okay?
And number one, and probably the most important, just because you can have a baby, it doesn't mean you should.
Words you will never hear Don Lemonhead speak again.
Especially without planning for one or getting married first. More than 72% of children in the African American community are born out of wedlock. That means absent fathers.
Look, can't you see, this is the point. Nothing ever changes. It's always the same. It was 72% in 2013 when Obama was the president.
And the studies show that lack of a male role model is an express train right to prison. And the cycle continues.
Yesterday you saw that Sleep Sofa Joe was the one that put them in prison. And Don Lemon remarked how it's a problem in 2013 when Obama was in office. So what's the problem when Trump wants to fix it? Anybody? Bueller?
Pay attention to and think about what has been presented in recent history as acceptable behavior.
Is rioting in the streets acceptable behavior? It's a good question, Don Lemonhead. What do you think we should do, Don?
Pay close attention to the hip-hop and rap culture that many of you embrace.
I embrace the Sugar Hill Gang. To the hip-hop, to hibbity-hibbity-hibbity, hip-hop, to toppity, don't stop. The boogie-boogie, bang-bang, sugity-bug-bug.
A culture that glorifies everything I just mentioned, thug and reprehensible behavior. A culture that is making a lot of people rich, just not you.
The time CNN spoke the truth. Wow, it's almost surreal, right? It's surreal to see CNN speaking truth. I kind of like it. How do we get them to speak the truth always? So what happened to Don Lemon in 2020?
This is the thing, Don. You know, black people need to hold other black people accountable.
Okay, before we get started, that's what Don Lemonhead was doing in the 2013 clip we started with. Okay, watch.
I said this the same thing. This is the Black America's version of the Me Too movement. If anything is going to change, we ourselves need to look at our own communities and look at each other and say, this thing cannot go down.
I'm sorry, isn't that exactly what Don said?
And then this is what I'm saying. It's about who is controlling the narrative. It's got to be all Black Lives Matter.
That sounds right. What does Don have to say?
Here's what I have to say.
All right, Spin Doctor. Let's see what you got here.
The Black Lives Matter movement was started because it was talking about police brutality. If you want an all Black Lives Matter movement that talks about gun violence in communities, including, black communities, then start that movement with that name. But that's not what Black Lives Matter is about.
I'm soured by the hypocrisy. It's like eating a lemon. Oh.
So if you're talking about, if someone started a movement that said, cancer matters, and then someone comes in and says, why aren't you talking about HIV? It's not the same thing. We're talking about cancer.
I think Lemonhead doesn't grasp the concept of apples and oranges. If it's 100 people and you're there for all cancer matters, then it would be somebody who stands up and said, I have prostate cancer. And they would say, sit down, buddy. We just said all cancer matters.
So the Black Lives Matter movement is about police brutality and injustice in that manner, not about what's happening in black neighborhoods. There are people who are working on that issue, and if you want to start that issue, why don't you start it?
We have a hypocrite warning.
It is about police brutality. That should never be accepted. Yeah. I am not saying that that's not it, but there's more there. And when I look at, if they have more on their agenda, we need to ask them about what else is on that agenda.
Don't you just love how uncomfortable Terry Crews made Don Lemonhead? It was hilarious. You could see he got very uncomfortable when he realized he couldn't control Terry Crews. I wonder, could we get Terry Crews on the Trump team? We should look into it. Look, I will see you tomorrow on the next Trump show. Have a good night.
All right, where are we now? Am I with you? Can you guys hear me? Holy cow. Let's see, I'm watching how long. Okay, I'm still here with you. So look, guys, we're at 5 hours, 59 minutes. Can you believe it? In 1 minute, we hit my first 6-hour show ever. You guys are on for the first 6-hour Real Talk ever. How insane is that? 6 freaking hours? Anon, you out of here, buddy? Oh, my brother Anon. Dude, so glad. I look forward to seeing you hopefully tomorrow. Tomorrow night I'm rocking through all the episodes. I'll start probably around... I'm going to try to go on a little earlier tomorrow, guys. Hopefully you get the notifications probably around 6:30. I want to get on and grok out early, okay? So it's going to be about a 4-hour show tomorrow night as well, so pop on. Daryl, I got to thank you, brother. And so, I was reading this. Well, sorry, it was while I was getting Max going. Let me go back over these comments you guys said. So I was going to ask you something, Sig. You said something about the sun being a gateway. Let me go back and see what I have here. Let me see. Sig said you helped him. Okay, I saw that. Oh, yeah. Yeah, Sig, you rock for getting Scott helped a brother out. Communist Network News, that's for sure. Let's see. Okay, so Anon unfortunately has to leave, but Daryl's with us still. California fires were started with dews. Oh, guys, I saw something crazy the other day. It was about the Building 7 from the World Trade Center. And that was brought down purposely. The guy even said it. The guy was like the lease owner. He was like, yeah, we watched it fall down. They took it down. Like, that was real right there. Oh, Nana's driving. Where are you, buddy? Because right now, where I am, it's 3:05 in the morning. And we've been officially live for 6 hours and 1 minute. Can't believe I did a 6-hour freaking show. This is insanity. But listen, guys, it's 3:05 in the morning here. Tomorrow, we will be live for the full rendition of the Donald Trump Show. Every episode, back to back. Daryl, you rock. Sig, you rock. Anon, you rock. Denise, everybody else who stuck around with me till the end. You're my people. This is the Real Talk family. Tomorrow, we gather again. Dagger, anybody else who's on, say hello. I'm peacing out. Sig, my brother. 6 hours, 2-minute show. Dr. Fleming brought it, and then I had to do another 2 hours myself. Holy cow. Tomorrow, send your requests I'll play some songs too. Why the heck not? It's Mark Pires. And it's real talk. Have a great night. See you tomorrow, fam.